Call the meeting to order for the for the afternoon of May 19th, 2020. And Tony, could you please call the roll?
Jimenez, I think he's over as an attendee. By the way, I'm just waiting to confirm before I move him over to panelist. So this is here. Perales?
Here.
Yep. Roscoe?
Here.
Davis?
Here.
Esparza?
Here.
Arenas? Foley?
Here.
Camus?
Here.
Jones?
Here.
Licardo?
Present. Thank you, everyone. Please rise if you're able to the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America
and to the republic
Which it stands, one nation,
under
God,
indivisible, with liberty and justice for all.
Thank you, everyone. Councilman Carrasco, would you like to provide an invocation?
Hi, thank you, Mayor, and thank you for indulging me in a couple of moments before we get started. In honor of this week is being recognized as Mental Health Awareness Week, and I thought it was very apropos given the number of weeks that we've been sheltering in place, and we're hearing from throughout the city and county that individuals are having a little bit of a rough time, confronting all of the numerous issues, and especially as they're confronting the four walls of their shelter. So I'm one of them. I thought it was nice of the temple that I'm going to be reading some of their words of wisdom. They serve my district. It's the Wat Khmer Kampucha Kram Temple, which has been serving my district for over 30 years. They seek to share the Buddhist teachings and practice. They teach and promote Khmer, Khmer Kram arts, language, and culture to all those who are interested, and serve as pillars of the Khmer Kram community. They serve their members who have immigrated from Vietnam after being persecuted and displaced during the Vietnam War. Today, they celebrate their culture and faith by practicing Theravada Buddhism, which emphasizes attaining self-liberation through one's own efforts. Meditation and concentration are vital elements of the way to enlightenment. And today it's an honor of mine to be able to share a message of blessings of the Buddha for my fellow colleagues and members of the public. And this is a message from the Venerable Sadao Son. Here we go. In light of COVID-19 and the county's shelter-in-place orders, this has been a very difficult time for the community, causing suffering for many people and their families. But if we take this time to practice meditation and contemplate within ourselves, we can seek peace for our minds. The term body is the combination of mental and physical phenomena with reference to the Buddha's teaching. Since the body is the combination of mental and physical phenomena, happiness, peace, suffering, stress is the work of our mind and body. The mind plays a vital and essential role in all actions. Everything is created by the mind. If one acts with a good mind, happiness will follow him. But if one acts with a wicked mind, he will also get suffering. So our body is a place where he can create happiness and peace. Lord Buddha explained that a person could find the Four Noble Truths within oneself. Namely, 1, noble truths of suffering, 2, origins of suffering, 3, the end of suffering, and 4, path to lead. These 4 noble truths, when attained, will cease suffering in one's own body. To look for happiness and peace within ourselves and in the world means our body and mind becomes the only place to find it. There are two kinds of happiness: the happiness by attachment to the material pleasures and the happiness by detachment to the material pleasures. Happiness by detachment to material pleasures is the enlightened path to happiness, peace, and the end of suffering. The Buddha said in verse number 202, and excuse my botching of this, Nati Santi Param Sukham, which means no higher bliss than peace. And may we conclude our advice and practicing by hearing the Buddha's blessing to all members of the City Council and to all those that are joining us today. Kataro Dhamma Vadanti Ayu Vano Sakam Balam. Wishes from the Venerable Sadao Son. May you all attain the longevity. May you all be happy. May you all be healthy. May you all attain the ability to lead. May you all be free from suffering. May the power of triple trainings heal the world. Thank you.
Thank you, council member. On to orders of the day. Does anyone on the council have any changes to the printed agenda? I understand the administration would like to defer 8.1, which is Markham Terrace refinancing until June the 16th. And we understand that the CDLAC application has been postponed. There's some issues that need to be addressed on that. So that request for deferral. In addition, there's a new item amended 3.4, report on digital access and inclusion and amendment to the agreement with CETF for the Digital Inclusion Fund. That's going to be added under the orders of the day, requires a determination by 2/3 vote. So the maker of the motion would consider those.
So moved.
Second.
Thank you, Councilmember Davis, seconded by Vice Mayor. And Councilmember Davis, it includes those, the deferral and the inclusion of the amended item. Is that right?
That's correct.
Great. All in favor?
Aye.
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 Is there anyone opposed to the orders of the day? Okay, I'm not hearing any opposition, so that passes unanimously. Well, on the closed session report, Rick?
Mayor, council met in closed session this morning. There is no report.
Thank you. Item 3.1 is the report of the city manager. Hello, Dave.
Good afternoon. Thank you, Mayor. Thanks for this opportunity again. Start off by acknowledging some of the great work that's going on in the organization. The first team I want to recognize is our finance department team. As you all know, many of our workers here in City Hall are able to work from home, but much of the work that the city finance department does really require that the staff come into the office here at City Hall every day. So just want to acknowledge the great work in our accounts payable team, which facilitates timely and accurate payment of the city's disbursements. The payroll team, which continue to make sure we all get paid. And the investment team, which manages the city cash flow and invests city funds in accordance with our policy. So really appreciate the work of the finance department and the staff that are coming into City Hall every day to make sure that all this important work gets done. Next, I want to recognize an individual from Public Works. His name is Reggie Roberts. Many of you may know Reggie from being here in City Hall. Reggie's worked for the city since 1999 when he started out in the city's warehouse and then transitioned into the mailroom, the city's mailroom. You know, aside from always having a really good attitude and a great sense of humor, you know, his work in processing and receiving the city's mail has been really essential for us keeping things going here in terms of our city operations. And in addition, Reggie's taken on additional duties that of taking on the bids that come in from vendors so that we can accept those bids formally. Reggie's taken that work on to make sure that our especially our public works projects can continue on in the process. So really thank you to Reggie for coming in, doing that work, and then taking on additional responsibilities to make sure things keep happening. Okay, I'm going to get into the update, the COVID update. And so just give a little bit of an outline on what you're going to be hearing from us. First, Kip will give an update and really a report out on kind of where we're at with testing, tracing, and supported isolation. These are issues that we've been talking with and working with the county for some time now. These are also issues that are highlighted in the mayor's back to work memo, and how we focus our efforts in this area will be hugely important, to say the least, in terms of our success in recovery efforts and keeping people safe as we reopen the economy. Second, we'll have an update on the financial recovery from Lee, Luce, and Jim. I just want to stress that next week we will be issuing an MBA that recommends how we fold the recovery funding into our proposed budget. So that will be happening next week, and you'll be hearing more information today as we understand the current lay of the land. And then finally, Kim and Rosalind will be providing an update on development services and our progress with supporting the development community. Okay, so I'm going to pass it off to Kip to kick it off.
Thank you, Dave. Kip Harkness, Deputy City Manager, and on behalf of Lee Wilcox, my co-Emergency Operations Center Director, and the 631 people currently deployed in the Emergency Operations Center and supporting emergency operations in the field, I want to present this update as the City Manager has described. We do have a lot to get through, so I'll clip through a fair amount of material quite quickly. First thing is some good news about an updated county order, which broadens and allows retail in a limited form. What, when I was at PayPal, we used to call BOPIS, buy online, pick up in store. So you're now able to do curbside or outside pickup for retail, but customers are not allowed to enter the store as of, this will be effective 12:01 a.m. on Friday. Also, businesses that support retail can resume operations. That's very narrowly tailored to include those that are manufacturing goods directly for those retail stores and businesses that provide warehousing and distribution services. In addition, outdoor museums, historical sites, and publicly accessible gardens can reopen, as well as car parades are now allowed as long as participants ride with the same household and do not stop to gather. Finally, the social distancing protocols have been updated, clarified to include the California requirements and requirements for training of businesses. I think, Mr. Mayor, I think your mic is still on.
Please forgive me. I'm sorry.
No problem. Starting with principles, our recovery principles, as always, are to be compassionate in action, to be open, candid, and direct, and to be one team. And the work that you're going to hear tries to embody each of those. So each of these is an aspirational, not a goal of perfection. As always, we are guided by our roadmap, which focuses us from the myriad of interesting things that we might do to the vital few. And with that focus on the roadmap, in the last week, we have delivered 2.75 million meals with our community partners. We are bringing together and bringing forward an item on the city-county food agreement for your approval later in this afternoon. We have activated a number of testing sites, including the PAL testing site, which we'll hear more about. We've launched a virtual community engagement branch to begin to make sure that throughout the recovery, we can engage our community more robustly. And we continue to shelter many of our individuals who need support in hotels and motels, as well as safe sheltering facilities. So as mentioned, I wanted to go a little more deeply into testing, tracing, and supported isolation. These three services are all led by the county. And so what I'm really doing here is describing a county role and that they lead and our role as a city in supporting them. The reason that these three services are important is they're absolutely critical to us coming out of the shelter in place. So we don't know what's going to happen next. There are three scenarios that I think help us think about that sort of in priority order, if you will. Priority number one, or the first scenario, would be this notion of a slow burn, which is we've brought the cases down and that we continue to keep them down. And in order to do that, we're going to need testing to see where we are, tracing to make sure that it's not getting out of control, and supported isolation to make sure that those people who can isolate can do so safely. If we're not able to do that, we'll start to see an uptick And we'll start to see scenario 2, the sort of peaks and valleys where we see an uptick in the number of cases and the number of deaths, and then we have to maybe take a little more restrictive action to bring them back down. The worst case scenario, and the one that we most want to avoid, is number 3, where we lose control and there is the big surge in cases that we have been working so hard to avoid. The danger and the timing of this is uncertain, but the most likely timing is in fall. Coronaviruses, which this is, and influenza typically follow a bit of a cyclical and a seasonal pattern. So if this coronavirus is like others, it might give us a little bit of a break over the summer, but it also might come back strong in the fall and winter. And it would come back at exactly the same time that the normal flu season returns. And to give you a sense of what that means, during a normal flu season, our hospital system is at 90% capacity. So if this were to come back on top of the normal seasonal flu or even a bad year of flu, we would be in a really tough situation. And likely whatever progress we'd made would have to slip back into full-on sheltering in place. So the idea is that we want something more like scenario 1, and that testing, tracing, and supported isolation are required in order for us to stay in that scenario. So let's dive a little bit into those 3. What I'd want to do is I want to take each one in turn, describe what it is, what the county's measure of their success is, where they are, and then just talk a little bit about the potential role that the city might play in each one, realizing that that is all to be determined and part of ongoing conversations between us and the county. But we wanted to make sure that council was both informed and had the opportunity to discuss so that that can inform our collaboration with the county. So testing, broadly speaking, there are 2 types of tests: diagnostic tests and serological or antibody tests. The diagnostic tests are ones that will tell you if you currently have the infection. The main form of this is what's called a PCR test, or a polymerase chain reaction, which amplifies the presence of the RNA, the virus itself, in order to detect the presence of the virus. And you can see a kind of a cool chart off to the side that walks you through the steps. Anybody who's done the old school replication and amplification of DNA or RNA samples knows that this has gotten increasingly sophisticated over the years. But this, you have to actually have the virus in you. You have to be infectious or near infectious for these tests to work. The other one is a serological test, which tells you if you've developed the antibodies in reaction to having had the virus at some point in the past. These are useful to determine people who are previously infected, but no longer infectious or no longer have the virus present. One thing I want to be clear on is that in many diseases, having had the disease conveys immunity. We believe that is the case with COVID, but the amount and the duration and the degree of the immunity is very much unknown at this point. So a serological test does not sort of give you an immunity pass to go out back into the world as it was before. So that's testing. Where we are at as a county is our kind of first hurdle that the county has set for themselves is they want to get to about 200 tests per 1,000 people, per 100,000 people per day. That's not the absolute number. That's sort of the first threshold that they want to get to feel like they have a good ability to survey and understand what's going on. Because we know that the testing that's going on now is not keeping up with the actual virus as it's circulating. So right now we are about at 100 tests per day per 100,000 people. So about halfway to that initial mark that the county has set for themselves. Eventually, people are talking, so that's about 4,000 tests a day is what we're aspirationally getting for the county. Eventually, some people are talking about, like Dr. Sarah Cody and Dr. Marty Finsterscheib, wanting to be able to get up into the 13,000 to 15,000 to 20,000 tests a day to really be able to get a sense of what's going on. But clearly, there's a long way to go before that point. Dr. Marty Finsterscheib has released, who is taking a lead role now in testing, has released an initial set of recommendations around frequency of testing. And bottom line, what you can see here is it recommends fairly frequent testing of people who are out, especially in higher risk professions, such as the skilled nursing facilities or within the shelters, and making sure that all of this testing is available on a regular and frequent basis for all of these key groups. So one of the things that we as a city have done is identified a site for the Verily testing, which is now both at the fairgrounds and at the Palace Stadium on the east side. Here's the initial data from that testing site. And it shows that we are beginning to test approximately hitting above, slightly below the 200 tests a day mark. So the total data that I've just got updated as of yesterday is we've completed actually 1,480 tests total. And we are set at about 250 people to be seen or tested each day. It's going up. The site's current capacity is at about 300 daily. Verily has let us know if we hit that capacity, they can probably double that to about 600 a day. So our goal is to try to drive traffic and to support the county in driving traffic to increase the utilization of this important site. So in addition, the county is the lead on sites. The county is also undertaking work on ease of use, and the county is also the lead on outreach. We have offered support in site identification, especially to make sure that they're getting into all of the areas of our community that have need. And in the case of the Verily site, we've taken over traffic management, though that was technically a county obligation under the contract. In terms of ease of use, the county has not asked for our support. We believe we could assist in making the user experience better and perhaps improving the registration process, but they have not requested that. And then on outreach, we are doing some additional community engagement, but again, are asking to collaborate more tightly in the development and rollout of an overall engagement strategy that works for all of our community. So let's take a look at the next one, tracing. Tracing is, our contact tracing is really identifying everybody who's come into contact with somebody who has tested positive for COVID-19. Ideally, those people would then self-isolate, quarantine themselves, technically speaking, and monitor for symptoms. And if they test positive, that process would continue on down the chain. So you see here, individual A has been going to home, taking the bus to work, and been coming back to home. He's been close to people at work and on the bus. And then after 5 days in this scenario, they test positive. And so what contact tracing does is goes back and gets in touch with everybody at the home, ideally on the business and train, and you can see how difficult this is, those who are close at work, and it contacts them and has them isolate. And then ideally does a second level of contacting everybody who was contacting. And in the most aggressive version, does a third tier and notifying the third tier people who were contacted by the people who were contacted. As you can see from the math of doing this for just one person, in the ideal, this is very, very complicated, very, very labor intensive, and very, very data intensive. So to have a good tracing capability is core to the public health response of containment and not going back into either a full-on epidemic or having to return into shelter in place. So by the county's own criteria, they want to be able to do this with at least 90% of the cases, ensure that 90% of the people that they reach out to within those cases are able to isolate, and that 90% of the people contacted are identified, and 90% of the identified contacts can safely quarantine. So it's sort of making sure that they're getting a high level of effectiveness on tracing. They'd like to do this for at least 70 cases. I suspect that number would be higher in their ideal, but that's their threshold. Currently, they're able to do it for about 25 cases a day. So about 1/3 of the way to where they need to be in order to feel like they've got this completely to the point where we could come out of shelter in place. So the county has asked for our assistance in this, and they have asked for our assistance in the form of providing personnel who have qualifications, ideally both in data analytics and medical terminology, as well as language competency and cultural competency, with a specific focus on Spanish, Vietnamese, and Chinese. They need, as an initial estimate on their side, a total of 680 case investigators, and have asked each of the cities to provide as many people as possible to help them get to this number of 680. I wanted to lay out for you next 3 options that we are discussing and evaluating on how to respond to this need and to respond to this letter in terms of the county's request for city to loan tracing staff. The first is obviously to send them the city staff they've requested. In that case, the city would identify and reassign staff matching the technical and language qualifications. The county would train the staff in contact tracing and the necessary business processes, and then they would be on a tour of duty as contact tracers for 6 to 12 months. In this scenario, the city would continue to pay the salary and benefits for those employees, and they would be loaned or seconded over to the county for the duration. So evaluating this scenario along 4 criteria, the effectiveness is okay. We estimate there are probably 20 individuals, many of them in the library system and part-timers who might fit with these requirements. Most of the other folks who fit with the requirements, and there are a number, are either in police and fire and fully deployed, or in other departments working on core essential services and not available for redeployment. The cost would be high because we would have to continue to pay those individuals at full cost, and that cost would not necessarily be reimbursable for us as a city. The opportunity cost, which is what we would have to forego in order to do this, is also meaningful, significant, because it would just require us sending that staff over and not having them available for things like, for example, deployment on food or homeless response, other areas that we have been redeploying staff to. In terms of job creation, which is a category that has been mentioned several times by the mayor and many council members, this would do nothing on the job creation side since all of those people technically are employed. So second option that we've created and want to explore is the idea of creating a volunteer tracing corps. As somebody who was a Peace Corps volunteer, Peace Corps trainer, and has worked with AmeriCorps and City Year over the years, the idea is to sort of take that model and build it out locally, either by working with a nonprofit like City Year or by creating a similar approach. In this, we would recruit focusing on recent grads, unemployed, and retirees. Those folks would undergo an intensive short-term training, both in contact tracing, building them up as a team, cultural sensitivity, and medical language where they needed the specific terminology in the language, hopefully, that they already spoke. Again, Spanish, Vietnamese, and Chinese being the highest priorities. They would then sign on for a 12-month, probably renewable tour of duty, and typically, as is the case, receive a modest stipend, some healthcare guarantees, and modest housing or a housing stipend. From this, we think this could be very effective. There are a lot of people in the recent grad, unemployed, and retiree area that have the qualifications around data, medical language understanding, and the language pieces. The cost would be lower for us, we believe, because this would be a lower salary than typically we're paying to a full-time, fully benefited city employee. The opportunity cost is still there. It takes a lot of work to put together and run a program like that, and the effort doing that means we're not doing other things. And it's kind of a green light, we think, on job creation, because by definition, a lot of the folks we're pulling in would have this opportunity to work and have something to add on to their resume, especially for the recent grads. Third option is more of a matching option where we connect community to tracing jobs. So in this scenario, Work to Future and other organizations would recruit from among the unfortunately large number of unemployed and underemployed people. We would do some initial preparation and screening to get them ready to interview. The county would then interview and hire the most qualified candidates. The county would undertake the training, and in a temporary position probably would keep them assigned to the contact tracing work as long as needed. From the city's perspective, this has a high level of effectiveness because you can recruit exactly the people that you need. The cost is moderate because, again, we're already doing a lot of this work through Work to Future, and the salaries would be lower than the city staff. Opportunity cost is smaller, again, because we are already doing this kind of work with Work to Future. And again, the opportunity for job creation is inherent in this approach. So these three approaches, we think, are ones that we'd like to discuss, both with you all and with the county, in terms of responding to the very felt need to provide a more robust capability in tracing at the county level in fulfillment of the county's responsibility. So tracing at scale, we see the county continuing to lead in recruitment, training, management, and funding. They've requested us as staff, which I've outlined 3 ways that we might respond. In terms of process, they're creating case investigation protocol and supporting business processes. They have not asked for our help in that. They're also doing data collection and tracing technology. We have offered, but they have not asked for our help in that. There's an awful lot of work in both the process and technology area that needs to complement the people work in order to be able to scale. And we'll have, let's see. Last one is supported isolation. And this is the idea that people who have COVID can't be sent back to a crowded home, or in some cases can't take care of themselves, or in some cases don't have a home to go back to. So we've already doing this, and Jackie Morales-Ferrand and her team are working with this with a particular focus on unsheltered individuals in collaboration with Key Lee and the county. But the idea that anyone who needs supported isolation should be able to have it either in a motel, in the trailer facilities we've opened up, or others. In addition to housing, we believe there's a wraparound need for cash assistance, access to phone and internet, potentially childcare, food, medical care, and social and language support. So to give you a sense of where we are, we have about 550 people who've already fit into this category over the course of the epidemic that we've helped place and then support in collaboration with the county. And in addition to, of course, the sheltering work that we've done to meet the unsheltered needs. So with this, the county is very much in the lead again. We've been partnering on housing. In terms of food, at the request of the county, we have been taking the lead. You'll hear more about that in an item later. And then in others, it's a partnership between us with the county, obviously as a social service provider, and the medical and health provider in the lead on both of those. But we have been supporting with rental assistance in many cases. So our proposal as we're going forward and beginning our conversations with the county is that we work as one team. And we believe the way to do that is through the emergency management approach of what's called a multi-agency coordination group, where the principals come together at a leadership level, debate and decide, and set the direction for the team. And we believe that testing, tracing, and supported isolation are not three things that happen independently or things that we are just simply silent partners on, but things that we need to help set the course, especially since we have over half the population of the county here in San Jose and a disproportionate share of the impact of this disease. So that is our starting point for our discussions with the county in this extremely critical area of testing, tracing, and supported isolation. So with that, our two key questions that we go forward with in this conversation with the county are: how do we create a one-team approach? And what is the best way for the city to support the county, especially as it scales tracing? So with that, I'm going to turn it over to Lee, who is going to take us through the presentation on the COVID-19 financial recovery. Lee, all you.
Thanks, Kip. Can you go to the next slide, please? Just want to remind everyone that our financial recovery is threefold. First, that we'll continue to do recovery right by focusing on our most vulnerable and at-risk populations throughout the COVID-19 response. We'll continue to maximize our reimbursement approach by matching all of our federal and state funds to our response through clear documentation processes so that we don't lose out on any potential reimbursements along the way. And both of those will help ensure that we minimize our any potential impacts to our city's general fund. Next slide. And I'm going to hand it off to Luz to walk through the initial use strategy and update on our budgetary work before I hand it back over to myself and Jim Shannon to talk about the Coronavirus Relief Fund and aligning it with our budget process.
All right, good afternoon, council members, mayor. Last week, you saw this slide for the first time, and we presented an initial use strategy that contemplated needs for COVID-19 related response and recovery activities through the end of the 2020 calendar year. Since then, we have refined some of our estimates and fully expect to continue to refine these numbers as we get a better picture of what is needed as the city moves from response to recovery. So one, we have increased estimates for personal protective equipment, that's PP&E, as the county shelter-in-place restrictions ease and the city begins to return to some sort of normal under social distancing protocols. Two, we have increased estimates for consulting and support as we will need expert advice to guide the city through the response to and recovery from COVID-19. And three, we have decreased our estimates for food distribution. What we're looking at here is how the need for food distribution will decrease as individuals return to work, move into longer-term feeding programs such as WIC, CalFresh or SNAP, as it's sometimes known, the unhoused, and senior nutrition programs. The food distribution numbers are some that especially will continue to be examined closely and further refined. And yes, I know I've used the word refined 3 times, but we are really refining these numbers. Next slide, please. I do need to remind everybody that all these estimates are evolving as how we need to respond to the crisis as the crisis moves from the intensity of the first few weeks to now a sort of more baseline process, I guess I would say. And as the city gets additional clarification around FEMA reimbursement, other CARES 3.0 initiatives, and future stimulus and or relief programs from the federal and state governments. This is also a slide that you saw last time, and the city is continuing to build its citywide strategic funding plan. Staff is convening a citywide grants planning group, which is made up of department representatives who are all pursuing funding through the various avenues that have opened up to address the challenges of the COVID-19 event. Monies are coming at us from all over the place, not just through the federal government, but state funding as well. We have seen the $178 million in coronavirus relief funds that was deposited directly into city coffers late last month. Lee provided a high-level overview of that particular funding source at last week's 3.1, and in a few moments, Lee will be delving deeper into the CRF monies, including the timeline to spend, the key challenges, and what limited guidance has already been provided for this particular color of money. The city has also received supplemental funding through several of the usual programs that the city manages, such as $8.2 million from the HUD Office of Community and Development Formula Programs, including the familiar Community Development Block Grants, that's CDBG, Emergency Solutions Grants, that's ESG, and Housing Opportunities for People with AIDS, that's HOPWA. These federal funds, matched with close to $27.8 million in state funding, will enable the city to enhance its wide spectrum of homeless initiatives that it currently is running. This council has already accepted these funds through budgetary actions over the past few weeks. Last, San Jose Airport has received a commitment of $65.6 million in economic relief. That's reimbursable money, funding that's coming through to the airport through the FAA CARES Airport program. We continue to get guidance and information on available funding, frankly, almost on a daily basis. With that, I'll turn it over to Lee, who will provide a primer on the Coronavirus Relief Fund.
Thanks, Luz. During last week's City Manager's Weekly Report out on this item, we reported out on the structure and the intent of the CARES Act, or more specifically, the Coronavirus Relief Fund. The council had several questions regarding this fund to help close budgetary shortfalls through our budget study sessions last week as well. So we were going to update the council on where we're at with this analysis, and then I'll hand it over to Jim to show how we're going to bring this into the city's budget process, as Dave had mentioned. It's important to note that the Department of Treasury, as we indicated last week, dispersed these funds to us. They issued guidance for state, territorial, local, and tribal governments on April 22nd, well after we received our additional funding. In addition, the Department of Treasury also issued on May 4th answers to frequently asked questions that state and local governments and tribal governments have been able to submit over the first few weeks. While it's important to know that as we've stated before, the Coronavirus Relief Fund is prohibited for any government backfilling revenue losses, it does allow a government to support its own costs associated with responding to the public health emergency, or in essence, absorbing some of the payroll that has been associated with the disaster. Our challenge over the last few days is narrowing to an overall spending plan, which is just what Luz mentioned, but also how we continue to support our response as we build out this budget. I do, as we move forward, additional clarity is going to be important from the Department of Treasury so that we can make the right decisions and really ensure that we are in a position when we recommend things to you to not impact our general fund in a negative manner. However, I do want the council and our workforce to know that we are aggressively working with our partners in other cities and our federal lobbyists to ensure that we have this clarification as we move forward. Next slide, please. Just as a primer, before I hand it over to Jim, The CARES Act, which is what the Coronavirus Relief Fund is in, it provides that payments from the CRF may only be used to cover costs that are necessary expenditures due to the public health emergency with respect to COVID-19. Were not accounted for in the budget most recently approved as of March 27th for a state or local government, and were incurred during the period of March 1 and ending through this year. So we would actually need to spend CARES Act dollars before the end of this calendar year. Specifically with the payroll expense or guidance that I mentioned, it states that payroll expenses for public safety, public health, healthcare, human services, or similar employees whose services are substantially dedicated to mitigating or responding to the COVID-19 public health emergency is deemed an eligible expenditure. Uh, like us, many other government entities had asked questions about this payroll provision, seeking the additional clarification. And the May 4th FAQs, most of those questions were really dominated by this language. So just so I can read to the council with a specific question, how does a government determine whether a payroll expense for a given employee is satisfied by the substantially dedicated condition? In their response, the Department of Treasury responded that the fund is designed to provide ready funding to address unforeseen financial needs and risks created by COVID-19 public health emergency. For this reason, and as a matter of administrative convenience, in light of the emergency nature of this program, a state, territory, local, or tribal government may presume that payroll costs for public health and public safety employees are payments for services substantially dedicated to mitigating or responding to the COVID public health emergency, unless the chief executive or for the relevant government determines that a specific set of circumstances indicates otherwise. While it is our intention to exercise this payroll function within the Coronavirus Relief Fund, how we do this is still yet to be determined. The administration, as well as the council, did receive a letter from the Police Officers Association highlighting new language that I just highlighted to you. And we will be meeting with our federal lobbyist and other cities, as we have been over the weekend, to get additional clarity. In addition, the administration will be meeting with the Police Officers Association this week and take their analysis and what we're learning from other cities into our own analysis as we recommend how we bring this money or these funds into the budget process. In addition to this option outlined in that letter, the administration has also been tracking all COVID-related time for all employees throughout the city since March 1st. Working with our emergency management consultants on preparing this documentation process for not only FEMA reimbursement, but also the other funding pots, like the Coronavirus Relief Fund, the administration is now refining numbers on what the city's weekly payroll is related to the COVID crisis. This option would also allow the city to charge the Coronavirus Relief Fund for past and future payroll expenses through the end of the year as it relates to COVID-19. So the administration will continue to analyze this fund and build in that analysis into the MBA that Dave mentioned. And to outline that process and how we will bring it into the budget process, I'll hand it over to Jim Shannon.
Great, thank you, Lee. Good afternoon, Mayor, members of the City Council. Jim Shannon, the city's budget director. So last week we reviewed the proposed operating budget and had some study sessions looking at the budget, and we knew at that time that the budget did not include specific costs or funding sources related to the city's response to the pandemic, but knew that we would be coming back as part of as the budget process continued all the way through to budget adoption in the middle of June. So we did, though, last week on May 12th, we did establish the Coronavirus Relief Fund. And so, as we've talked about, that fund is one of our most flexible uses to make sure that we can do the recovery right. Aside from the general fund, the Coronavirus Relief Fund probably has the least amount of restrictions and sort of broad categories of use. And so we want to make sure that we're maximizing the use of that fund to do our response right. And so we want to be really careful about how we program funds there. For the moment, though, we have allocated, council has appropriated $45 million of the initial $178 million. And that was primarily to fund sort of to see the initial response for things like food distribution, PPE, and some sheltering costs. So that amount will grow. You know, it's as the slide that Lou's produced or talked about a few moments ago. There's a lot of other costs that we're still working through that this fund will help pay for, as well as other sources like FEMA. But so just this is where we are right at this moment of what's currently budgeted in 1920 as we newly established that fund. As we go forward, though, we will be looking to recommend that coronavirus relief fund is used as much as we possibly can to offset those costs of the city that were currently budgeted but were had to be redirected toward that response effort. Next slide, please. So our next steps then, now that we have the fund established, is actually folding it into the budget process. So we're going to make sure that we continue to refine our cost estimates to make sure that we're aligning our response with those costs that are most appropriate. So that spider web of arrows that Luz was pointing at earlier, so that's part of our process. But we are putting them out of budget, and so we need to make a call. And so part of making a call is our intent is that on May 27th, we would issue an MBA that would do a few things. So one of them would be to estimate the response activities funded by the CRF through December 2020. It will not be the final estimate, likely, because things, conditions will change. But for budgetary purposes, we need to make a call as to what we think our total response effort will be from March 1st to December 20th, or to December 30th for this calendar year. We would be incorporating that, the CRF into the budget document. We would be recognizing any general fund savings due to reimbursement by the CRF for existing resources that have been redeployed to response efforts. And then also in that MBA, we would identify any of those general fund savings to be set aside as a reserve for future use, or potentially to restore some of the one-time funding that is currently considered for elimination or reduction in the existing proposed budget. I think if we had, in an ideal world, these two things don't move separately. They would be as part of one package. But we know that every day, matters in this pandemic. Every day brings us new information as the status of the pandemic, new information as to the status and the need of our response, as well as to the city's budgetary outlook. So every day, we're getting new information about what our budgetary position is going to be. And so all that matters. So as we had the budget that was released last week, looked at what we had to do to have a balanced budget and to get at some of those ongoing reductions that are going to be necessary as we move through these next few fiscal years. And we can now pivot to making sure that we're addressing appropriately as part of the budget the city's response costs, and making sure that we are appropriately reimbursed for the costs that are eligible to be reimbursed for. So I'll be around later on for questions, but I think now I'm going to turn it over to Rosalind and Kim to talk about development services.
Great, thank you, Jim. Kip, you can go to the next slide. Thank you. So we're here today to provide some updates on our development services activities during COVID-19. So we have information both on our planning as well as building services. So I'm going to start with our planning activity. And as this slide shows, during the 8-week period from March 16th through May 8th, we've actually had almost 200 new planning applications submitted. Normally, on average, we receive about 30 to 35 new applications per week. So we're about 64-65% of our normal volume. In regards to planning permits that have been approved, and these would have been approved either administratively or at director's hearing, at planning commission, or at city council, we've had over 100 of those planning permits approved. And I did just want to take the time to highlight two very important projects that were recently approved. First is the Meridian Affordable Housing Apartment Project that Planning Commission approved on April 8th and the City Council approved on April 28th. And then next down the pike is the Tamian Station Residential Project, which the Planning Commission has recommended approval at its meeting last week. And this project will be coming to City Council for its consideration on June 9th. So I think it's pretty impressive that even during shelter in place that the city has actually approved 850 residential units. Next slide, Kip. So regarding our building permit activity, I actually want to share three different pieces of information. So first, I want to talk about just the volume of our building permits. Then I'll be talking about our strategy to address the building inspection backlog that I shared with the council a few weeks ago. And then lastly, I'll share about our current daily inspection counts. Since the county order has been revised and our inspectors are now able to inspect all construction projects. So first regarding our building permit activity, so the top half of this slide will show the activity that is ongoing through our virtual permit center. So our staff in the permit center continue to work remotely. However, we're able to continue to take permit applications. And during this 8-week time, we have taken in 300 new permit applications, and we've actually issued nearly 1,000 building permit applications. So we're really glad that we're able to continue to assist our customers there. The bottom half of this graph shows our building plan reviews that staff has been able to complete also during this 8-week period. And that figure is nearly 1,000. I do want to point out, you can see on the graph that there was a dip between March 30th and April 10th. And this was the period of time when our plan reviewers actually shifted their focus on residential projects because it was at that time of the county order that construction could continue or on affordable housing projects. And we find that the reviews of those construction projects, residential, some of them are high rise, actually takes longer for staff to complete their reviews. So that's why you'll see a slight dip there. But as you can see, in the last couple of weeks, we have ramped back up and continuing to process building plan reviews. Next slide. So I shared with the council a few weeks ago about our strategy to attack those building inspection appointments that were canceled early on when shelter in place took effect. So I shared with you that in that backlog, we have about 2,000 inspection appointments that were canceled. And thus far, we have been able to complete inspections for 44% of those canceled appointments. We're going to continue, of course, to focus on the remaining backlog. First, our staff continues to be in close coordination with the Office of Economic Development, their Development Facilitation Officer, and doing direct outreach to customers whose appointments were canceled. So we are following up with them, trying to get a better understanding of their revised construction schedules and when they might be ready for staff to actually come out and conduct those inspections. Also, as part of this strategy, we are actually reserving inspection appointments. So at any point, any one of these customers in the backlog contacts us and say, hey, we are ready for our inspection. We can actually put them into our appointment schedule and get their inspection completed. Next slide. So also wanted to provide an update on inspections for what we consider our high impact projects. So these are projects throughout the city, both residential, commercial, office, and commercial retail. There are actually about 27 of high impact projects on that list. And 21 actually of those projects had experienced canceled inspection appointments early on when shelter in place first took effect. And that represents actually was 500 inspection appointments that were canceled, representing about 5,000 residential units and about 4.5 million square feet of commercial space. So to date, we've actually been able to complete inspections for 336 of those. So we're about a 67% makeup rate in terms of working with these customers. And again, we'll continue to work with OED, stay in close communication with these customers, and really be ready when they're ready to reschedule those inspection appointments. So the next slide, wanted just to provide some information to the council in terms of how we manage our inspection capacity and the time it takes to actually to conduct an inspection. So the way we do this is our team actually considers inspection counts per day. So normally we do about 500 inspection counts per day. This was pre-COVID-19. And as you can see from this graph, in the last 2 weeks, since the construction activity can now fully resume on all projects, we have been doing a good job of getting those counts completed. So we're at a rate of about 85 to 90% of our normal inspection count activity. So we're happy to see progress in that area. So the next slide, just wanted to conclude the presentation, again, to share with the council the tactics that we are going to continue to use and explore to really drive development during COVID-19. We understand the importance of assisting our development community and our customers. So I shared a couple of weeks ago that we will pursue extending both building permits and planning permits. So on the building permit side, we have actually already extended all building permits for 6 months. So whatever date that the permit currently expires, customers will just simply add 6 months to that date. The building official also has the authority to grant an additional 360-day extension should that be needed. On the planning permit side, we are preparing to do a zoning ordinance change so that we can change the term of a planning permit from 2 years to 4 years. So we'll extend that. And we are on track to bring the ordinance change to the City Council in August. Regarding construction hours and extending those, staff is continuing to work with the City Attorney's Office to pursue an emergency order to extend construction hours. And right now, we're looking at extending so that construction can take place from 6 a.m. to 8 p.m. And we think this is really important as we know that our construction sites have to adhere to the county safety protocols. So we're continuing to pursue that with the City Attorney's Office. Again, I shared about how we will continue to reserve inspection appointments so that we can get our customers' inspections completed. We will continue to monitor the high impact projects in coordination with the Office of Economic Development. And then lastly, we are going to start virtual community meetings. We have several projects that are now ready for either a EIR scoping meeting or for a community meeting so that their projects can continue to proceed. So we are working hand in hand with the EOC Virtual Community Engagement Branch. We have a couple of pilots that we're working with them. And then in additional, our staff is going to be proactive and work with our customers who need these community meetings to move their projects forward. So with that, I think I'm turning it back over to Kip.
Thank you, Rosalind. And just one small in the weeds detail, just to illustrate some of the complexity of this. Rosalind talked, for example, about the construction hours and the necessity from the public health order. One of the reasons that becomes necessary is the lifts that they use, the elevators that they use on the high-rise projects to get the construction workers up and down, have a social distancing requirement, and so you can only get a few people in those lifts, and so you have long lines, socially distanced, of construction workers who are needing to get into those lifts. And if you maintain the normal hours, they really don't have the full construction day that they used to have. So this is just one example of the increased complexity that both Rosalind's team and then the construction workers are dealing with within this new safe environment that they're deploying. And the reason that we're looking at kind of rewriting some of the rules and guidelines around how we operate. I'll close with just a reminder that this continues to be our roadmap, where we do focus on compliance with the public health order as our number one goal. We do that by providing the continuity of existing city services, everything from garbage to sewage that you don't notice to development services, which you do. Supporting our most at-risk communities and populations with food and necessity distribution, homeless support, and local assistance, which is winning actually shout outs from our peers in terms of the effectiveness of our local assistance website. And of course, all of this that we do is powered by people, and making sure that they're safe and productive and engaged is paramount to making sure we're able to do everything that we need to in this response. So again, on behalf of Lee Wilcox and myself, the two co-directors of the Emergency Operations Center, and the over 630 people actively deployed in emergency response to COVID-19, I turn it back over to Dave Sykes, the city manager, and conclude our report.
Yep, thank you, Kip. Thank you, team, for the report out. And Mayor and Council, we're available for any questions and comments.
Thanks, Dave. We'll go to the community first. Betsy Hammer Carr, welcome. If you could.
This is Jeffrey Buchanan with Working Partnerships. Thank you, Mayor and Council. Really wanted to encourage the council. Thank you to staff for the presentation on the Coronavirus Relief Fund monies. For some time now, I think we've been talking with many of you about the opportunity here to ensure that we are maximizing every possible last federal dollar, whether it be through FEMA or whether it be through these Coronavirus Relief Fund dollars. Would encourage the staff, mayor and council, in addition to looking at within the city manager's team to try to evaluate what opportunities there are for those that are working on COVID-related activities, to also think about bottom-up strategies. Obviously, the city's had a lot of success with using through the budget process, trying to reach out to staff and get managers talking to staff about ways that the city can be trying to save money. Now is a perfect time for managers to be talking with staff about what parts of their work are related to COVID now, or potentially could be adjusted to focus more on COVID-related activity in order to be able to maximize some of these federal opportunities. And so would really encourage, look forward to seeing the MBA as it comes forward, but we really encourage mayor, council, and staff to really think creatively about how everyone together is working on finding out what we can do to maximize these resources and ensure that we have every last dollar we need as a community to recover, that we're trying to invest in ourselves as a city, and that we're not pursuing austerity in a way that really could potentially elongate the recession and the kind of economic hit that has come from this pandemic. Thank you so much.
Mr. Beekman. See that I have 5.
Hello, can you hear me?
Yes, Mr. Beekman, we can.
Good.
Mr. Beekman, we're not hearing you now.
Uh-oh, you hear me now?
Yeah.
Great. Okay, to continue. Thank you for this meeting today. It was very interesting learning, a really interesting talk actually about the ideas of statistics today, and learning how, I'm learning how we're kind of, we're beginning to talk about the pandemic as plateauing here in the Bay Area and what that can mean. I was interested in this, learning how you're using work to force, possibly as a way to gather statistical data. And that's interesting to me. It's severely talked about in terms of surveillance. And I'm trying to learn what surveillance and accountability means at this time. And I don't think necessarily these words have to be so strong. I mean, they're applicable, but maybe, this is good work along the lines of census taking. I'm hoping. So I find it interesting that you mentioned it, and I guess good luck to yourselves in these efforts. Good luck in how we're going to talk about plateauing this issue, and I guess that's about all for now. Thank you.
Thank you. To the phone-in callers who have pushed *9 and have indicated they'd like to speak. First, the caller with the phone number ending 2896. 2896, welcome.
Yes, my name is Mike Mattingly. I'd say the least bit troubled by the fact that you guys are continuing to talk along the lines of continuing this shelter-in-place order when there's no new deaths. And so, I understand that we're getting new cases, but when you do testing, you're going to get new cases. So the new cases to me mean nothing. They are nothing. We got no new deaths in this county right now. And you guys are talking about tracking and tracing people as if you'd forgotten that the Fourth Amendment requires you to be safe and secure in your own house and person and not be invaded without a warrant. And as far as the last man who was just talking about the census, they don't come in and take your kids away if you don't have enough toilets. So I'm assuming that that's part of the tracking and tracing thing. I would love to have a conversation with somebody, but I don't know. I'm probably not allowed to talk for very long. But I also find it interesting that on the Santa Clara website, where it tracks the deaths and the illnesses, that there are 134 deaths, 135 now. 89% had pre-existing conditions, and on top of that, there's another 5% that they don't know if they had pre-existing conditions. So we're looking at like 15 deaths in our county, and you shut down the entire valley. Now, I need to work. I need food. I don't need to be tracked and traced by some program that is designed by the technocrats of this county. It is disturbing, to say the least, that you guys just act like nothing has changed. This illness is not what you claim it to be, is not killing swaths of people. Cuomo said that in New York, sheltering in place did nothing for their testing. These people.
Thank you, sir. The phone number ending in 6137, welcome.
Hello, thank you. I am also very much opposed to the contact tracing. It's a violation of my privacy, and it's just wrong. It's against the constitutional rights. Also, I'm calling to ask you all to vote no on wearing a fabric face mask. Masks only block 0.03
Ma'am, I'm sorry, that's a
microns.
different item on the agenda, so we won't be hearing comment on that until that time comes up.
When will
to speak on
when will
3.1.
that?
I'm sorry?
Well, and also again, find it just a violation to my privacy. And you talk about it like this is so okay and okay with everybody. And I just want to let you know that it's not okay with me.
Thank you. The item is 3.6 regarding to the face coverings. Thank you. Okay, I'm just going to take two more people who have are on. I'm sorry, three more people now who have indicated they want to speak in the public, and we're closing public comment. CEE, followed by Tessa, followed by Robert Aguirre. Thank you.
Hello, can everybody hear me?
Yes.
Okay, great. I'm C. I just want to thank everybody for the efforts that have been made to attempt to deal with this situation. And I know I don't have a lot of time. We opened with the Pledge of Allegiance. There's principles in there that are very important. I know they're important to you. This path that we've taken seems to be gone off track. There was a speaker that mentioned a little bit about numbers not adding up. When action is too swift or too extreme or bypassing these principles, it creates unrest. And that's why I'm calling in today to talk about this unrest. This shutdown was designed to limit harm, and these non-COVID deaths that we're seeing exacerbated harm. It's mounting, it's staggering, it's overwhelming. And this crisis may very well have spread beyond the original problem that the county and the country and our city had set out to solve. We have domestic violence, drug abuse, addiction, toxicity in the home, and our infrastructures just aren't able to address those things. And we've in effect sacrificed, people of color, low-income people, protected demographics in this attempt to protect public health. So we're cherry picking the issues. And that's why I'm saying this path really needs re-examination. The isolation that we're under, I'm sure any of us can talk to our doctor about how not mixing and limiting the interaction actually will negatively impact our immune system. Anyone on this council can, understand that a lot of the people getting sick are people who are remaining home. In regard to the testing and the contact tracing, I hope the mayor and the people on the council, someone will control for what extent keeping people safe in this situation is creating an unsafe civil rights climate for all of us free Americans. As history has shown, it need not matter how well-intentioned policy may be. If policy makes human beings vulnerable from abuses, we have to take stock of that, and Americans should retain the right to opt out. An opt-out option must be in place for the contact tracing, for COVID testing, for mask mandate.
Thank you very much.
Thank you.
Welcome, Tessa. Tessa, if you could unmute your device, and we'll be able to hear you. We're not able to hear you now. Tessa, if you could unmute your device, we can't hear you. Okay, we'll try coming right back to you. Tessa, go ahead. No, okay. Robert Aguirre.
Okay, Robert Aguirre here. Yeah, I have a real problem with this requirement for face covering, not for the general public, but we have thousands of people that are living.
Robert, that's coming up on 3.6.
I thought we were on 3.6.
No, we're on 3.1.
Okay. Oh, sorry about that.
We got a little ways to go. M. Alvarez.
Hello. Hi. Can you guys hear me?
Yeah, welcome.
Hi, thank you so much for taking public comment, and just wanted to start off with that and say I appreciate you listening to your people here. My concern is about the testing and tracing, and I'm just trying to gain a better sense of what does this mean. And we know that there are false positives on the test, and with your depiction of the diagram, one false positive could lead to a tremendous amount of people being needlessly contacted and traced. So that's just a concern of mine that I had. And the other thing is this mandatory? So what happens is if a person refuses? And so I'd like to know, let's say a child is deemed positive in the house and no one else is, will that child be taken away from the home against the parent's will? If someone wants to accept the service, I think that's completely fine. But also if someone refuses, what are the next steps that we're talking about? Recently in California, a bill was passed, AB 262, and I'm going to read exactly the wording. It says, The bill would authorize the local health officer to issue orders to other governmental entities within the local health officer's jurisdiction to take any action the local health officer deems necessary to control the spread of communicable disease. My concern with this is that the wording is very vague, and we're on the brink of a very slippery slope where I feel like we're just kind of one step away from taking people out of their homes without them wanting that. So at what point is enough? And that's my concern that I want to bring up. Can you address any of that?
Thank you, ma'am. This is just the time for public comment. Ordinarily, I would simply say, no, we're going to continue on, but I will just say clearly, there is no one in the city of San Jose who's planning to take anyone out of their home or take any child away from their family.
Thank you.
So we're going to return then back to the council. Councilmember Davis.
Thank you, Mayor. I'll kind of work backward from Rosalind's presentation. You talked, Rosalind, about monitoring high impact projects. What does that look like? Who's in charge of monitoring? What will that process be?
Thank you, council member. So our building division staff, so both of our building division managers, Mark Garcia and Bill Mang, are in close communication with Emily Lapoma. She is the city's development facilitation officer. So they are in direct contact with the customers of these high impact projects. So that's phone calls, emails, following up with those customers about their revised construction schedules, when they might be ready for inspections, what other obstacles they may be having. So it's direct contact with those customers.
How many high impact projects have been identified, and are they all downtown?
There are 727 projects on the list, and they are not all downtown. They are throughout the city. Of course, most of them are located downtown or nearby downtown. I'm happy to share the list with the council.
That would be really helpful for me. Okay. I would appreciate that. Thank you. And then you talked about the number of inspection counts per day pre-COVID, and that we're about 85 to 90% of that capacity now in the early May, first 2 weeks of May. But when we looked at the budget last week and the budget goals on the dashboard, your inspection goals were higher than this previous fiscal year and the 18-19 fiscal year. So I'm curious how being at 85 to 90%, getting back up to that is great, but how are you planning to exceed that while we're still in this kind of weird limbo so that you can meet budget goals?
Yeah, so we discussed last week during the budget session that the building's target, excuse me, is to conduct those inspections within 48 hours. And so we're still going to aim for that. In our department, we aim high, and we're going to continue to do that. Currently, we have good staffing levels. We do have a few of our inspectors who themselves are high risk. So we're not sending them into the field to conduct on-site inspections, but they are the ones who are doing the virtual video inspections. So we fully intend to be able to maintain or at least get up to the 500 daily count that we are normally at.
And what's the target for getting back to the 500 then?
We anticipate perhaps by the end of this week, or certainly by the end of next week, we may be hitting our normal 500 count per day.
Okay, so by the end of May?
Correct.
Great. And the only reason, I'm not trying to give you a hard time, Rosalind, the only reason I'm asking is because you are basically the linchpin for our development. And we know development is always the most important thing that we have going on in our city. And even more so now in an economic downturn, where if they're still willing to build, then especially office buildings, getting more businesses back here to have that revenue is very important. So that's why I'm asking these questions. I think you know that, but I just wanted to make sure that people understand why this is such an important thing. And then we can take this one offline if you want, but I was looking at slide 36 where you were looking at the charts with building permit activity, and the numbers that you gave, new building permit intakes and building permits issued, they didn't track with the numbers that were in the virtual permit center activity chart that was to the right of those numbers. So I maybe I missed the connection, or maybe they weren't supposed to be, they didn't add up to what the numbers on the right in the chart did not add up to 301 or 983. So I might have missed what was going on in that slide. And if it's like a really long thing and I'm the only one who's interested in that level of data, we can take it offline, but I just wanted to ask about that. I'm confused.
Yeah, actually, I see your point now, because the chart to the right, I'm sure if you add up all of those numbers, 3, 11, 24, 28, it looks like it does not equal 301. So we will take a look at that. I'm anticipating perhaps just a typo, but we will definitely take a look at that.
Okay, thanks. And if you could get back to me about that when you get back to us with a list of the 27 high impact projects, I'd really appreciate that.
Certainly.
Want to make sure I'm, understanding all that. Thank you. And then for, let's see, I think my other questions are for Kip on the testing and the contact tracing. Just wanted to ask, there was a target for testing for, and I'm losing which slide, it was early, on testing people who are in shelters. And I'm wondering how that's happening.
Target for testing people in shelters.
Yeah, it looks like it was slide 10, shelter and congregate setting residents who should be tested and how often? One time every 5 weeks. Are we going into, how are we keeping track of that?
These are guidelines that just came out from the county and haven't even been officially issued yet. And so we're still in discussions with them about how all of this is going to be rolled out and take place. So it's only just this last week that these were presented by Marty Fensterscheib to the Board of Supervisors as a suggestion and a recommendation. So we're following up. We have a meeting with the county that's being scheduled right now. And we will be operationalizing how we do the testing within the shelters and the congregate setting in line with their recommendations. So there's more work to be done on that.
Okay, so when you come back next week, will you have more information for us on how that testing is happening at the shelters? And I assume it will happen on site, because we're not talking about a particularly mobile population here. They don't necessarily have vehicles.
Yeah. I will come back. We'll be able to. It won't be next week because we have no meeting next week. So it would be
next week.
2 weeks from now. But I can follow up with you on the question of testing at the shelters in general and specifically in regards to these new recommendations.
Thank
Councilor Davis, I'm sorry, I failed to announce. We were going to try to adhere to our 10-minute limit. So you got about 4 minutes left, and we're going to do that just because we have a very heavy schedule.
Yes.
Mayor, point of clarification, we have voted to have that in the past, and we did not vote on that today. So I request that we vote on that change in order if we're going to pursue that today.
We didn't vote on it last week. Rick?
You've done it both ways. The rules of conduct do allow the mayor to set time limits, but so there's precedent both ways. And I think the way it works is the chair can say that it can be overridden if the council wants to by motion overrule the chair.
Yeah, Mayor, I request that if we impose these limits, I know we had the Pam Foley rule in the past to limit time in the past, but if this is going to happen from week to week, then I think we need to have a vote of the council so that we all have a say in that.
That's fine. You can certainly make that motion. My concern is, as I stated before, we've got a very long calendar, as we have had consistently long calendars on these Tuesdays. And on item 3.1 in particular, these are the EOC lead staff who we critically want to get back to work as quickly as possible. And these items have been lingering for 3-4 hours at a time. And so I am concerned about the duration.
Yeah, I feel you, and I would be amenable to, a little bit more time. I think that this is the only chance for some transparency around some important issues during a global pandemic. So and I feel like 10 minutes can go pretty fast when we're talking about some really, a whole bunch of complicated issues as it relates to both COVID, and our response, and how we're working with the county.
Councilmember Esparza, you're welcome to make a motion, but right now Councilmember Davis has the floor. If you want to make a motion, go ahead and make the motion.
I move to not limit our questions during the COVID report while the public health order is in place.
Second.
Okay. There is a motion. Rick, I assume we should take that vote now? Is that right?
Yeah, it's a non-debatable motion, and it's got the preference.
Yeah. Okay. So we'll take that vote now. And Madam Clerk?
Jimenez? Jimenez? Peralez?
Aye.
Dieppe?
Aye.
Carrasco?
Aye.
Davis?
No.
Esparza?
Yes.
Arenas?
Yes.
Foley?
No.
Camus?
No.
Jones?
No.
Ricardo?
No.
I'm 5-5. Jimenez?
All right. Councilmember Davis?
Thank you. So I actually only have one more question, and even though I had 4 minutes, it looks like they were taken up by this discussion. So I will just ask my question, and hopefully it will take less than 2 minutes. My question is for you, Kip. We talked about only a human contact tracing component. I know there is an app being worked on jointly, I believe, by Google and Apple, and that they had done some background work. Can you talk a little bit about the app for contact tracing and when that might be available to assist with this effort?
Yeah, there are a number of apps that are in development. There's some that Google and Apple are doing jointly. There are a number of other ones that are deployed in other contexts in Europe and in Asia. There's a range of them. Some of them are simply, if I'm isolating, to give people the ability to check in and say, I'm okay, I don't have any symptoms, I'm still at home, to the more elaborate ones, which are opt-in. The ACLU has actually put out a nice framework around how to do this kind of contact tracing and respect people's privacy. And generally speaking, everybody agrees that these should be opt-in technologies, but it makes use of Bluetooth technology and other near-field communications to, let's say I've got the app voluntarily and downloaded, I've turned it on, you've got the app and you've downloaded it and turned it on, we come within 6 feet of each other, then I test positive, my app would anonymously be able to notify you that you come in contact with somebody. And in some cases, that data might be available to the public health folks so that they could use it to augment their contact tracing. The traditional kind of gumshoe and paper way to do contact tracing is very, very labor intensive and relies on people recalling everybody that they've come in contact with over the past 4 to 7 days, which is a notoriously bad way to actually get good information. We don't really have our memory doesn't work that well. We don't recall everything we've done. And so there are many apps out there which are intended to augment that capability. Unfortunately, there is no standardization. And in the absence of standardization, you don't have something that everybody can say, this is what we're doing together. And that's one of the inherent weaknesses of any of those technologies out there at this point.
So everyone would have to have the same app for this all to work?
Generally speaking, yeah, or they have to talk to each other. So some businesses have used that, especially in manufacturing settings where they've given people wristwatches so that if somebody becomes positive, that they can we can rapidly alert other people and get them safely isolated. But we have no national standard and we have no state standards. And so in the absence of that, you have a bunch of competing ways of doing this, none of which are really necessarily talking to each other. So the utility goes way down because it's really only effective if it's a single methodology and it's largely adopted on a voluntary basis.
Okay, so this explains why the state of North Dakota basically picked a winner and they went with it. And their entire state everyone is being asked to download the exact same thing. We don't have
Right.
that at the state level. Do we anticipate having that at the county level or the region level?
We haven't been brought into those discussions. We've offered our support to the teams that are working on those, but the state has picked a team with Accenture, with Salesforce as the back end, that they're working on the data solution. But their primary focus is actually getting the data integrated in with the extremely archaic existing state system, which requires a lot of manual keying in of data. So this county, I don't think, has made that determination, and we're certainly willing to help them think that through if they get to that point. But we've had dozens and dozens of different vendors coming at us from all directions offering to help.
Okay, thank you. And by my count, I only took 3 out of my 4 minutes, so I'm going to make the motion. It's a modified Pam Foley rule because the Pam Foley rule was for 5 minutes. So I'm going to make the motion that we limit our speaking to 10 minutes.
Right, there's a motion from Councilmember Davis. Is there a second? Okay. On that motion, Tony?
Jimenez,
No.
Peralez,
No.
Dieppe,
Sure.
Carrasco,
No.
Davis,
Yes.
Esparza,
No.
Arenas,
No.
Foley,
Aye.
Camus,
Yes.
Jones,
Aye.
Ricardo.
Aye. All right,
That's
motion
6.
passes.
Passes.
Thank you, Councilmember Davis. Did you have anything further?
That's it. My time would be up anyway.
Thank you. Councilmember Arenas?
Thank you, Mayor. So I wanted to ask, on page 20, on the supported isolation, here it indicates that the assistance for people who test positive for COVID is pretty comprehensive. Who's providing all of those different support ways to support a family, including if you can outline the childcare, access to phone, cash assistance, obviously. I know. Anyways, if you can just go down, run through that, please.
Yes, and this is that was intended to illustrate sort of the ideal supported housing. Not necessarily all of those are being provided right now, but these are the things that either council members or in our discussions with the county have come up as potential elements for supported housing. Typically, what we're providing right now is housing, either sheltering facilities, hotel, motel space, trailer space, or other housing. Some cash assistance, usually in the form of rental assistance if it's not provided the housing, food, and then medical care. The language and cultural and childcare and access to phone are services that have been talked about, but I don't think are necessarily part of the package that's currently being provided. So part of what we wanted to do as we discuss this going forward with the county is kind of use this as a checklist to say, are these the right set of services? How are we providing them and who is providing them?
Okay, so I think you probably already know what I'm going to say and bring back the points that I made last week about the overrepresentation of some communities and certain zip codes. And so I know that there's a difference between an unhoused person and an inadequately housed person. And so that is taken into consideration, obviously, when somebody's impacted. And they're living in the living room of somebody's house. So not only just the person who's infected gets that support, but the rest of their family members, I'm guessing.
Yeah, again, it depends on whether that person is infectious and what the kind of status is. But in terms of of COVID positive status. What I understand is that if somebody is positive, we want to make sure that they can be isolating in a way that's not putting other people at harm. And so they would be able to safely isolate. If other people needed that support, I'm not sure exactly what the protocol is on that. And I actually should do a little more research before I answer and get back to you. I know it's primarily been focused in the current process on people who have tested positive for COVID and sort of getting them out of that space if they want to, so that they can safely isolate. So I'll have to follow up on what support, if any, is provided to kind of the rest of the household, if you will.
And I'd like to know what the city, what resources we're providing to support that community. These are our San Jose residents who are dying, and maybe some of the folks who've called in so far don't realize that there's people who are dying, and there's a reason why we have this shelter in place. But they might be far from the center of this crisis. All right, so I'd like a breakdown of that, and I'd like to know what efforts we're going to make if there isn't any plans on the county side just yet, but what are we planning to do in terms of supporting these folks who are inadequately housed and infected or exposed by COVID with our CARES money. I also wanted to just point out, I think, and I didn't do this, I think about 2 weeks ago, but I think the baseline screening for the testing is not in Vietnamese, or wasn't in Vietnamese about 2 weeks ago. Is that now offered in Vietnamese? Because I know it's in Spanish, obviously, in English.
Are you speaking about the Verily site?
Yes, yes. So the
Yeah.
online screening that a person has to go through to see whether they qualify to.
Yeah,
receive-
last time I checked, it was not in Vietnamese. I can check again and follow up on that. We have given that feedback to Verily.
Okay, that is another area that I would like to get some answers on. So if I understood correctly, I think last week, I think it was last week, I don't know, these days are kind of blending in, but there was a breakdown in terms of FEMA reimbursement. It was the operations, or the cost of operating the emergency operations center, and the personal protective equipment. Those are items that are FEMA covered. And then CARES was slightly different eligible expenditures. Am I hearing something different this week in terms of the EOC not being covered by FEMA?
Councilmember, this is Lee Wilcox. So no, I don't think you're hearing anything different. We still have not yet heard back from FEMA on our initial application around food distribution and PP&E. What Luz had gone over in reference to slide number 28 that you saw is that's not just specific to CARES or the Coronavirus Relief Fund. That's specific to the overall response. And so what we've done is we've refined these numbers, is realized our PP&E costs are going to go up. And so it's not that FEMA won't reimburse some of that. We are expecting reimbursement from FEMA on that, but our overall costs through the end of the year, as we've forecasted, have gone up.
Okay, and why is the food distribution piece of this so high?
It hits the most amount of people in our community. And so that's why the cost has been so high. And again, that number's been refined as Kip mentioned in the modeling of what the pandemic might look like through the end of the year. We've taken a conservative approach to realize that some of the food needs may go down, but come back up as people need to isolate again in the fall. So we've used a conservative model to go after that number, but it's been based off of what we've spent to date and modeling out what it would cost to do through the end of the year.
And does that take into account like the setup costs? Because obviously we are not set up for as a network to provide food distribution. That's just not what we do. And so I'm guessing there was quite a bit of investment in order for that to happen. So is that taken into account as you approximate the numbers in the fall, winter season?
Yes.
How?
Well, a lot of the work to create that centralized business model, we've spent already. So we don't anticipate we would need to redo that again in the fall, but we factored that cost in as we looked back on this is what it cost administratively to set up the program, and what we've used to forecast out is the actual distribution of the food. So that's how we took that into account. We haven't based that off of needing to spend that money again in the fall.
And for your forecast also includes a lesser amount of people, correct?
At various times, but again, as Kip mentioned, not knowing what this looks like, it does the modeling now does presume a spike again in the fall where people would need to isolate and they would need to be fed. So it does have numbers going up in the fall.
Even though right now I think part of the effort is to enroll folks into a lot of the federal or state programming that would provide them with some food resources.
Yeah, and I mean that's getting factored in every single day, which is why we'll see a refinement of this numbers, and probably one of the many reasons the number went down from last week. So we are factoring that in, yes.
Okay. And then I don't know if Kip is still in, but I know that he said he would follow up with the page 20 and the supporting isolation. If I didn't mention it before, I also would like to know the childcare piece of this. And obviously we're covering our city employees, but I think it's we also have to think about what it is that the city does very well. And one of the things that we do very well is recreation programming for our community. And I think we are missing an opportunity here to provide and when I say childcare, I don't mean, babies crying in a childcare based center somewhere, but I mean what parents just like myself use in order to work from 9 to however long we work, right? 7, 8. And so part of that is our city run recreation programs. And so I think that this is part of what we do really well. Maybe the food distribution, now we're getting to do it very well, but recreation is something that we do very well. And I think that our community is missing this system because obviously we haven't put it up and we haven't offered it to anybody outside of our first responders. And so I wonder how close are we getting to offering childcare to our not our first responders, but our essential service workers.
We've just started those discussions. Oops, I think I just cut out. Oh, there we go. Angel Rios, Deputy City Manager, has been working with both Jill Bourne, our City Librarian, and John Cicerelli, our Director of Park Neighborhood Services, to begin the discussion about what we would be able to offer as we come into summer around child recreation, child care, and we've also initiated discussions in collaboration with the YMCA about what their plans are and how we might be complementary. So those are still at the initial stages, but we recognize that for a great many people, both within the city and organization and within the city as a community, the question of providing services where their children will be, whether that's formal licensed childcare or recreation programs over the summer, is important. And we're all figuring out how to do that within the confines and the restrictions of the public health order, which at this point kind of restricts you to these stable pods of 12. So that work is beginning, and we are understanding what we will be capable of forward, both with the budget process and through the months. We'll provide additional information to you as we have an approach and a plan, especially getting into the summer months here.
Yeah, I really would like to have a date attached to that. I've been bringing up childcare since this stay-at-home order has been implemented, and I haven't seen any real updates on this. So hopefully next week we can get some meat on the bones here.
We won't be here next week, so that would be in 2 weeks' time.
I know, 2 weeks. Thank you. Those are my questions. Thanks.
sorry, problems with the mute. Councilmember Perales.
Thank you very much, Mayor. Here. So a couple questions in relation to the presentation, and thank you again for to staff for that. Going to see, I think it was slide 12, but you don't have to go to this slide. But it talked about the ease of testing in, and specifically, I'm thinking of obviously the East San Jose test site, and my question is in regards to how is it that staff thinks they might be able to assist. I saw that we're not being asked to assist at the moment, but I do know we've heard concerns in regards to I guess the lack of ease of testing or being able to access it, certainly being that it's online. I know that what was very successful early on for other countries was drive-up testing. And I know we don't have that yet. And it looks like some of our neighbors here in the Bay Area are starting that. And so just wanted to see what that might look like, as I think Kip described, we might be able to help in that regard.
Yeah, this is, I want to be very careful in how I describe this again, because this is very much the county's role and responsibility. And so it's sometimes easy to tell somebody else how to do their job and how they could do it better. And I don't want to come across as saying that this is easy and if we were in charge, we would do all these things. I think what I've understood from the county, what they're trying to undertake and what we are willing to support them in, if it's useful to them, is sort of 3 or so changes. One is to create a very user-friendly, centralized website that you could come to and sign up for any of the tests that you needed. Ideally, that would be simple, straightforward, easy to use, available in Spanish, Vietnamese, and Chinese, as well as English. The other thing is that we believe that there'll be need for on-the-ground engagement and opportunities for people to do either non-appointment drive-ups or non-appointment walk-ins in a safe way. And then the last piece is really making sure that the various providers for people who do have healthcare are really making that available to everyone that they serve. So that I've gotten some emails from Kaiser. I'm a Kaiser member, letting you understand that those testing is available and how you would do that, so that each and every one of the healthcare providers would want to be doing that in a way that reaches that broad community. So we think there are a number of ways that we might assist the county if we were asked, including helping them create a more elegant website, but also thinking about reaching out to some of our nonprofit community-based organizations and creating partnerships with them so that you have more of an on-the-ground presence, in language presence, in community presence, especially in the areas where access to the digital environment or doing a website in English is going to be problematic. So again, those are all suggestions I've heard the county talk about. We are willing to partner and support to the extent that they are interested in having us do that and that we can make that capacity. But those are the types of improvements, looking outsider in, that I would say are needed in order for us to make this accessible to the folks who need it the most. And in my mind, I think of our essential service workers who aren't public sector employees, so our grocery store clerks, our DoorDash folks, all of whom we've begun to realize how vital and how important their role is, are the ones that really need to make sure that they have access to that testing, and are often exactly the ones who lack gold-plated healthcare plans or who might be working as English as their second or third language.
Thank you, Kip. I know I was got a couple of emails over the weekend in regards to mobile testing, a mobile testing van, or maybe a trailer that had Carbon Health denoted on the outside, and it just said appointment only, and it was stationed in downtown. Are you aware of what that is? Who's administering those?
There's been some pop-up testing folks that have started, and I think that may be the one that you're referring to. We got looped into that a little bit late, and basically what they wanted from us is to make sure that what they were doing wasn't in violation of any of our ordinances. I think Rob Lloyd has been the one who's been working most closely with them, and if he's on, I'm going to ask Rob to tap in on that.
Yeah, good afternoon, Mayor, City Council, Rob Lloyd, CIO for the city. The reef and carbon health folks did reach out to us on Friday. They were doing it on their own volition and had some agreements with a landlord who owns that parking lot. They asked the city if it would be opposed, and we said no. We more testing the better. We did ask for if some of that data to be sure that it's reported to CalReady and the county so that it would be counted. But for us, it was very much just an inquiry: would we be opposed for a pop-up testing to exist in downtown? So it was on their own volition.
Okay, I'm talking about one actually was on the street. I didn't see one in a parking lot. Maybe they had a couple of them. Is this something that's free?
It is, and there is a request for information, and it does require an appointment, but they can set up an appointment quickly for you, as they described it to us, if there's one available. But they do try to make sure, and it is street facing, you're correct, but it bleeds into the parking lot, and they actually have the agreement with the parking lot owner, as it was described to us. So it is free. It does ask for insurance information, but they have a way to pay for it if there is no insurance. Because of some funding agreement from what they described.
Do we know if the locations are being coordinated through the county or through us, or is it sounds like, we were just sort of notified last minute.
So they look for opportune places, and it goes with actually the landlords that they can get agreement with. And it is a trailer and a truck, and it's pretty black from what you described. But they go where it's opportune, and then they try to reach out where they can.
And we've connected them with the county to make sure the county is aware and can hopefully more intentionally loop them into their overall approach.
Kip's right. Yeah, we did make that introduction on Friday.
Okay, yeah, it was just a surprise. I knew nothing about it, and so as community members started reaching out, I said, "Hey, look, I'm not aware of this mobile testing." So I do think, if this is something that is sanctioned, and if it can be coordinated through the county, there's certainly a lot of places that I think we would want to see if there's this mobile testing, especially if it's of no cost to individuals that don't have coverage. And I think we would want that to be coordinated. So I appreciate you connecting them in through the county there. Question in regards to the this was on slide, I think 22, of the number of people being housed. In the presentation, it stated that we have people placed in a shelter bed suited to meet their needs, 1,032. People placed in permanent housing, 400. I'm assuming here that's all formerly homeless individuals, because I know the slide before that talked about COVID-19 positive individuals and medical respite, vulnerable or at-risk persons needing congregate shelter, and that talked about cumulative 550. I don't know if that's all homeless as well, but are formerly homeless. Is that the case?
Yeah, so slide 22, as you say, is folks who are homeless in the case of those who are being sheltered, or formerly homeless in the case of 400 who are being placed in permanent housing. The prior slide is folks who are COVID positive, which included both some people who might have been homeless and some people who might have been sheltered.
Okay. And so, but the total number sheltered at the moment, that 1,032 and the 400, is that, do those 400 placed in permanent housing come out of the 1,032, or is that in addition to, can I look at that as a 1,432 number?
That's a good question, and the housing director is texting me in real time, so let's see what she says.
Okay. And while she's texting you, I'll just make another point. So my main concern is that I'm not seeing what looks like a major dent being made in our homeless population, especially some of the encampments. The one that screams out is the one at the Guadalupe River, right by the 280, and it has grown enormous. And I've not, there's now, right as you're getting onto the freeway, there's a giant RV, a couple trailers. And so I don't know if it's just a congregation that's happening. Certainly haven't had a chance to tour the entire district and the different encampments, but I'm not necessarily seeing a major dent. And so I'm curious. I know that we obviously have had some publicity around the opportunity of these vacant motel rooms. Certainly, we opened up some shelter opportunities. And so just kind of curious in that regard, we're looking at, and maybe you haven't answered, if we're looking at 1,400 or 1,000 total.
Yeah, I still getting the answer, but my understanding is that we have, for the interim, allowed the encampments to be where they are. We have offered folks housing primarily in the shelters, and for many people, they prefer to remain in the encampments rather than to be in the shelters. There is a desire and a demand for the hotel and the motel space, but I believe that is being directed more toward people who are COVID positive. And again, I would defer to the housing director to give a more detailed and authoritative response on that. I don't think she is Reagan is on, so I'm going to tap onto her and let her give a more frontline and accurate response.
Hi, Councilmember. This is Reagan with the Housing Department. So the 1,100, that's what's the number of people who've been housed or sheltered in either hotel or motels or our congregate shelter sites. The 400 is in addition to that 1,100, and that is our continued daily work of permanently housing people.
Okay, thank you. Yeah, I do recognize we're certainly seeing some of these encampments, longer because we're not abating. I get that, but I'm actually seeing the reverse of what I thought I was going to see, which would be, as we're beginning to shelter some of these individuals, maybe see some of these encampments in the homeless population subside a little. I'm seeing what I think is the opposite, and so just a little concerned in that regard, and looking at the numbers there. And sort of hoping that we can see an alternate trend, especially if we're not abating at the moment. And what we're telling our community is that we're opening up these opportunities for shelter. Granted, I know that we have the tiny home bridge housing communities that we have. We're barely underway. I get that, but if we want to win over some confidence from individuals and understand why we're not doing abatements, I think we certainly need to be showing some success in housing our homeless population, and I'm not seeing that. And so I'm hoping that we can begin to see some higher numbers on individuals being sheltered, and as we open up some of these opportunities, hopefully we do really see a dent. And then obviously it just screams for the need for even more shelter. So thank you for that.
We continue to identify new hotels and motels. We're also opening up a second phase of South Hall, which will be an additional 100 beds. We opened up the trailer site last week, but it's there's 5,000 people unsheltered in the city of San Jose alone. In 6 weeks, we've been able to shelter 1,000 of them.
Councilmember Perales, I wanted to give you extra time because I know there was challenges in getting answers to you. Could you make this your last question?
Yeah, let me choose it wisely then, because I had 2 left. So, so I'll go to the tracers then. This was on, I think, page 17 or slide 17. So I was curious why we're not only talking about paying the tracers for this work. I know that the presentation, stated the 3 different options. Option 1, identifying city staff, which sounded like a pretty big cost to us, both financially and opportunity cost, to loan these individuals. With so many people out of work, I appreciated the, option 3 of working with Work to Future for unemployed or underemployed individuals. But even the option 2, the recruiting recent grads and trying to get individuals to receive a stipend, I just kind of feel like with so many people out of work right now, why wouldn't we want to, even if it's a short-term deployment or short-term opportunity, why wouldn't we be paying? So is this something that is the county, do they have funding to pay for this? And is this their request that they're saying, hey, we'd like to not pay for it first, and we'd like to get volunteers or loan, people on loan from the city? Or was that just the option that the city was conjuring up?
Yeah, the county's request is for us and other jurisdictions to provide them with personnel who meet these criteria while we, the city and other jurisdictions, continue to pay for that. Our interpretation of and understanding of the funding sources is that to the extent that the county does this, it is actually a reimbursable cost for them. And so part of what we're trying to figure out is a way to maximize their reimbursement for their services and minimize our costs, certainly to our general fund and non-reimbursable way. So this is intended to be sort of an opening deck of cards of possible options. There may be others, or it might be a combination of 1 and 2 or 2 and 3 together that meet their needs. But we think that there are ways to do it that are more effective and less costly, and perhaps bring people who need the jobs rather than sending our staff over on our nickel to do this work. Bottom line.
Yeah, thank you. I think it's very honorable, but I think it's foolish. We're hurting at the moment, and we have our own individual employees that may be out of work at the moment, whether they were part-time or a temp. I don't think we need to be loaning employees. Is going to both cost us in their salaries and cost us in the opportunity loss. I think we should focus solely on getting people back to work and using this as an opportunity and allowing the county to be able to pay for that through these federal dollars. And I hope that's that's the only route that we go.
Thank you, Councilmember. That view has been expressed to the county, I assure you. But thank you. You're absolutely right. Councilmember Kimmis?
Thank you, Mayor. And I want to start by saying I'm glad to see that there was some flexibility in the CARES funds in the way that we are allowed to potentially pay for some of the first responder services. I'd love to see I'd love to see what happens, and if nothing else, if we can try to maintain our higher ed program with some of those funds, if at all possible. If that money could be used. I too, I'm very concerned about that direction, Kip, with the taking on more responsibility from the county. I think it's, we've already taken on this food distribution, which is used to be the county's responsibility, and I know that we're receiving some federal funds. Is the county reimbursing us for the food distribution that we're doing?
Hopefully. We'll be bringing that item up forward next, right after this one, as item 3.3. So we'll be discussing the county agreement at that point.
Okay. And so, I don't see us, I'm not necessarily thinking that even this testing, what are they tracking? I don't even think that the tracking is, just looking at your charts could be exponential, especially if you're riding a bus or something. And I think this could be a huge kind of wild goose chase potentially. And I don't think that we should get involved in it in any way. But if the county wants to help fund Work to Future, I think that would be a good opportunity to volunteer Work to Future as a way that is something that they could fund to help get qualified people in their doors. And that's the way I would couch it back to the county. I don't know if you had any.
This is exactly the reason we wanted to bring this discussion to you as a council. Is we are concerned about, we want it done well. We do believe it is very much a county lead, and we want to be partners, but we want to be partners in a way that's fiscally responsible for us and makes sense. And so that's why we put these options forward. And from our evaluation, the idea of using Work to Futures to match feels like a very good one for us as well.
Yeah,
if I could, Councilmember, just to share a little perspective, I think Kip stressed this, and I just want to stress it as well. The testing, tracing, and isolation process is going to be key to us being able to open back up the economy. And so, just to be fair, we've been pressing the county, and others have been for quite a while, on what is the plan. And so, they've sent a request out for resources to all the cities. I think what you're hearing from us today is, the request as it has come to us has some complications and some concerns that we have, and we're sharing those with you. But not wanting just to say no, we want to offer alternatives to getting to that point where we can support the county and have it done in an effective way, so that we can really be confident in opening up the economy. So that's kind of what you're hearing here. We do have concerns with the request as it came to us, and we're hoping to offer some alternatives to the county, and all of your input to this is important to us. As we want to try to be on the same page about how we respond to the county's request.
Well, again, I think that the first level tracing might be okay, but when you get to the third level tracing, that's a wild goose chase, and it's possibly, unattainable and potentially undoable. That's my opinion. I just know numbers, and numbers could be exponential at the third level. Not something that could easily be done even with 900 employees. And I don't know if we should waste our time doing that. I think that testing is absolutely important. Quarantining is absolutely important. First level tracing is absolutely important. Anything beyond that, I don't think we should be delving down that direction. I think I'm lockstep with Councilmember Perales today. I have had our encampments grow in my area as well. I've had several complaints lately, even though we've been providing bathrooms and cleanups and what have you. By Oak Ridge Mall, the Guadalupe Trail, the Highway 87, we've had a huge, it feels to me like an increase in homelessness. In the meantime, I was hoping that all these programs would actually be paying off and we'd actually be getting more and more people housed. I'm looking forward to my perception, why aren't they taking advantage of the opportunities? And is it the fact that we don't have enough opportunities? Is there for housing still, or is it that they don't want to take advantage of it, as the county had said previously, that they're service resistant?
Reagan, did you want to venture an answer at that?
That's my last question. And, if you want to keep the timer on, that's fine. It won't be me talking.
No, I think we're just trying to track down perhaps somebody in housing. So perhaps could we come back to you, Councilmember Camus? And so when someone
Absolutely.
respond to that,
Absolutely.
Resume. Any other questions you want to ask?
No, that was my last question. I concur with Councilman Perales. I just want to know whether is it just they're truly service resistant? Is it, and if so, why? What is it that's causing them to stay in place?
Okay, we'll come back on that. Councilmember Sparsam?
Thank you, Mayor. I had some questions about testing. I wanted to bring up a couple of issues. One is there are people in my district who have been blocked. So for example, when they applied at the Verily site early on, it did not meet all the conditions. And then now that it's been opened up in their online form, that's been blocked. So they have actually been blocked from applying to get tested in the future. So that's one issue. And are we looking at possibly opening up our own testing sites? Because aren't the two Verily sites state requested sites?
Yes, the two Verily sites are under contract with the state. We can pass the feedback along to Verily about the blocked applications, especially with the status change, the recommendation changes. That seems like it's really a barrier. At this point, we do not have plans to stand up city-run and city-operated testing sites. We've looked into what this would take. We've reached out to LA, where Mayor Garcetti and crew have done that at initial expense of over $10 million to the city to run sites. At this point, again, we are trying to work in collaboration with the county with our primary role to be, we've let them know we will be happy to identify any sites that they need locations on. And we'd like to support them in terms of getting the word out. But we have not made independent plans to stand up our own sites at this point.
And I had some of my residents were contacted today, actually during the closed session, by County Public Health offering that development, housing development, just those residents testing. Which was interesting. Have they communicated that with any of the city staff that they are doing that? And if so, where they're doing that?
I don't know. I'm not aware. They may have. There's a lot of communication going on, but it hasn't happened at the senior level.
And one of the issues, so some of my residents had some questions around what the plan was if somebody did test positive, and they were told there was no plan. So actually, I did step out and contact the county, and I asked them what was their plan, and they said, well, if anyone who speaks English, Spanish, or Vietnamese test positive for COVID, they could call 408-278-6420 and request a place to stay. And I suggested to them that that as public health reaches out, that there's a plan in place if we're going to go to certain places, as we should, to request people to get testing, that particularly in areas, my district has 3 of the top 6 most impacted zip codes in the county. And we have a lot of people who are living in overcrowded living conditions, who have no money in their bank accounts, and are stressed. And so if they're offered no plan, that's not going to take us to where we need to go. And when I talked to the county, they mentioned that they actually wanted the city's help with that. And I know we've had some talk about hotel rooms in the past. Where are we now when we talk about working with local businesses who are also hotel and motel businesses?
I believe Reagan is rejoining the Zoom, so this would be an opportunity to answer that question because is our housing department, which has been coordinating with Key Lee in the county around supportive housing, including the motel piece. So
my understanding is that motel piece was only for homeless residents. It did not apply to anyone, and so I think
that's part of the reason
clarity on that would be really helpful.
Agreed. That's why I'm hoping that she is rejoining.
Hi, Councilmember. It's Reagan with the Housing Department.
Hi.
Hi. So your question is, are we using hotels and motels to shelter, I guess, non-homeless people who may just be instably housed?
Well, people who test positive for COVID who are living in overcrowded living conditions. Right, where in my district, like in District 5 and District 3 in particular, we have a lot of families, multiple unrelated families living in, a garage or a 1-bedroom apartment. How do we, I'm not a public health specialist by any means, but how are we responding to that?
We have been able to accommodate individuals who request housing or isolation assistance. We've been able to accommodate them. We had a few when the county and the state were operating the field respite center at the Santa Clara Convention Center. But since that is closed, we've also been able to accommodate them at some of the hotel motel locations.
So are we working with economic development to secure additional motel rooms? Or my understanding is those motel rooms are under the 600 or so that the county has negotiated.
Yes, the county is still the lead on securing hotels and motels.
Okay, thank you. I have another question for Kip, which is, what are our plans? So 95111, 95112, 95116, 95122, 95127 and 95148 are the zip codes that have been have the most COVID cases and the most COVID deaths. What are our plans to focus on areas where we're seeing communities hit hardest by COVID?
We believe that in being data driven, that data tells us that that's exactly where we want to make sure that we have the most robust capability, or the county has the most robust capability around testing, tracing, and supported isolation. Especially because we believe that a lot of there's two factors driving this that are perhaps different and useful to separate out. One of them actually is the presence of nursing home facilities or elder care facilities. Those are obviously high risk spots, and the county has the responsibility and is proactively working with those to make sure that there are protocols in place and testing in place on that. So we think that's super important. There is actually a fairly large concentration of those facilities in the zip codes you mentioned, and so that is part of what is contributing to the number in those zip codes is the concentration of nursing home facilities that were skilled nursing facilities and other senior facilities that were showing a significant number of cases. And we believe that because of the nature of the community, that a lot of folks who are doing essential services, who are not public employees, are having to move about, having to put themselves at risk. And so therefore, part of what we're bringing forward as we talk with the county is exactly that question. How do we make sure testing is available to that community? How do we make sure that we're able to rapidly trace to find people are infected? And given the density of the housing and the affordability issues in that community, how do we provide the supported housing that they need? One of the things that's not clear to me, and it literally is a question that I'm going to be asking the county, is, to my mind, there's a difference between me proactively saying, hey, do you need supported housing? And somebody saying, hey, I'm in a crowded environment. And I want to understand what is sort of the standard operating procedure and what is the protocol around people being made aware of the services that are available to them for supported housing and supported isolation. I suspect some of the low numbers that we have taking us up on that is that I don't think the word is getting out to some of the people who may need that. And so it's a combination of both getting more testing in those areas that you've mentioned, the zip codes that you mentioned, as well as making sure that when and if people test positive, they understand what the resources are that are available to them so that they can isolate safety. And I think there's a lot of work to be done on that. And frankly, it's been very opaque to us what the county's plan and strategy is around that at scale, which is exactly what we need to have before we can come out of the shelter in place. So I know I've been a bit circular in my response, but those are all questions that we seek to understand from the county.
Well, and I hear what you say about the assisted living. There certainly are, but for example, what happened this morning, it's a low-income housing development filled with families, many of whom are unable to work, and some of whom, or who are underemployed and are only able to work at one of their jobs. And so as we reopen and as we move forward, that's something we also really need to consider. And frankly, we really need to focus on those, on the data, right? So if we're seeing populations in, again, 95111, 12, 16, 22, 27, 48, those are not all assisted living facilities, especially on the data that was given to us earlier where we could see ages. So we could see the ages were lower than many of the seniors that we were used to. So again, just extrapolating from the data that was on the county dashboard, that means that people who are not just in the retirement homes are getting COVID at a higher rate, right?
You're
See what I
correct,
mean?
and
So
I
these
agree.
are in neighborhoods as well, not just assisted living facilities. And we have people that, for example, public health contacted today with no plan, and they asked and were not given a plan. And so, those are our residents, and they're suffering, right? And so what are we doing about it in those, with the data that we have in the areas that are impacted?
And I think, council member, just to kind of weigh in a bit. So, I think completely agree. And so, as we provide feedback to the county just not in terms of how this is done, as the three options that Kip provided. It's also where this is done. Where are the impacts being felt, and who's most dependent on our services? So that has to absolutely be part of it, not just in what we're asking of the county, but what we're asking of ourselves.
Right. And to be a little bit emergency operations wonky for a moment, the whole reason for a multi-agency coordinating group is so that we can strategically talk about this and make these decisions together, rather than being on the receiving end of secondhand or third-hand information, right? We need to be very intentional about supporting these communities that are at risk, and we need to do it now before we come out of the shelter in place. And you're absolutely correct. It's not just nursing homes. It is especially denser housing developments and denser apartment buildings, which are the ones that we should be most concerned about and focused on, and providing proactive resources to support. So we agree. And we believe that in order to do that, we need to be not just a secondhand recipient of information, but in there in the strategy sessions, figuring out this together with the county.
And so the site.
I'm sorry, the time's expired, but it's obvious there are many questions.
And I actually, Councilmember Jimenez has offered me his 10 minutes, and so I'll go ahead and take his 10 minutes so that we stay on time.
Councilmember Esparza, I appreciate that, but we need to move along anyway.
But Councilmember Jimenez has given me his 10 minutes.
I don't recall that being part of the motion, but certainly if
Well, why wouldn't it? Why would we limit discussion on parts of the city that is filled with people who are suffering?
Because
our residents are suffering. We know where they are, and you're limiting our questions when we are here to represent them.
I'm not limiting anything.
You just did. You just did.
I was about to encourage you to please ask our city staff to request that information of the county and have it reported back to us, either from county staff or through the city. But we are routinely seeing now a pattern of questioning of city staff being asked for data and information. This goes back several weeks that we don't have, we ask for, we're not often privy to, and ultimately we need to get that from the county. The county is the public health agency. And I think you're hearing from Dave and from Kip a strong willingness to try to get information, but their hands are tied. And so continuing to ask them questions about data they cannot possibly have today, unless we ask them to go back to the county and bring it to us, we're just not going to be, it's not going to be.
Mayor, you're putting words in my mouth. I'm asking them about our response to data that is publicly available about the COVID cases that we know about and where they are. And I'm asking about the city's response. The county, I separately have conversations with the county. Believe me, I have multiple conversations with them about releasing data to us because yes, we are not a public health agency, but the city, we are responsible in many areas, including housing and including areas that we have taken on, such as food, and we offer the infrastructure, including testing sites. And if we're asking them for information about testing, then I don't think we should limit that discussion for ourselves because we need to pursue our options. And we ourselves, the 11 of us, need to be on the same page when we go talk with the county, because just as staff is talking with the county, you talk with the county and I talk with them, and we should all be asking for the same thing so that we get it.
Councilmember Esparza, I completely agree. So if you could describe, in addition to the questions you've already posed, and they're important questions, they're critical questions, you could describe additional questions you want posed to the county for Dave and Kip and anyone else to return to us to have a public discussion about on next Tuesday or another day, then I think that would be productive. I just don't believe what you're hearing.
The questions that I had were, the questions that I had were about our response as a city. I'm not asking them for questions about what the county is doing. I'm asking what we are doing with the information that we have today. And that is a valid question. Separately, we can have discussions with the county, but we are taking action ourselves as a city based on the information that we have.
And Councilmember Esparza, I allowed you to well exceed the 10 minutes in your questioning. And
Councilmember Jimenez offered me his 10 minutes so that our time in aggregate would not be affected.
We're borrowing of time. We need to move on. We've got very important
So
matters.
you're going to limit our discussion during a global pandemic when communities like
I'm not
mine have 3 of the zip codes that are most impacted by COVID?
No,
Is
the
that
council
what I'm hearing?
limited that conversation. Councilmember Carrasco.
Well, I'm actually feeling a little uncomfortable overstepping my colleagues' comments, but I just want to a couple of things I really want to emphasize. Am I there?
Yep.
Oh, sorry. Sorry. I just want to emphasize the need for testing. And what I heard, Kip, is that you've been doing some research regarding city-hosted test sites. And I had no idea that a city-tested host site would run us up to did you say $10 million to do that?
That was the data that LA did, and they ran about 8 test sites. And so there was an initial capital outlay, the contract outlay, as well as some of the operating costs. So the number they threw out for us, which was not an accounting number, was that they thought it was about $10 million that they were spending.
I need time to process it, but I don't want to take up a lot of my own personal time on this. And I'll have a conversation with you about that afterwards. And these are my initial thoughts as I look at the zip codes where we know are hotbeds, and you know, I had my staff look through. We did a PRA on the county's cases and the deaths that took place. And we saw that a lot of the deaths were related to the nursing homes or the skilled facilities, but the cases are still nonetheless in those zip codes that Councilmember Esparza mentioned. The top 3 were Councilmember Perales, Councilmember Esparza's, and mine, and then of course Councilmember Arenas, and then Councilmember Jimenez's. And so it's unfortunate that that those numbers consistently go, are drawn down Highway 101 and Highway 87, that they're consistently along half of this council that continue to advocate for the same issues. I wish it weren't the case. I wish that they crossed over some other boundaries so that we could have a much richer conversation, so that we could really all, as Councilmember Esparza was expressing, have a conversation that was all on the same page so that we can continue advocating at the county level. This is a pandemic. This is not just any ordinary crisis, but testing seems to be the name of the game right now that everybody is speaking on. And you just also made mention in your presentation that it's not just the swab, right? The swab testing, which is, what is it? It's called the what is it?
PCR.
Yeah, help me out. PCR, but it's also the antibodies. And what we're seeing in the research is that the best way of tackling this is actually to do both of them jointly. And I know that there's more research that's being done, but right now we're just doing the swab test, which is fine for now. But in my opinion, we're going to have to set up test sites everywhere because we're just not getting the word out fast enough and efficiently enough, effectively enough. And we can spend a lot of money in hiring folks, creating these elaborate networks to do outreach in a time of isolation. And we don't know how effective that's going to be, but we need to test, and we need to test frequently in order to have some control over COVID and be able to reopen the economy and get people back to work and get kids back into a normal school life, get them out of the house, and be able to have some sort of a normal life, whatever that's going to be like. So in my opinion, we should have them in every densely and overcrowded apartment complex, housing complex that we're building and that's already been built. And I can name 5 of them in my district alone. I can name several of them in my Esparza's district because I'm familiar with that area. And I can name several of them in Councilmember Peralez's just because we've built them over in the last several years since we've been in council. And so I'm just astounded by the price tag that you gave us. So that's just a thought that I had as you were giving out your presentation. And then the other thought, Kip, is the support around folks who are testing positive. And I don't know if this is a question for you or for Reagan, but for those who cannot isolate, and I'll tell you that when the order first came down from our public health director about isolating, it was printed out in the media, it was reported out in the daily shout outs that the county and the city give out, where folks needed to isolate in. It gave a very elaborate description, put them in a room, preferably where they have access to their own bathroom, blah, 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 blah. The first thought, and I think, we put it out in our statements, was where do we do that when people are living 2 families to a household in 950 square feet? How do you expect to do that? The directives, and I know that you have no control over this, were made with no poor people in mind, and most definitely with not those zip codes in mind. Again, blunt instrument versus a very thought out policy and a well thought out directive. So we find ourselves now having to really rethink how we control COVID-19 and make sure that it doesn't devastate us again as a city, because it has a rippling effect. And I like to have a more automatic system versus families having to proactively go out and ask for it, and having to maneuver their way through a very complicated system of having to advocate for themselves when maybe a language barrier, a cultural barrier, or an administrative barrier has been set up for them, and they don't know how to access those support systems, don't know how to ask for isolation or financial support when maybe they're the only breadwinners in the family. I'm going to leave it at that because I really don't have any questions. I just wanted to make sure that I made those statements, and I'm going to yield the rest of my time.
Thank you.
Thank you. Councilmember Foley?
Great, thank you. A good report, again, always enlightening and helpful with information that we'll be able to take back to our communities. I just have 2 questions. One has to do with development. Rosalind, you had mentioned that you're looking to modify construction hours from, did I hear 6 a.m. to 8 p.m.?
Thank you.
Yeah.
Yes. Thank you, Council Member. Yes, we're actually looking to propose extending construction hours to start at 6 a.m. and end at 8 p.m. In order to allow the workers at the construction site to adhere to all of the new county protocols.
Is this specific to high-rise development, or will we be seeing this in the neighborhoods? Construction beginning at 6 o'clock.
I think that's yet to be determined. I think ideally, so that it could be uniform, it would be citywide. But obviously, we know that this is particularly of concern for our construction sites in downtown.
Okay, I would encourage you to look at different requirements for different types of projects. I can completely understand and accept and agree that high-rise development or more development with more stories to it, who need access by elevators and such, need to do social distancing, and it takes time for their workers to get to the top floor, etc. But when you're doing a rehab or a rehab or a tear down and flipping a house or whatever you're doing, I would be concerned about impacting the neighborhoods with that noise level that's going to occur at 6 o'clock and as late as 8. And those small projects, the single family homes is what I'm referring to, they really don't need to get there at 6 o'clock in order to meet the social distancing rules. They're smaller units, there's not as many people working there, it's easier for them to spread out and deal within the time allowed. So I would really encourage you to consider 2 different approaches to the timing. I certainly understand and agree that that's a proactive way to get people on high rises and other more intense projects. But when you're dealing with single family homes, that may be too much, is going into neighborhood at 6 o'clock.
And just wanted to weigh in, council members, so certainly appreciate that input. And certainly I think we're focused on major projects where there's multiple trades, and the loading of that project takes a long time, and including the unloading of that project. And when I say unloading, there's a lot that goes into bringing the workforce onto a project site nowadays in a safe manner. So I think we are focused on the major projects, and certainly when we take this sort of action, there's certain findings we need to be able to make and criteria that we need to be able to adhere to. So there will be absolutely a solid thought process that goes into that thinking.
Okay, great. I appreciate that. And my next question actually has to do with PPE and availability and access to it. With us, the new county rule is stating that for all businesses, the employees must wear PPE, wear masks, and any customer going into the store or business needs to wear a mask too. And I'm concerned about our access to PPE, particularly in the high areas that COVID has affected our community in San Jose. So particularly the zip codes that Councilmember Esparza referenced earlier, but also actually throughout the city. Is there a way that we can provide PPE to those folks who may not have the resources to obtain their own, or either financially or the ability to find their own masks and other PPE? Are we considering how we might be able to do that?
Councilmember, thank you for the question. Just a couple of pieces, one definitional and then an answer. Face masks, as you've described them, the face coverings, are not technically PPE because they don't protect you. And I'm just being clear on this. They protect other people from you if you are infected. So when we talk about PPE, we talk about things like the N95 masks that seal, the gloves, nitrile gloves, and other things like that. So it is technically possible for us to provide PPE to nonprofits and businesses. We actually have been providing some to nonprofits that are part of the food supply work. It is very expensive, and it is not an expense that we so far have chosen to incur on behalf of the private sector. It is something that is possible, but it is an additional expense. In terms of the face coverings, which are now recommended outside and required inside, the expectation at this point is that those are borne by the private business themselves. And so that is an additional business expense. And either people would have to come on with those or the business would have to provide those. For example, at the airport, we have chosen to purchase some face masks, face coverings, to make them available if somebody shows up at the airport and they haven't brought one with them, rather than sending them back home or having them purchase them. We have some of those available if people need those as they're getting on planes, but we have yet to expand that program beyond the services that we provide, primarily because of the cost that would entail on an ongoing basis.
So just to follow up, if we have areas, and I understand the distinction between PPE, I apologize for using the term incorrectly. I view my own personal protection, but it's not as good as what I might get if I was a doctor or a nurse. So I'm concerned about, and I understand the business has to have access to it and the person going into the business, but what about those people who just don't have, who aren't going into the business, still need to have access to PPE to keep themselves safe? So maybe they're at home, quarantine at home and in a high risk environment, or in these care homes that they need their own PPE to be safe. We're not providing that. We are through some nonprofits distributing it.
Yeah,
I
it
just wanna
it
put
depends.
it
So
out there that maybe we should look at how we can help provide this for vulnerable populations, seniors, etc., who might not be able to get access to it themselves.
we'll take a further look at that. In the case of licensed care providers, the county is working with them, and where they have not been able to meet the PPE needs in order to be safe, they can make a request in through the county Office of Emergency Operations Center for those PPE support, and the county has been providing them in many cases, but they will often also bill them back later for them. So that's one mechanism to do that, is to go ahead and provide the PPE requested, but then bill them back. Specifically for those critical care communities, I understand the county has been operating that. We have been focusing our efforts around the nonprofits that we are working with in terms of food distribution to make sure that they have adequate protections, and safety protocols in place for their employees, especially as we are sending our employees to work alongside them. So that's been our main focus in terms of providing both safety protocols, safety training, and PPE for some of a limited number of the partners we have. But we'll take that question back and look more broadly.
Great, I appreciate that. Thank you. That's all.
Thank you. If there's someone from the Housing Department to respond to Councilmember Camus's question, either Rachel or Reagan or Jackie, is anyone here?
Hi, Mayor. This is Reagan.
Great, Reagan. I don't know if you heard Councilmember Camus's question.
If he could repeat it, I would appreciate it.
Sure. If he's available. If not, I'll try to do my best. Okay. Maybe we could wait for him to come back, since he'll probably want to hear the answer too. So we'll go to Councilmember Dieppe and we'll come right back to you. Thanks, Reagan.
Sorry. I'm here.
Oh, you are? Great.
So I
Councilor,
was having trouble.
restate your
unmuting
question,
the mic.
Reagan, and then she can answer it.
Yeah. No, my main point was, I feel, as Councilmember Perales said, that the homeless encampments are actually getting larger. And I know that we're offering services, but it seems to be not working. Is it because they're service resistant? And if it is because they're service resistant, why are they service resistant?
Sure. So our shelters, all of our congregate shelters are currently operating at capacity. So people are accepting shelter. I think we certainly don't have enough of it. What we have also seen is some homeless individuals declining shelter and instead requesting a hotel or motel room. Unfortunately, we don't have enough hotel and motel rooms, and so we are prioritizing hotels and motels for our most vulnerable, meaning older adults with those underlying health conditions such as diabetes, heart disease, history of cancer, etc.
Okay. So what you're saying is that you still don't have enough capacity.
I mean, that's right. I mean, there's, as I stated earlier, there's over 5,000 people who are unsheltered nightly in the city of San Jose, 9,000 countywide. During this emergency response, we've been able to shelter 1,100 of those people, but still, clearly, that's not enough.
Okay. Yeah. It seems to me that some of these encampments are actually growing and not actually shrinking, is my unsophisticated, unscientific observation. Thank you.
Councilmember Dieppe?
Yes, thank you, Mayor. So my question is also about the contact tracing, mainly because I was kind of concerned about some of the comments that the public speakers were making earlier about, Fourth Amendment, liberty, and all that. My understanding, as far as I'm kind of doing outside reading, is that in the Western world, predominantly the contact tracing will be offered, through Apple and Google and kind of these large companies with the phones. And my understanding is it's kind of built into the operating software on our phones, and it is dispersed throughout. Everybody has like a lock or a key on their phone, and nobody gets to see the data. It's not centralized. The only Western country that I understand that is even attempting to do like a government centralized database, I believe, is in Britain, if I'm not mistaken. But the pitfalls of having centralized things that everyone has to opt in. You have to download it, and it uses more battery life to have an extra app running. And the beauty or the elegance of the Google, Apple method is that it's on our phones already. It doesn't run, maybe a little bit extra, but it's not an app that has to be open all the time. And you can't see where you've been until you get some sort of keys paired up together, and then the phone unlocks and you get to see who you've been in contact with for however long. So there's no central database. Nobody from Big Brother can keep track of you. Is that an accurate understanding, Kip?
I think that's accurate in large measure, and I think one step further is that at this point the county is not accessing or using any of those technologies. So the methodology that they're putting forward or developing is a kind of the old gumshoe and interview technique with very little support from those apps. And I think you are correct. I believe the United Kingdom is doing a single nationwide app that they've standardized on. There are a few other in Asia where they have also South Korea, Taiwan, Singapore also have some standardized technology. But from a Western context, I'm aware of the UK, as you mentioned.
Yeah, so I guess I just want to say to the larger public, if the county of Santa Clara is not even at the level of doing like phone-based apps yet, no one is tracking you. There's no Big Brother following you around with closed circuit TV. It's really, again, gumshoe detective work, sitting down, interviewing you. Where were you, to the best of your memory, the last few days, last few weeks, and truly trying to create a chain of where you've been, to try to protect as many people as possible. Because if you've come into contact, I know I would want to know that potentially I've been exposed. And the whole idea of public health is separating the 4 buckets of people. Every one of us is either susceptible to this COVID-19, we've been exposed to it, we are infected with it, or we've recovered from it. And if you're recovered from it, that includes people who have died from it, but are no longer susceptible to it. And so you have to, the only way that I can see to open up the economy in any meaningful way is to be able to protect the people who are susceptible from this, and kind of take out the people who have been infected or have been exposed, and keep them under quarantine for at least 14 days. And so everyone else is in kind of a safe zone where we're not in danger of going to work or going grocery shopping and getting exposed to this. So that is the overall goal. I share everyone's or the public's concerns, speakers, about government overreach, but I don't think we're anywhere near that. And I just wanted to clarify that, because some of the concerns seem to be stemming from a place where we would be violating your Fourth Amendments, and we are nowhere near there. So I just wanted to put that out there. Thank you, Mayor.
You've been gone for over 4 hours.
Thank you. Councilmember Jimenez?
We needed to do work with you.
Councilmember Castro, if you might mute your mic.
The task force.
If everyone can mute their mics, please. Thank you. Councilmember Jimenez?
Just say that
Oh, I'm sorry. The time will be reset. I understand it hasn't been reset. When Henry gets back, we'll do that. We're having a hard time hearing you, though.
Okay.
Do you want to try? Let's see. I see your video is off. You want to try that again, Councilmember? No, we're still not getting an audio. Are you on the phone, Tony?
No. Can you hear me now?
Yeah, we can hear you great now.
Okay, wonderful. Yeah, apologize. I just wanted to comment on some of the statements that have been made around the 3 options that Kip presented with regards to the tracing. And I, some of the things, similar things came to mind for me is that if we're doing some of that work and not getting compensated for that, and the county is able to get reimbursed, it doesn't seem to make sense for us to go down that path. I think option 3 is what I've heard. That seems to be make the most sense for me. And so I just simply want to relay that, and Kip or you, Mayor, could take that back to the county and let them know that that seems to be the will of the council. And so I thought that was important to say. The other thing that comes to mind as we're having this discussion is, I know in past meetings we've discussed about the ability to use some of the CARE Act money and what it's used for, and clarification as to what's allowed, what's not allowed, things of that nature. And so does staff feel, and maybe, I don't know if this is for Kip or you, Lee, but do we feel like we've gotten a grasp on that? Like nailing down exactly what we can use the money for?
I would say on certain items, yes. As the FAQs came out, it certainly provided a bit more clarity around certain things. In a lot of respects, the CARES Act, or specifically the coronavirus relief fund guidance, is silent on a lot of items. However, we believe they're either directly or indirectly related to our response. And so, even looking at the questions that you submitted to Congressman Lofgren, I believe that we're in a good position once the city manager's office, city attorney's office loop back around once more with O'Brien to be able to answer most of those questions. And we need to be able to do that work to bring forward that MBA that Dave and Jim and I mentioned as a part of our presentation next week.
Yeah, okay. And I was quite frankly very surprised to hear that no one, and that's just what I understood, that no one had reached out to Congresswoman Lofgren. Is there any reason we hadn't reached out to her and utilized that sort of entry point to some of the folks that are making these decisions?
No specific reason why we hadn't reached out to our own delegation yet. We've been speaking to our own delegation mostly about the legislative effort. So specifically what was going to be needed in HEROES Act, which she was a big champion of, as well as our other congressional delegations. Since CARES and the Coronavirus Relief Fund was already in a department, we were trying to work directly with Department of Treasury through our legislative advocate on seeking clarity there and not having too many people in the middle. So it was a matter of efficiency more than anything.
All right. Okay. I mean, that sort of makes sense. I just, the thing that came to mind as we reached out to her is that it seemed to be a very natural sort of, to me, first place to go, right, to a certain extent. And so I was surprised at that. But I'm hoping that some of those answers that or the questions we submitted in the letter that we sent over can get answered, and hopefully provide some guidance that maybe we're lacking and clear up a few things. So I'm hoping that that's the case. I just have a few additional questions related to slide 28, I think it was. I think the heading is COVID-19 initial use strategy. Just about some of the amounts on there. The first one is I think in the middle of the page on the left-hand side, response support and payroll expenses. The 50 million, it just says personnel cost. Can someone elaborate a little bit as to, obviously, that's, I assume, paying folks, but is there anything else built within that cost that they could, that you think is good to understand and helpful to understand?
Yeah, so that is specifically related to what we went over in the Coronavirus Relief Fund, that payroll category. So we've put that in there. That number is based off of our kind of initial rough estimates of what it's taken and who's been in the EOC, or say, in the police department and the paid overtime cars, and an estimate of what it would take to carry that through onto the end of the year. So at a minimum, the administration would like to bring recognize 50 million of that coronavirus relief to help offset some of our own costs, and then it would create the one-time savings that Jim mentioned. So that number is what's going to get a lot of attention over the next week as we put in work and finalize that MBA and recommendations to you.
Yeah,
so that'll get refined quite a bit
as we start integrating some of these costs into the budget, right? Is
correct.
Okay, all right. And being here on the city council for about 4 years now, I recognize that when folks in finance or just during the budget office and such, when we're looking at numbers, we tend to be a little conservative and maybe overestimate what we're going to need. Is this, would you say that this is the high point, this 50 million? Or do you expect that it's going to, you know, and I asked that question knowing that we're in uncommon times, right? But is that a decent assessment to make as we're putting out some of these numbers that we're unclear as to where we're going to land, but we tend to be a little bit more conservative and maybe put out some information that shows we're going to be trending upward as opposed to downward?
Yeah, I don't want to say whether we've been conservative or not in that number. Really, how that number will change is what we need for the rest of the recovery. Quite frankly, you know, our own costs. You know, the 600 folks that Kip mentioned that are within the EOC or folks in departments in their DOCs. That's taken quite a bit of work and quite a bit of payroll. So if that 50,000 or $50 million figure could be more, I would say I believe we would have the documentation to support that. However, as you can see, there's other costs related to PP&E, small business, some of the residential assistance, and ensuring that we have some of the coronavirus relief fund and the other CARES Act funding that's a part of that dedicated to the response and what the community needs. We need to figure that out, and that will kind of help drive what is in the personnel costs.
Okay, all right, very good. And then have we gotten guidance from Treasury or from FEMA on some of that spending around that money?
Yes, we continue to get additional guidance from FEMA, and I believe that we will have another letter from Treasury at some point this week that'll help us have information to finalize that MBA for you next week.
Okay, all right, cool. And then the other question I had is around on that same slide, food distribution, 125 million. You know, I know in other items that we're going to be hearing later today, there's statements around loaded cost and just, I guess, more singular costs as it relates to actual food. Is that 125 million loaded cost, meaning staffing and everything associated with delivering the food or disseminating the food, or is that just purely the food?
No, that would be full costs.
Okay.
That is not just the food.
Okay, all right. And again, that's an estimation, right?
Yes, it's an estimation, and it's not just specific to the coronavirus relief fund either. That is the total cost of food distribution. So, you know, a certain amount is eligible for FEMA reimbursement, although a very narrow slip of it. Some would fall to the coronavirus relief fund, and some is our hope that the county, through our reimbursement agreement with them, as well as the other cities, that cost would continue to come down. So it's not just specifically related to the coronavirus relief fund.
Okay, and then the last question on that slide is the 42 million, I think, is to facilitate compliance in that section. That 42 million, are there other bundles of money wrapped up into that 42 million, or is that strictly 42 million from the care money?
No, so this slide represents the full response, not just CARES money. So at this point in time, there are other pots of funds in some of these costs. And so what we need to do so that we can make the recommendations in the MBA is to finalize what sources we have that are pointing to those uses so that we know what is the remainder of coronavirus relief fund and what falls to that and what might be left over for the personnel costs.
Yeah, this can get a little messy in my mind. And so to the extent that we can, I mean, assuming it's not, doesn't go against anything we're trying to sort of show as the MBA and things are presented to us, but almost like disaggregating the costs so we can see very clearly where the money is and where it's going and where it's coming from, I think is very helpful. There's a lot of movement of money, you know, that we see in a lot of different actions we take. And so some clarity on that, I think would be great to the extent possible. And with my 35 seconds left, let me just, and I suspect I have a little bit more because I know we had some tech issues, but, and I'm not sure if this is for Kip or you, Lee, but is there anything given at the point we're in now? I mean, we've come a little far down the line, right? We're hoping that we're actually moving out of this whole situation, but is there anything that we would have done different? One thing that comes to mind, for example, would we have taken on the task of feeding the whole Santa Clara County? I mean, are there any things that jump out at you all already? And if so, how is that sort of helping us adjust as we move forward and dip into other commitments.
Yeah, there are always things that one would do differently, and there are always things that you learn. And we take an action reflection model. What would you did right? What did you do wrong? What would you do differently next time? Specifically to your question of feeding countywide, that is not one that I would do differently. You know, I have spent the first 10 years of my career in West, North, and Central Africa, and have been in cities which have suffered food insecurity, and that is bad city management. You do not want to be there. And so part of the decision that we make is we knew that the county had to focus on healthcare and public health, and they were very concerned that if they did not flatten the curve, they would be completely overwhelmed with that. And they knew that the only city in this jurisdiction that could take that on was us. So they asked, we said yes, and that is not a decision that I personally regret.
Yeah, that was just an example, Kip. I certainly think it's wise to be in that, right? A lot of these residents are our residents. I know it's countywide, but yeah, I totally agree with you. I just threw that out there just because that's what came to mind. But
yeah, there's a
okay,
lot
good.
to learn.
Yeah, certainly. And I assume that when all this is said and done, there's going to be a post-mortem of sorts, and we're trying to figure out exactly what transpired, what didn't, and what worked and what didn't.
You're correct. We'll do a formal, a formal after action report as part of this, and we're already working on that process now so that we don't have to wait till the end to learn.
Okay, thank you for all the work. I appreciate it.
Thank you. Want to really thank, again, the city workforce, the 631 members who are in the EOC, and all the many others who are doing everything they can just to keep the wheels on. And I appreciate Dave recognizing the finance team, because if it weren't for their refinancing at City Hall, we'd have another $25 or $26 million of services to have to cut. And Reggie Roberts is also a great choice, in addition to all he does to keep our communication moving in the City Hall. He really lifts the spirits of everyone he greets. So I appreciate that very much. I just want to start with, I think, something that Councilmember Esparza said, which was really important, I think, is the importance of proactive isolation. I think that was implied really through questions, that we can't just hope that people are going to figure out that they should call somebody to try to get into isolated housing if they live in a home with 3 other families. And obviously it's incredibly hard. But the challenge we face, as I understand, Kip, is we don't know who's positive, right? Because we don't get the test results. So is there any communication from the county to the city about who's COVID positive, or is that a HIPAA problem? And do we have to just hope that the county will identify people?
We don't get that information. We rely on the county for that. And to date, it's been very difficult to get that sort of level of coordination. They have done some coordination on the housing, but as is evident from what was mentioned by Councilmember Esparza, it's not necessarily a proactive approach to this. So that's something that's been very difficult for us. The only good news piece is that they have brought back in Marty Finsterscheib to bundle this together and lead it. He has reached out. We've reached out to him. Thanks that you've connected me with him. He has been very responsive in the last several days as he and I have gone back and forth and discussed a number of items, including the supportive isolation. And we have a meeting with him and his team coming up on this. But to date, that's not the information that we get. We don't know where these cases are any more than anybody else does. And so that puts us at a disadvantage of being able to be proactive.
Right. And I appreciate your desire to form this one team approach. And I'm hoping that's where we'll get in terms of being able to be proactive with the county. Also wanted to mention, I think, Councilmember Crosco also made a very good point around this. We really need, we need to obviously have the housing for people to go to. I know we're doing the best we can with the motels, and I'm actually very impressed that we've moved more than 1,000 people off the street into the various shelter spaces on a temporary basis, in addition to permanently housing 400 people during a time when everybody is scrambling. I think that's an enormous amount of progress. And the 1,032, I think, is the number have been sheltered at this point. What I've heard from my colleagues in the cities, it is brutally hard to get folks to accept anything that does not look like an apartment. If they don't have a key to a door that can be locked, they have their own private space. And so it's a lot of hard work, and I appreciate that we've made some progress. I do know that there are challenges. I agree that the encampments are growing. I have a few theories, but I have no facts. But I do know we're going to have to keep pushing hard. And I'm hopeful that as we're getting prefab housing built, I know one of our projects is just started. I think it's 3 weeks from completion. I'm hopeful that that may be a site where we can isolate people. Ultimately, we get to the point where we're at a level of staffing with the county and contract tracing and so forth that we're able to isolate folks. Kip, you said that the county's capacity is now at 25 cases daily, which would actually be more than enough to cover the number of people who are testing positively each day. But I recall seeing in the Chronicle that they only had 50 staff dedicated to this, and that doesn't sound like enough staff to cover 25 cases a day. Have they boosted staff substantially recently?
I'm not aware of what their new staffing numbers are. That hasn't been shared with me. We've just, that's the estimate that they provided in terms of their capacity. So I'm not sure if that's, I know they've been augmenting their folks and they have been training new people in contact tracing. There's some of these 20-hour courses Johns Hopkins and others have done. So my impression is that they have been adding staff to that unit, but I have no sense of what the size of that unit is. And that's really an impression from reading the newspaper as much as anything.
Yeah, I understood. I know we're trying our best here. The contact tracing apps, I had a conversation with Mayor Tubbs yesterday in Stockton. He was under the view that the governor's office is no longer pushing a statewide contact tracing app that everyone should subscribe to, that they backed off of that. Are you hearing something similar?
Yeah, my understanding is that the focus of the technology work statewide is really on integrating some of the data reporting efforts into the what I would call antiquated public health reporting systems. Because part of, for example, at the county level, one of the staff lines that they have is about 65 people to do data entry. In this day and age, nobody should be doing data entry. Data entry should be done automatically. And so part of what the state seems to be focusing its tech efforts on piece, I have not heard of a standardization on a statewide app, tracing app.
Okay, we'll follow up with their team. Lee, I just want to mention, we'll be talking to the FEMA administrator tomorrow at 8:30 p.m. So if you have questions that you really want us to push, please send them to me and Scott.
Great, thank you.
And then a question on that very extensive chart you have about the 278 million in costs. I understand we've got 178 million in CARES Act, at least for some of the general fund type of, well, more the flexible sources. I know we've got different pots for airport and so forth. When you come back with that in our next report, could you also tell us how much of that 278 million we realistically think we can get reimbursed through FEMA or are attributable to other pots of money, so we know really how much is left that has to get paid for with the CRF?
Yeah, so that'll be the source and use analysis that we need to complete in the next week at a high level. And none of that 178 million will actually be FEMA reimbursable. We already have the money in hand. So what the trick is, the 278 million, the grand total, the question is, what is FEMA reimbursable out of that 278? So then as we understand what's FEMA reimbursable and what's not, the what's not then falls to the 178. But technically we can't use the 178 of the coronavirus relief fund to match or have it also be reimbursed by FEMA. We need to treat it separately.
Okay, I understand that creates challenges. So thank you for that. Rosalind, if you're still on, I want to go back to something Councilmember Davis said. Don't we need to be above 100% if we're going to clear the backlog? Or you described this being at 85 or 90% on inspection rates.
Yes, Mayor, we definitely need to get back to our normal daily inspection count. Like I said, currently we're about 85, 90%, but you're absolutely right. We need to get back to full 100%. And perhaps we may need to go a little higher than that. However, I do want to also note that currently each day we are reserving inspection appointments. So if we get a call from a customer to say, hey, I'm now ready for my inspection, we do have that capacity that we're reserving and we can put them in an inspection appointment slot.
Okay, that's great. And of the 1,148 that are left in the backlog, Does that include scheduled and unscheduled? You have any idea how many are actually scheduled at this point?
I can follow up with that
Yeah,
information.
we
Many
can
of
talk
those,
offline.
yeah, many of those is that customers aren't quite sure when they're going to be ready to reschedule.
Okay. And the reason why we're not yet at 100%, is that because we got folks in the EOC or folks who are on COVID? I'm just trying to understand.
Yeah, we do have a handful of inspectors who themselves are considered high risk. So we are not sending those individuals into the field. However, we have assigned those inspectors to the video inspections.
Got it. Okay, so there's some constraint there, and video is still something we're working out.
Yes.
Okay, great. And then on the Verily site, Kip, I know there's a second Verily site at the fairgrounds. We don't get data directly from that in terms of usage.
No, we haven't been. They've been providing us data on the PAL site since we have been hosting them there, but we have not been getting data directly from the Verily folks on the fairgrounds site.
Okay. And I know that a big challenge is that folks, you know, if they're on the wrong side of the digital divide, they're not able to sign up. And I've had this conversation with our friends at Google about, you know, can we get somebody there with an iPad who can just sign people up on site to get them through the website and maybe help them navigate it. Are they close to that?
Not yet. There are a couple of hiccups for us. One is that the county has yet to sign an agreement with us that actually allows Verily to be on the site in the way that we need them to be, because we don't have an agreement with Verily. The state has an agreement with Verily to do the testing. So we've got a little bit of a hang up in terms of getting the county to sign on to the agreement that we need to continue the testing in that way. In Oakland, and Councilmember Carrasco pointed this out last week, in Oakland, there's a local organization called Roots there that has teamed up with Verily in providing a bit more sort of supported registration for folks who are on the other side of the digital divide. We've asked to learn more about that model, and we think that that's actually a model that we would encourage the county to adopt in terms of potentially hiring some local health affiliated nonprofits. Folks like Gardner Health Center come to mind, and others which are already doing this, which can help people through that registration process if they don't have the devices or in languages that they're not comfortable with. So we think that that's a model we'd like to advocate for, and that's part of what we'll discuss when we finally sit down with the county. But to date, we have not operationalized that. We would be open to doing that with Verily if they were open to doing it as well.
Thank you, Kip. Any other questions from council members who have not spoken yet? Okay, we'll move on then. Thank you to everybody on the team, Luz, Kip, Lee, and everyone who, Rosalind and Reagan, and everyone who's jumping in to help us understand what's going on. Okay, we'll move on now to the consent calendar. I have several items to be pulled. Councilmember Sparks would like to pull item 2.8. Councilmember Perales would like to pull item 2.18. Councilmember Arenas would like to pull item 2.19. Are there other items to be pulled? Anyone could just indicate by raising your hand. Okay, we'll entertain then a motion on the remainder, but before we vote, see here. Mr.
Move
Beek?
to approve?
Second.
Okay, motion from Councilmember Sparks, a second from Councilmember Davis. Mr. Beekman?
Can you hear me? Hello?
Yes. Welcome.
Thank you. Thank you. Let me look for my speech real quick. Thank you. To speak to item, what I think is 2.6 about the budget questions of the next few years. As it was spoken in good terms in March, to use concepts of equity and deficit reduction practices for government budget. Please remember, these are the meaningful good ways in how to focus and make good decisions for the different tiers of the city budget in the next few years. I feel consent calendar items 2.14 through 2.16 are issues of street resurfacing and bicycle pedestrian improvements that can be connected in their needs of technology, surveillance, and data collection. I hope the efforts to improve Vision Zero community safety last fall can remember how better openness and accountability with technology can add to local neighborhood safety and stability. as these practices are based on the ideas of peace and to end continual war related to shock doctrine, disaster capitalism practices. Open, accountable practices need to be treated as equals and not as also-rans. As always, it has an important role at this time in how to balance the questions of equity, neighborhood safety, and stability for the future of local communities. To conclude, if the current trees have to be removed in the Post Street alleyway downtown, I hope an all at once replanting and a more phased-in version will both be considered. Thank you very much.
Thank you. Mr. Kelly, I think you're probably wanting to speak on 2.8. We're going to get there in just a moment. Is that right, Paul?
Yep, that's right. Sorry.
Okay, we'll call on you in a second. All right, then on the remaining items on consent, Councilmember Esparza's motion, are there any council members who object to the passage of those consent items? All right, I'm not hearing any objection. So those remaining items, all the items other than 2.8, 2.18, 2.19 will pass. We'll go now to item 2.8. Paul?
All right. How's my audible? You got me?
We can hear you now. Yep.
I just want to say, first off, good afternoon, Mayor and Council. I'm Paul Kelly, President of San Jose Police Officers Association. First, I want to say thank you for all your efforts through these trying times. And I know that the police officers and the community are well aware of the efforts that are going in, so thank you. I support the exploration of interfund borrowing from the city's $2 billion investment fund to prevent devastating cuts to city services on a one-time basis. This is a practice utilized across our state to help struggling general funds weather economic storms. And Lord knows this is one. Ms. Cooper's recommendation against this sound fiscal practice disregards the findings contained in a December 2019 white paper from the Government Finance Officers Association on internal loans. The findings expressly advocate for appropriately structured interfund loans to assist jurisdictions in navigating through a financial emergency. Ms. Cooper is in fact a member of this association. So if the top professional association of government finance experts endorses interfund loans in emergency situations and other jurisdictions in the state of California utilize interfund loans to support their general fund in emergency situations, we are left scratching our head wondering why it is flatly disregarded out of hands by Ms. Cooper for the city of San Jose. We believe that a properly structured interfund loan should be made to support one-time programs, initiatives that preserve city services. You should do it. Thank you very much.
Thank you. Bob Brownstein. Bob, you may have to unmute your computer. Bob, we're still not hearing you. Oh, now we're hearing me. That's not right. The mute button should be on the bottom left. Bob, we may come back to you. Let me go on to our next speakers, and if you're able to fiddle with it, we'll come right back to you here. Let's hear from Gene Cohen.
Good afternoon. Can you hear me?
We can, thank you.
Thank you. Thank you, Mayor. This is Gene Cohen with UA Local 393. We have 3,000 working men and women that we represent, and we want to first just thank you for your hard work and diligence during these challenging times. I think we're all struggling to come up with creative solutions to figure out how to deal with the environment in front of us right now. And thank you in particular to Council members Esparza, Jimenez, and Arenas for their memo on this subject. We think that exploring the use of a portion of the city's $2 billion investment portfolio to protect critical services, support small businesses that are struggling, and to produce the affordable housing that's needed during this pandemic is the right thing to do for the budget and for the communities of San Jose. This is not an untested policy, and there are state law and city policies that allow for you to loan money to yourselves to meet a one-time need. The cities of Santa Clara, the county of Riverside, and the state of California are examples that you can draw from. You're the stewards of our taxpayers' money, and the city budget allows for you to use this interfund borrowing. It must be done responsibly, and it must be used for one-time items with a clear schedule to pay it back and a clear source to pay it back that includes interests. At this moment, everybody is struggling, and many people are looking for loans from banks and relatives to stay viable. San Jose should do not less by using a fraction of its multi-billion-dollar portfolio. This item before you is simply to analyze a one-time loan to address a one-time need during a once-in-a-lifetime crisis. Thank you for your consideration.
Thank you. Brenda Rodriguez? Welcome.
Hear me? Thank you.
Yes.
Good afternoon. My name is Brenda Rodriguez, and I am the organizing director for the South Bay Labor Council. We represent over 100 unions and more than 100,000 union members and their families in Santa Clara County. We would like to thank City Council members Arenas, Esparza, and Jimenez for their memos. They raised valuable questions, and we urge City Council and the City Manager to answer them so we can address immediate budget needs. The item before you is to simply analyze a one-time loan to address a one-time need during a once-in-a-lifetime crisis. We are in a temporary crisis, but if not addressed properly, it can have long-term devastating impacts. You have the opportunity to explore a short-term solution that does not harm our community, like excessive cuts to services. This is not the time to cut necessary services for working families in San Jose. We must get through this crisis with the most minimal impact on the local economy. We urge you to gather all the necessary information to make an informed decision on a one-time interfund loan. Thank you.
Thank you. Mr. Beekman?
Hello, can you hear me?
Yes.
Thank you. To try to add my 2 cents in, I'm sorry, my opinions, as in item 3.1, they can be a little shallow sometimes, but gosh darn it, I want to try to add, a good 2 cents and just a good thought or two to the process, if I can, if possible. My feelings on this issue, this was fairly nicely talked about in your budget stuff, budget public or council meetings last week. And, my only guess, and off the top of my head at this time, is that maybe it sounds like a good idea. The loan sounds like actually a really good idea, but maybe there's just a sense of wanting to wait a bit longer to see how things will be working out for, say, different federal packages coming through and stuff like that. So it's I fully understand this loan. Maybe if it's thought about in those terms, it can ease the tension of the issue, and we can prepare ourselves if it's truly needed, say in a month or two, that then it can be the time to actually go through with this loan process. Thank you for your time.
Thank you. Jeffrey Buchanan.
Thank you, Mayor and Council. Would like to support the Arenas, Esparza, and Jimenez memo. As numerous speakers have identified, again, this is just a memo calling for looking at the data so that we can take a clear and honest look at this issue. This is a pandemic. The pandemic is not going to expand long into the horizon. We don't know definitively how long, but a pandemic is not a structural issue. It'll come to an end. Again, this proposal is to look at one-time money. This is not about ongoing money. And per Mr. Kelly, in fact, this is a practice that many government financial officials have looked at in the past. Many of you know, in my past professional experience, I spent a lot of time in the Gulf Coast working with communities that were dealing with disasters. In fact, this practice of looking to interfund loans is used in many experiences in recent history around disasters, particularly around the delay in the incoming reimbursement from FEMA public assistance. As the presentation that was laid out by Lee Wilcox, the city is likely to see tens of millions of dollars in FEMA reimbursements. And so this is one of the tools that many jurisdictions have used in a disaster. In fact, the industry association, professional association Mr. Kelly had referenced speaks about exactly that context for examining interfund loans. And so with that in mind, given the enormous needs our community has for things like parks, for library hours, for ensuring that we have public safety officers in this time of growing need, it makes all the sense in the world to look at the facts of what a modest interfund loan could look like, and does it make sense in this particular scenario? Thank you so much.
Thank you. Rose Herrera, welcome. Hi, Rose, we're not able to hear you. If you could take your device off mute. Yep,
Yes, Mayor, I'm sorry, my hand is up for 3.5 and 3.6.
Oh, I'm sorry. Okay, thanks. Bob Brownstein?
Can you hear me?
We got you now, Bob.
Okay. Thank you very much for coming back to me. I'd like to speak in favor of the proposals by council members Jimenez, Esparza, and Arenas regarding using the mechanism of interfund borrowing. I frankly found Julia Cooper's memo in disagreement with this idea perplexing. The memo points out that the city's investment objectives are safety of invested funds, maintenance of liquidity, and attainment of an appropriate rate of return, and interfund borrowing meets all three of those objectives. It's hard to think of an investment that would be more safe than investing a modest amount, like say $25 million, into San Jose's general fund when the general fund is well over $1 billion. And the city is well managed. I mean, for that not to be safe, the city would be facing an apocalyptic fiscal crisis in 2 or 3 years. And if that was the case, certainly the budget staff and the city manager would be alerting us to the enormity of that problem. They aren't doing it because it's not a realistic fear. In terms of liquidity, no one is suggesting that the city should issue more notes at longer maturities, but simply investing the ones that are already for longer maturities in a different place, in an internal fund rather than an external agency. And in terms of the rate of return, the investment department can simply say this is what the appropriate interest rate will be, and the city's general fund can pay that amount. So all three objectives can and would be met, and there would be funds available for the very kinds of things that the mayor and city council and staff have been talking about for the past 5 hours. Thank you.
Thank you. We have someone who's calling in by telephone with a phone number ending in 1367. Welcome.
Yes, this is Lillian Dev Davis's district. I was just listening to the other gentleman and it was kind of complicated, but if you want to flatten your curve, and this is Affordable Housing Month, and the Housing Authority stated that they don't have enough shelter or motels, if you really want to dis-isolate, if that's even a word, because I don't feel like isolating in the fall again. I have isolated for 10 weeks, and I am tired of isolating. I live in zip code 95128. That's pretty close to those zip codes that have a high incidence of COVID-19. Please borrow some of that money, open up whatever you have to open up, do your contracting, put pressure on the county, get those people where they need to go, and open up your city. Thank you.
Thank you. Okay, returning to council. Councilmember Jimenez.
Thank you, Mayor. I just want to first start off my comments. I do have a few questions, but comments. Specifically, I wanted to touch on something that Julia, and I appreciated the memo, Julia. I think it's page 4, at the beginning of the analysis, you state that in the spirit of looking under every rock to close the general fund forecasted shortfall. And I just wanted to nail down on that because I think that's, I just wanted to express to everyone that that is really the spirit under which this was submitted, at least from my mind, right, is to try to figure out if there are other ways to help dig ourselves out, at least temporarily, from the challenges we find ourselves in. So I very much appreciated that statement in there. So just a few questions, just so I can better understand what we're dealing with, and I understand this is likely a complex issue, and there's likely some things within this existing policies and such, Julia, that maybe I don't quite understand. And so the first question I was going to ask, because there seems to be a distinction in what's happening now in the economy. I know there's some differences between cyclical downturns and structural sort of deficits and such. And so I guess what I'm trying to understand is, and maybe someone from the budget office or city manager's office can touch on this, but what would be the definition of where we find ourselves today as a city?
Dave, did you want to answer that first?
Yeah, so let's, I did want to take the opportunity just to kind of do a little context setting here. And certainly, I'm not the fiscal financial expert. We have some pretty phenomenal staff that Julie and Jennifer and others that can help. But, certainly, Councilmember, I do appreciate, the way you posed the question and the wording that was in the memo, that I think that's the way we took the memo that came from yourself and others, just trying to make sure that we are examining every opportunity. And so that is the spirit that we took it in. I think everyone knows that, that memo came out on Friday and we used the weekend to evaluate and tried to put out a written response just because this subject is pretty complex. And it just seemed like trying to answer the questions verbally would fall short. So, I think we did our best to put out a written staff report that went out yesterday afternoon. And I think Julie and Jennifer and others are probably better positioned to kind of answer some of the specific questions. I think for me, as I've been around for a long time, I do know that there are things that set our city apart from other cities. And one of them is an extremely unfortunate fact that we just find ourselves to be in a chronic shortfall scenario with the general fund. And so it makes us pretty cautious to take on more debt that we'd have to pay back later. I do think some of the clarification around kind of looking at this as a solution to one time versus ongoing, I think that obviously would be a much more prudent approach to how we would deal with this. Ultimately, it's important that you all have access and hear from our experts and factor into your decision making on how we should proceed. But ultimately, we stand ready to take council's direction.
Yeah. Okay, I appreciate those comments, Dave. I also think that it's, one time would be the preference. As it's, I don't think, I'm thinking back to everything we wrote in the memo, but I don't think we actually outlined exactly what we would want to use the money for, right? So we were just more to it seems to me, poking around the edges, trying to figure out if this is a viable option, right? And obviously, Julia, you provided the perspective in the memo. But going back to my original question, I mean, would this be viewed differently if this was, actually, let me not ask that. I guess I want to see if someone can give me an objective sort of perspective. And this is a very open and honest question that I don't know the answer to this, right? Is that, are we in a cyclical downturn? And I know we're in strange times, right? Or is this a structural type of thing that we're dealing with? And I'm trying to wrap my head around exactly where we are as a city, right? And I'm sure the pandemic and this seemingly unnatural downturn in the economy really, I know, for example, when we're looking at budgetary models, there, as I've heard consistently, there are no models for what's happening now. And so I'm trying to better understand exactly what the view is of where we are. And if the fact that we're going to have budget deficits over the next 3 or 4 years, whatever, no one really knows, if that would fit the definition of a structural deficit. I mean, when does it become structural, I guess, is what I'm, and are we in fact living with that?
Councilor, let me see if I can take a shot at this. This is Jim Shannon, the budget director. So, I think that, like you said, there are no models for this, but we do know that this is a recession caused by the pandemic. We also know that pandemics have an end. Even this one will eventually have an end. One of the problems is we don't know when that will end and how deep the recession will be that will cause it. But as recessions end, where the recession ends at, it's going to take the city a long time to get back to where it was on a revenue basis prior to the recession beginning. Meanwhile, our costs are going to actually go up. And so our costs aren't going down with the revenue. They're either going to, a small portion of it will stay the same as much as possible, like our supplies as much as we can, and our materials and some contractual costs. But by and large, those costs will creep up too, as will our labor cost and almost certainly our retirement costs. And so as we go through these next few years, as the recession ends and we start to come out, it's going to take a while for our revenues to catch back up. And even when they start catching back up, our costs will have outpaced them. And so we will be at a point where over the next few years, we're going to be like we were in the recession for the dot-com era, which we never really came out of. We went straight from deficits in the dot-com bust to deficits in the Great Recession. We're going to be sort of grappling with an ongoing general fund shortfall for the next few years in all likelihood. And so that's why we view this, even though it's caused by this short-term event, it's going to translate into a longer-term economic impact that we're going to need to think about in an ongoing basis.
Yeah. And well, I think
maybe helpful.
Yeah. Thank you. And I think that speaks to the one-time nature of doing anything of this nature, right? I think it'd be important. Certainly, I'm not interested in funding anything, out 5-6 years. But anyhow, so thank you for that. The other question I wanted to ask to better understand this, I tried looking back at past CAFRs. It's a 300-page documents, but I went to the pages that showed inter-fund transfers or inter-fund loans and such, and I didn't see a whole lot of them. But I'm curious as to how often we've done this, Julia.
Julia Cooper, Director of Finance. Not very often. The most notable, my recollection is, with respect to an inter-fund loan, was back about a decade ago when the state was looking at dissolving redevelopment agencies. And as part of that, there was 3 special funds that loaned money to the redevelopment agency in a total of $10 million. And as a result of disillusionment, those funds needed their money back. So actually those loans had to be converted from a loan from the general fund to the redevelopment agency. And we just recently got paid back those loans. Yeah. So that experience was not very pleasant with respect to the way it turned out and how long it took for the repayment to happen. So there's maybe been some loans for relatively short periods of time, like inside of a year, but nothing as long as those redevelopment.
And the money, as it was flowing in that particular example, was going from the general fund to this other account, right?
No, initially it was from 3 separate city special funds, and then they had a call on that money. They needed their money back, so the general fund had to step in so that those other funds could get their money back. And that's one of the conditions of a short-term loan, of these inter-fund loans, is when the funds need their money, the money is due and payable at that moment in time. And all these special funds do have a plan for the use of their money, whether it be the regional wastewater facility, the airport, the housing funds. They all have an ultimate need for their money. So to the extent there was a delay from the general fund being able to repay this, they would have to be cuts in order to replenish those special funds. So that's one of the key components of an interfund loan. Is it's basically, you can set out a payment schedule, but if they have an issue that requires a need for those funds, you need to pay it back, and they make a call on it, so to speak.
Even though the maturity would put us out, say, 4 or 5 years. I mean,
yes. It has to be due and payable when the funds need their money.
And maybe I can add, just from my experience of being the budget director during the portion, at least I was assistant budget director during the dot-com bust, and then I became the director at the latter part and into the entire Great Recession. We actually experienced shortfalls during those 10 years of about $700 million in the general fund. And to my recollection, we never did an interfund loan to do that because we could never identify a repayment source within the general fund because every year we were negative. And we had these chronic shortfalls, obviously very severe. 3 years were very, very severe in the recession. And obviously the buildup of these shortfalls over time just made the service reductions even that much more impactful to our community over those time periods. But what we did do, which is an option that we have used, is not an interfund loan, but we have done transfers to funds that are considered general purpose funds that are legally available to us to transfer to the general fund. And we've done ongoing transfers. The problem is that one of the funds is the construction excise tax fund, which by council policy has been generally used for the traffic capital program and to pave our streets. So that is an option out there. The manager did not put that option on the table to resolve this shortfall. That doesn't mean in the future that might not be an option that we may want to explore. There's also the general purpose parking fund, but there's obviously calls for those types of monies for other purposes because we've got infrastructure problems in those areas. But those have been things where there was no required payback, and we were able to use that as one of many funding strategies. We are concerned about the ability to, in the memo, we're talking about one time right now, but we're not sure what one time we would use this for specifically. And we obviously are looking at other strategies as was discussed in 3.1 today, but to potentially use some of our CARES money if we can. It was discussed more about preserving services, supporting small businesses, and develop affordable housing, which are all really important things to do. And we in the administration do not want to cut services any more than anybody else, because that's what we've signed up to do, is to provide services and help our community. But the lack of the ability to identify a payback mechanism also by potentially it could have a negative impact on our city's credit ratings. Those are two of the major concerns that we would have about that. And given that we believe we have an ongoing problem here, and it was notated in the forecast even before this pandemic hit, if we had we had 3 scenarios plus a recession scenario in the forecast, and that we saw that we just had the biggest economic expansion in U.S. history. We knew something was going to happen, and it's probably going to be a multi-year problem. This pandemic just accelerated that. Okay. So just want to give you some history on how that we really have not used this as ever. And the last time I remember borrowing, it was exactly the scenario that Julia discussed.
Okay. All right. The other thing that frames I'm thinking around this is that these are unprecedented times as well, right? I mean, I saw a footnote in one document that we were reviewing recently and talked about the unemployment rate at the height of of 2008 or so, and it was at about 10%. I think right now we're at about 15 or so. And I'm sure if we disaggregate that, it's going to be in certain parts of the city. And so anyway, so these are extraordinary times, I think, and that's why I was interested in venturing down the path and really just exploring some of this. And so just 2 additional questions. One is with all the comments that have been made, do the credit agencies treat transfers similar to loans?
You mean the transfers that Jennifer was
Yeah.
talking
So the
about?
transfers as opposed to the interfund loans, because there seems to be a distinction there.
If it's a transfer and there's no anticipation of a repayment, then no. But if it's a loan, they look at it and treat it to some respect as debt, depending on how long the loan is for.
Yeah, we never considered those transfers as we never paid them back, and they were never considered to be in a payback scenario.
Okay, all right. And the very last question I have is, I was looking through some of the documents that were released with the SIDEM, the investment report for the quarter ended March 31st, 2020, on the bottom of page 1, Julia, and it's the memo dated 5/8/20. It's at the bottom, you go through some summary of the portfolio performance, there's a bullet there that says fiscal year to date net interest earnings. And I was looking for a policy somewhere on the web page for the finance department or the budget office as to what does policy say as it relates to the net interest earnings from those funds?
The interest, to the extent that they're special funds and the fund is, so for example, the interest earned on the airport fund stays in the airport fund. There are a few funds in which the interest is transferred to the general fund. Jim probably knows better which ones those are, but they're few and far between. So basically, we allocate interest based on the percentage that a particular fund has in the pool during the during the month. And so that's how we allocate interest. So if the airport has 30%, then they get 30% of the interest earnings during the month.
Okay, so the $35 million in interest for the year, as stated at the bottom of this page, again, page 1 on that memo, that is just a sort of a bucket of all these different funds, right?
Yeah, and it's allocated back out to the general fund and all the special funds on a monthly basis. And as part of the budget development process, they assume a part of interest earnings as part of the source of revenue that they have during the course of the year in order to make their expenditures.
And has the city in its history ever, diverted some of those earnings to needs that have come up during the course of a recession or downturn?
I don't think we have, to my knowledge, anything that the city managers recommended in my 26 years in the budget office. But what I do want to point out, because these are very important questions, and they have definitely come up before. We have a budgeted funds guide, and it needs to be updated. I think the budget office was going to update it this year until the pandemic hit. But it substantially covers all of our over 100 funds that we have. It's on the city's website and the budget office, and it talks specifically about each fund, because we had a lot of questions about this. This is important education for our community and for all of us about what the restrictions on each fund are. And we work closely with the city manager's office, works with the city attorney's office and the finance department in developing that document. It's a pretty easy read, kind of about a page or a page and a half per fund that you can look at and peruse through and see what the different funds are, what the restrictions may be on those funds, and our ability to, if they can be transferred or not be transferred. It's all outlined in that document. So it will be something that we will get updated for you to get any new funds we've added, but it's a really good reference point. Just I want to point that out for the council.
Okay, wonderful. Thank you. I'll stop asking questions and let the rest of my colleagues ask questions. Thank you so much for the answers.
Thank you. Councilmember Arenas?
Thank you, Mayor. So I do have some questions, but I just wanted to say thank you for helping us figure out all of the strategies that we can use during these difficult times. I think the three of us who are on this memo, we've not been in or lived through some of those difficult times. Jennifer, you have. Julia, you probably have as well, Mayor. So you've seen this strain on our community. And even when I started 4 years ago, I think we were still seeing some of, excuse me, I'm sorry, my kids came into the room. So we were still trying to support our community from the losses that they had experienced during the Great Recession. So nowadays, I think, and that was the spirit, and thank you, Councilmember Jimenez, that's what we were hoping to obtain, is just more tools in that toolbox. I know just families in general, if they've lost their job or if they have reduced hours, they're trying to reduce their own expenses, right? And either if they own a home, they're refinancing their home, or if they have retirement funds, then they might borrow against their own retirement and pay the interest on top of that. And so, I saw it in the same way that families deal with hard times, that we can also deal with hard times. And so I don't quite understand why some cities are actually loaning money to themselves. And even the state is doing this. I think I think, excuse me, I think it was in the May revision, there was, I think, 4.1 billion from special funds borrowing and transferring. And so, you know, California is the fifth largest economy. That I'm sure our credit rating is reflective of that. Why would our state do it and not ourselves, not the city? And I know that in your memo you stated like one of the examples that you actually have about our pre-funding is like the pre-funding of the retirement contributions, and you used a tax and revenue anticipation notes, which are short-term cash flow. And so I think the payment has to be done within a year. So it has to be short-term repayment. And we have to, I think part of the issue that in our memo, we didn't say how we would pay back any interfund lending. We are in a crisis, in a pandemic where we have CARES and FEMA money coming in. We just don't know when. And so why wouldn't we be able to use the CARES money or the FEMA money while we wait for those payments to come in, for those reimbursements to come in? Couldn't we use something similar to what the trans is in what you're doing with the pre-funding of the retirement contribution?
And if I could, council member, and I certainly want to let Julie and Jennifer kind of jump in here. I guess I'd just share and elaborate a little bit of what I said earlier. One of the things that makes me cautious is that I know the state and other agencies, you know, with the economic cycles find themselves with pretty significant surpluses, which we never find ourselves in. And I do think that's a dynamic that sets us apart. You know, so should we be looking at these things? Yeah, absolutely. But I just, for myself, you know, I think, and having gone through what we've gone through over the years, you know, I think there's reasons for this city to be cautious about this type of approach. It'd be different if we got, you know, receive the benefits of the economic cycle like some of the others do, where we can count on these surpluses in the future to kind of help us get through the valleys. It seems like we never really see the mountains. We just see the lower valleys. So, you know, that's my layman's terms, kind of the caution that I have around this. But I'll ask Julia and Jennifer to, you know, provide maybe a more thorough technical answer.
Dave, and I appreciate that response. I get that. I mean, you know, we do have a reserve for rainy day reserve that we've been contributing to, at least in the last couple of years. I know for sure that I've been on council. But in any downturn, economic downturn, we know we have to reinvest in our city to actually get it going. That's why I heard a lot of my council member colleagues talk about development. They had a lot of development questions, a lot of construction questions, because we want the economy to get going. We want to build in some more revenue coming our way. So, I mean, it would stand to reason that we would want to also invest in our community in the same way. So, Julia or Jennifer.
I just to kind of clarify a little bit on the trans, is that they do have to get repaid within the fiscal year in which they're issued. And the reason that we use them for the retirement pre-funding is we're basically advancing an expenditure that we would make during the course of the year and then repaying it over the course of the same year. And so it's just, and then by doing that, the retirement fund gives us a discount and we save money, and the general fund being balanced to the tune of over $7 million because of the pre-funding proposal. So that's why we use it, is because we don't have all that cash up front with respect in order to make that prepayment. So that's the distinction there. And we have to pledge property tax revenue to make that repayment. So it's very specific within the fiscal year and the property tax money that comes in during the fiscal year. And it's offsetting an expense that we would have made otherwise. We're just accelerating it. So that's kind of the difference there. And to kind of touch on what Jim was saying, you know, I've worked for the city for just now a little over 33 years. So I've seen a lot of recessionary periods. And the caution that we have with these short-term loans is that we don't know what this recession is going to look like, as Jim pointed out, coming out of it, and how deep we'll be with respect to our revenues down compared to our expenditures up, and how do we identify the source of general fund money to pay back the loan, and when can they pay it back, and the requirement that the funds have to make a call on it at any point in time. And that's just why we're so cautious about doing this as a tool to solve even a one-time budget issue during this time, given the level of uncertainty that we have.
And I'm just going to add on one more thing about, because I think, what your points, council member, about us having our rainy day fund or our budget stabilization fund is a good one. The council has prudently set aside monies for these times, and so we can smooth out or take some time to transition services so they can not be as an abrupt cut to our community if we need to. Back over the years of I keep calling it the decade of deficits, we had a similar fund. It was never as healthy as the fund that this council's put together. But we did use it. We used it cautiously, and we eventually drained it. I think we replenished it when we could with a few $1 million of extra fund balance from an annual report, and then drained it again. So we kept using it as one of our levers to help when maybe a cut was just too severe or we wanted to wait out the time. So kind of similar, but that is a one-time funding source for the budget. The administration has only recommended to use $5 million of that reserve in this budget balancing, given where we feel that we solved 55% of the shortfall with things that were not cuts. So we felt like we did a good job in that regard. Luckily, we had that extra sales tax money. We did the pre-funding, we paid down some debt, we had some fuel savings, and we unfortunately obviously have to do some service reductions. Also have a scenario where we're not laying anybody off, we're cutting mostly vacant positions. Obviously the round 2, if we have to go there in the next fall, that's going to be much more severe of an impact. We feel it's prudent to save that money, and because we do not know the length or the depth of this recession, and we would rather start out more cautiously. And that kind of budgeting has served the city well. We've considered a very well-managed city because I think the council's always been very cautious and prudent in that kind of scenario. And we made it through, over the years. Yes, we had really bad budget reductions, but that's, cumulative of years and years of cutting. There's no choice but to do that. But I think that, that is an option. And I would much rather recommend that if that was a decision point, you would not loan money, you would use a little bit more of your reserve if it came down to that. But again, the administration's recommendation is to keep most of that reserve intact in this budget, but that's for your deliberation in the coming weeks.
Right. Well, I mean, I think the best fit would be CARES money, because we know the reimbursement is coming. It's not like it's unknown. It's not an unknown factor. And that would, for me, it would be to prevent a lot of this round 2. I fear that it's just going to be really deep, and our community is going to be really impacted in that way. I mean, it's already being impacted. So, the spirit of this memo is to really discuss the options that we have. And I found, although your response was 10 pages long, and I am not a financial expert by no means, and so I had to really read sections over and over again. And so for me, it's about learning what are some of the tools, because in the end, what I read was, to not consider this interfund loans as a strategy, which wasn't what we had originally asked. What we originally had asked was to take a look at, and it was meant to look at all the options to get us through this difficult time, and to explore all options, and to learn more in particular about this strategy. And so I guess I like to know what is, if interfund lending could work with the CARES money, how could it work? Now, Julie, you're saying the trans notes are not that's not the way to go, right? Because it's you have to pay it back in the fiscal year. Do we think that the CARES money or a reimbursement is not going to get, I mean, we have to use it by the end of this year. I think Rick, you want to
Yeah,
say?
I want to clarify something, and this may be part of this. You know, we've talked about this in the context of the COVID response, and there's two different buckets. You've got the FEMA money,
right,
which is in part advanced, but for the most part is reimbursed. And then you got the CARES money, which is money we've already received. So we have $178 million in the bank.
Yes, yeah.
There's no CARES Act money that's going to be reimbursed.
Yes,
and the Treasury regulations specifically limit it to COVID related expenses.
right.
And specifically say they can't be used to replace lost revenues. So we have to operate under those limitations. That's why I think the CARES Act money is a problem, just simply because under the Treasury guidelines, it's not eligible.
Yes, and I actually stated what you just said earlier in the COVID response update, which was I recognized that FEMA only was reimbursing the EOC operations and PPE, and the CARES Act was reimbursing everything or many other things. And so I think I just misspoke when I said CARES. Just replace every time I said CARES, just replace it with FEMA, and that's what I meant. So, if we take the FEMA, and we haven't had a reimbursement just yet.
So I think Sylvia, with the CARES Act, we've got the money in hand. We will be recognizing that money. We'll give you our recommendation through the MBA very shortly here next week. And I think that's going to help the council out a lot. As the city manager said, marry up the budget and the COVID and how can that affect services and all that good information that you need. The FEMA money, which is reimbursable, I don't think we've received anything yet, but I'll defer to Julia or Luz. My experience with that is it can take years to get reimbursement. Sometimes we get subsequent audits for that. It's not something that it's like this CARES Act money is unprecedented that we got all that money up front, which is really great for the city. But the FEMA has been a different story through my experience. It's taken years and years sometimes to get all of our reimbursement back. So I don't know, Julia, if you can talk a little bit more about the FEMA experience from your finance end.
Yeah, we haven't received the advance money yet that we put the application in for a week and a half ago. But to use the 2017 flood experience, which those expenditures were mostly related to repairing capital as opposed to dealing with an operating expense. But we did, because of the delay and the time between insurance proceeds and FEMA, the council authorized the use of the city's commercial paper program to advance the money needed for those capital repairs while we waited for the FEMA reimbursement, and then have been repaying the commercial paper with the proceeds of the FEMA coming in. Little different because we're funding capital versus operating, but it was a way that we used short-term borrowing to create that bridge essentially between getting the insurance and FEMA proceeds in, and then ultimately, paying for the capital projects when we need to get them done.
And this is Kip, just to weigh in a little bit, to be clear, we are still working on those reimbursements from the 2017 flood. We have not been fully reimbursed for our costs on all of those, to give a sense of how long this takes with FEMA.
Mm-hmm. Yeah, and I think there's I have read in a white paper about the borrowing from FEMA, and I think FEMA has a community disaster loan program. Is that something that we've looked into?
No, but again, I think those types of programs with FEMA are more related to when there's been some kind of natural disaster and you're doing capital repairs. So it's you're replacing a road, a bridge, community center, those types of activities.
Got it. Okay. Well, it's always good to look under every rock possible, for sure. That is exactly what I'd like for us to do. And I'd like to see more of an example of how we can, how our budget office can support some of the policies that you've heard many of us raise in the last couple of weeks, especially for some of the population that is very much impacted by COVID and is dying because of COVID. And, you know, I don't know that any of those folks are going to care whether there's reduction in services and city services, or if our credit rating isn't going to be great, because they're going to be dead. And that's what it comes down to. Is it really is about making sure that our community continues to be healthy, to be thriving. And so I rely on you, Julia, and of course Jennifer, and Dave, to lead us to think about really outside of the box thinking. You know, I've used some examples maybe that are not going to work, but there's still like the eBay fund. There's still some options there, and I don't know that we've explored everything. I think your memo said not to do this, but it also takes it completely off the table, because it says do not consider interfund loans as a strategy to close the projected ongoing budget shortfall in the general fund to preserve city services, support small city businesses, and develop affordable housing for the reasons outlined in the supplemental memorandum. Now, if this gets approved, you know, you can, you know, you've painted yourself into a corner, because it might not be for this particular COVID response incident, but it might be to preserve future city services in different ways. And so I don't know that I would completely support it the way it's written, but I like to make a motion to move the memo. Although this is a report, so how does that work, Rick?
Rick, I think you're on mute. Rick, you're on mute.
He's trying to fix it.
Oh,
I
okay.
unmute myself. I pushed the wrong button. You can make the motion on this. It is a report, but it's a report out to council. These reports typically go to the Public Finance Committee, and it is for Public Safety and Finance Committee. And with COVID, it's coming directly to council. So you're considering the report, and this is something that you're proposing, and you can direct staff if you want to come back with the information you're requesting in your memo. So it's an appropriate motion.
Great, then I'd like to move our memo. Thank you, Rick.
Second.
Wonderful, and I think that's the end of my questions. I would really like to see what is it that we can do with, and what are the tools are available, and what is it that we can do versus, you know, this is something that's off limits, even though many cities in California and our state is doing this, and I get the surplus piece of this, but I'd like to see more options available to us. Thank you.
Thank you. Councilmember Esparza, were you the one with the second?
Yes.
Okay, great. And you're up next. Thanks.
Thank you. Thanks, Mayor. So I have some questions. So Jennifer, did I hear you say that correctly, that we would rather spend down our reserves than pursue an interfund loan?
If I had the choice between the two, I would, because you're going to have to pay that. You're going to either pay directly with the cash of your reserve, or you're going to have to. You can use that as a potentially, I guess, a repayment if it's a one-time transfer. I mean, one-time interfund borrowing, but you're going to have to pay interest on that. So why would you incur the extra expense of interest? I think that, you know, again, tools that we have used, and kind of going back to Councilmember Reynos's question, is we've done transfers, direct transfers, where we never had to pay them back to those other funds. So there was never could be a call. we're not recommending that right now because of, our pavement condition and other traffic calming and all the, and frankly, the construction excise tax has also experienced some lower revenues as well. But that is a general purpose fund that can be used, and that's a choice the council can make. But again, they'll come with consequences to other funded programs that the council may want to pursue that are being funded through that fund. There's also the general purpose parking fund. Those are the two general purpose funds that are in the special fund world that come to mind that you could transfer money from and not pay back. And so it's the loaning part that is what we're not recommending. If you did a transfer and that is an option for the council. That's a policy call, or using more reserves if you're unhappy with a certain part of this budget, which of course you're not happy with probably most of it anyway, because obviously it's not the budget that any of us wants to put out. But those are options that you could pursue that I don't think there weren't our recommendation at this juncture, but there's certainly policy decisions the council can make. I worry about given at this early stage, and the experience of going through this for 10 years, and hopefully we don't have that experience this time, but we just don't know. Having some of those tools for down the line, like our reserves, to be able to use them if it gets worse, that will be helpful. Obviously, I think this, what we do with this MBA, with the CARES Act money, will be helpful to the council, like I said, so we can see ultimately how does that marry up our budget with our budget actions. I think that will be helpful to council in your decision making. And I'm sorry we don't have that for you today, but you will get it next week, well before you have to make decisions about the budget. But interfund loans at this point, we do not have an identified payback mechanism, and it would be more, especially within a year. That's why we're not in favor of that at this juncture.
When will we get that MBA? So I've heard next week repeatedly. What day do you think that will come out?
Next Wednesday.
Wednesday. Okay. Thank you. So are all the loans made from the reserves, all the investment? So all the investments and the loans made from reserves, are those all callable then?
Yeah, the way the policy is written is that if you make a loan from one of the special funds to the city's general fund, the special funds need to be able to make a call on that at any point in time. So even when you set up a loan agreement and says the general fund's gonna pay interest and they're gonna pay it back over some schedule that's determined, if the fund were to need the money for a reason that the fund would need it, you would have to pay it back immediately. So let's just say, for example, you borrowed from the wastewater fund and there was some catastrophic event that happened there. There was a capital project that they needed to appropriate money for right away. They could call on the loan because they would need that money in order to do that. So that's the issue here is that a lot of these special funds in and of themselves are experiencing fiscal stress because they are tied to the economy as well. So, their downturn could end up being, worse than it was originally projected, and they need the money to spend on the purposes in which the fund was established.
Sure, and I think that's one of the reasons why the eBay fund seemed like an attractive option. I wanted to ask
my council member, the
Sure.
eBay fund, it's not a separate fund. It's sales tax money that's in the general fund. Jim or Jennifer can correct me if I'm wrong, but it's not a special.
Oh, it's not kept as a separate fund
Right.
within the jail. Okay, so within.
Yeah.
Okay. And I had another question that if FEMA reimbursements, because I actually read the white paper titled Internal Loans and Emergency Situations by the Government Finance Officers Association. I thought it was really interesting, and timing was interesting because it came out in December 2019, just before this all hit, and it specifically talked about the use of interfund transfers by local government in disasters, and talked about FEMA and borrowing, and it talked about the FEMA fund, but also if FEMA takes so long, doesn't an interfund transfer become more attractive in that sense? I mean,
Well, and as I kind of briefly just mentioned earlier, our experience with the 2017 flood, yes, it has taken a long time for that FEMA money to come in. And we've used the city's commercial paper program as an alternative to do that. But again, those 2017 expenditures were related to capital, the rebuilding capital, roads, the parks, things like that were destroyed as a result of the flood. Not in this case where we're talking about the city's general fund operating budget. And the debt policy really talks about not borrowing money to meet operating expenses. So that's where this is a little.
Actually, I want to correct you on that. The Community Disaster Loan Program talks about essential services. The program offers affected local governments direct loans to keep providing essential services or to expand essential services to meet disaster-related needs. So it is not for capital, actually.
No, I was talking about the city's commercial paper program.
Oh, okay.
That's set up to fund capital expenditures, not operating expenditures.
Okay, thank you. Yeah, and I mean, I appreciate my colleagues' comments. I think, given we are cutting public safety, in particular with higher ed. I know that I really appreciate all the hard work. I know this has been a really difficult process and it made even more difficult doing it in the middle of responding to a global pandemic. But given the fact that we have some cuts to services to residents, particularly in libraries and public safety, and the phase 2 that none of us want to have to do is kind of looming on the other side of the summer. It's one of the reasons why I have been so passionate about the CARES Act and the HEROES Act. I just think that in the spirit of what we're asking residents to do, we're asking residents to take extraordinary measures. I think we need to also consider our options. I don't think any of us are saying this is absolutely what we should do today, but that's the spirit in which we're bringing this up. Is we really need to. It's a disaster, right? And we have this next phase 2 looming ahead of us, and we owe it to our residents to be really transparent about the choices we're making and why, so that they understand what's going on, and that when we talk about interfund loans and interfund transfers, that this is a common practice that private companies also borrow from funds that cities make loans to, and those aren't callable immediately either. And so I just think we need to consider our options in this disaster. Thank you.
Thank you. Councilmember Perales?
Thank you, Mayor. And I appreciate the discussion and the quick turnaround from staff on the written response. I do think that was helpful. So I have a question. It sounds like we bake in assumptions on the interest earned from this sort of overall portfolio fund 3 that's in question. 99% of all of our money that we're putting in that's gaining interest. It's obviously all the accumulation of most every single fund that we're talking about. What happens when we get an interest return that is better than what we assumed? What happens with those dollars?
Well, we make the assumption on the interest earnings based on how much is in the portfolio and what we project our reinvestment rate will be over the course of the fiscal year. If we end up doing better than that, the interest that comes in each month is allocated to all the funds in the city based on their pro rata share of the pool. So if interest earnings are higher, then the special funds and the general fund just have more interest allocated to them during the course of the year.
And that interest is tracked, council member, as part of the bi-monthly financial report and our year-end position about how all revenues are performing in the general fund and all funds. And then they get all reconciled as part of the annual report.
And then if I could just jump on, those interest earnings are often budgeted as a source to help cover the cost of the expenses in those special funds as part of the budgeting process too.
Okay, so I mean, would we, it sounds like that's sort of baked in and we have a cushion there of sorts. Do we tend to be, far off on our assumptions and is there a dollar amount? Maybe Jim, you can help with how much in excess of our assumed interest earnings we actually get?
From a budgetary basis, I mean, I think we are, we just, the good news is that Julia's team is very good at their estimated rate of returns that are matching up what actually happens. And so, those interest earnings that we project in the funds that help, pay for some of those costs, they're generally pretty close. We like to be on the more conservative side than not. So those, but they, there's not as big wiggle room in terms of how much extra there is. The bigger variable is on the cost side. So for some reason, there's a larger amount of cash that sits around because the capital project maybe hasn't moved forward, then maybe we would see a little bit more interest earnings. So I think the variation is really more on the pace of the expenditures rather than necessarily on how the investment performs itself. Because again, I think Julia's team does a good job of keeping that very stable.
And just for context, for next year in the budget, the interest earnings assumption in the general fund is 5.9 million. So it's a pretty small piece of the general fund pie. It was, we're estimating 8.5 million in the current year, and it's gone down because I think, as Jim has explained, we're going to get a little less interest because of the retirement pre-funding.
And then maybe just I just did a little bit of looking. So for those funds that we can transfer the interest earnings to the general fund, so the estimate for that for 2021 is about $1.8 million.
And you're describing
that's part of our budget.
You're describing that as a transfer, which I think, right, we were talking earlier and saying how a transfer does not have to be paid back. That's not a,
right.
It's not an inter-fund loan.
Right. It's just a straight transfer from eligible interest earnings that can be spent for any purpose. And because of that, we transfer that to the general fund.
And we are doing that, is what you're saying already for this coming year?
Correct. Yes, that's part of our normal budgeting practices. Part of our base revenue estimates in the general fund is the transfer of interest earnings from those funds that are allowed to transfer those.
Okay, so in essence, what might be considered excess every year is transferred into the general fund for obviously our use and all other general fund purposes.
Yeah, I think we try to put as much as we can in the general fund that is supported by the needs of those special funds. So that's part of our scrub every year is are those things that are not specifically identified for a special fund purpose, can those be classified for a general purpose? And if the answer is yes, then we look to see if we can move those into the general fund because we know that's so constrained.
Okay. And in regards to an inter-fund transfer, an actual loan here, it sounds like there's not just some, giant portfolio of 2 billion, that we would have to pick a specific funds to transfer from, hypothetically, if we were to do so, correct?
Yes, you would, because you have to enter into a loan agreement between the funds and you need to understand what it's going back for, and you would have to ensure that those funds actually had the liquidity in order to loan the money. Just because you see a fund that has a big balance in it, that money may already be encumbered for a construction project, for example, underway. And so that part of the balance that's being invested wouldn't be available to be loaned because it's already been committed to a capital project.
And Julia, you used an example from when redevelopment was dissolved,
Yes.
What funds did we borrow from at that point?
Oh,
Sorry, testing your
that's
memory.
my memory.
There was a utility fund. I can't remember what they were either.
Yeah,
I think there was a park fee fund too.
Yeah, I think so.
Yeah,
and the
I think
Ice
it's the
Center
subdivision park trust fund. I think we use the shark size fund.
and the sewer fund, I think.
A
Yeah,
utility
storm
fund.
fund. Yeah.
Okay. And you mentioned, Julia, that these debts were called back. Were they called back sooner than we had expected, I guess? It sounded like that was the case.
Well, yeah, I mean, the issue became is that there was no date at which the redevelopment agency, now the successor agency, could commit to a repayment because of the waterfall, and the redevelopment agency was in an insufficiency of funds at that point in time. So looking at the, essentially we didn't know if the oversight board was essentially going to approve those loans, which was required under state law. So they had to be converted out of the special funds into the general fund, because the general fund can pretty much spend money on anything that's legally available to be spent on. So we had to convert them from special fund loans to the general fund. So then the general fund was owed the money from the successor agency, which was repaid, Jim, 2 years ago? I think.
Yeah, the loan back to the city. Yeah, that was 2 years ago.
Thank you. And Dave, your description was that we don't tend to use these interfund loans, loan transfers, because we also don't see many years in our history, and we don't project many in our future of surplus years where we might have opportunities to sort of be flushed to pay back loans.
Yeah, and that was just my, obviously the question was, why do other cities and jurisdictions do it? So it was conjecture on my part. It does seem to me that other cities and jurisdictions do have a better reliance on surpluses in their future. I, as you know, I'm connected with all the city managers across the country. So, we're in a really unique situation. I guess and like I said, the reason for our caution is around the fact that I think we do see it as a debt and as a cost to the money. And so, but that was conjecture on my part in terms of why other jurisdictions would be more prone to doing something like this, where to us, it seems really, I think there's other options on the table that you'd want to look at before doing this.
Julia or Jim, to Dave's conjecture, does that, or do you agree with that? I think Julia wants to say. I think Julia wants to say no. I don't know.
No, I agree with the city manager. So.
Yeah. I mean, I think just looking at our history and where we will probably go. Having the benefit of a lot of surplus in the near future. I mean, we just don't see that really as a likely outcome for us. That would be great if that were to be the case, but that would be different than what we've experienced in the past.
Okay, and so, and I appreciate the conversation, and certainly my colleagues for raising this as a discussion. It was something I wasn't even aware was possible, and I recognize too that it's clearly it's not something you want to use, nor is it something that's allowed to use just on a regular basis, but in times of crises and certainly great need for one-time uses, it's a tool that could be utilized. And I do think it's worthwhile, right, to have this conversation, and two, to really have some thought on where it could be utilized. So I wanted to share two ideas I was having and see if staff has a response now, or if this could be something that staff has, depending on where the motion goes, would be willing to consider and at least give a better response. So I am thinking in simple terms here now, based on my understanding of what this what this sort of interfund loan transfer would be, in regards to, for instance, me taking a loan from my 401A plan through the city. There's an interest certainly paid, but it's an interest paid to me. And could I use that, right, in a time of need to potentially pay off other debts that have a higher interest? And I know that we use this tool, right, currently in our current budget. We're using 25 million, nearly 25 million one-time funds to be able to pay. It's the Los Lagos and the LED streetlight conversion debt, and ultimately, as our budget states, these combined actions will ensure the benefit of the city taxpayers $4 million annually. And tell me if I'm wrong, but my assumption is because this is the interest, right, savings that we're saving on those by paying those off, correct?
Yes. Yes,
So
and- go ahead.
go ahead.
Do you have anything else to say?
Great. I do. So my thinking here is, are there opportunities like this in this coming budget that we're about to approve, that are one-time uses that potentially would, save us through interests, right? And not necessarily, would we have to use the general fund or dollars that could be in the general fund? And so that's one example there. And just tell me if I'm right, Jim, the 25 million, the nearly 25 million from the refunding of City Hall debt, would that otherwise be general fund dollars if we weren't using it to pay down Los Lagos and the LED streetlight conversion? Are those general fund dollars?
Yes, yes. So we're using a portion, I think it's about 26 million or so, and we're using the most of that to pay down the debt. The rest is just part of our other one-time funding source for 2021.
Okay. So my thinking would be, is it possible that instead of using those general fund dollars, that we consider an interfund loan transfer? And now, granted, that would have an interest to it, and it wouldn't be just paying it off with his general fund dollars. It would be paying it off with another loan. But would that interest rate be less? And would we still, realize an overall savings for our taxpayers? Maybe just not at the $4 million mark.
Well, I mean, Councilmember Perales, the challenge with that is that if you were to use, you still are going to have to pay that back, and you're going to pay it back over time. And the issue is those special funds are going to need to have a call on that money at the time in which they need the money. So you wouldn't be able to set up an amortization schedule in order to pay it back, so to speak. So it really wouldn't work. And the interest rate that we're projecting on the City Hall refunding is only a tad bit higher than the interest rate that we're currently receiving on the portfolio. So the actual difference in the savings would be pretty nominal, in addition to the risk that we would have in terms of making those repayments.
In the callback period, I get that. I guess we couldn't really make a good guess, or could we, on what a potential callback, time would be for particular funds. I know you stated that the hot water, it seems like we got into with the redevelopment agency or the successor agency to redevelopment agency, but I would believe that there's other funds that probably wouldn't have that same we wouldn't have that same issue.
Well, I mean, most of the funds that are in those special funds are pledged for budgetary expenditures, whether it be in the capital budget or the 5-year CIP or the city's operating budget. They all have a planned purpose. They're not just sitting there as a, so to speak, think of as a savings account. And the city has a significant kind of mismatch between when revenues come in and when expenditures go out. So a lot of times, I'll just use as an example, garbage, right? The residential garbage fee is collected on the property tax bill. So we basically get those payments in two big lump sums. So at certain times of the year, the solid waste fund looks really high in terms of its fund balance, but then we have the monthly payments out to the various haulers. So then that gets depleted over time. So there really is a pretty integral cash flow analysis that happens. So while in a particular month, they may look like they have a big fund balance, those monies are all planned out over the course of a period of time.
Councilmember Perales, I just want to interject. It's and now typically the dinner break time. Did you want to ask for many of your questions after dinner, or do you think you're close to wrapping up? In which case, we do it now.
I probably am not close. I probably only have about maybe 10 minutes though, but I don't want to say for certain. So I'm happy to break and then take it back up after break.
Okay, why don't we do that? Why don't we come back at 6 o'clock so everyone can get some food, and we'll continue at 6. Thank you. Perales, I believe you had the floor.
Yes.
Great.
Great, thank you.
Sure.
And is Julia back on?
Yes, I am.
Perfect. So just to pick up where left off, what I'm hearing sounds like there's some reluctance to want to consider these interfund loan transfers because one major factor being this sort of payback period and not necessarily being certain on when that might happen. I'm just thinking off of the top of my head some dollars that we may have out there that have sat for some time because they're for projects that aren't for immediate use, and I'm curious, Julia, if there are certain funds that may actually be not as risky in regards to our concern on how quickly they would need to be paid back. If there are certain funds that may be out there that staff had more time to be able to consider.
Yeah, I mean, I honestly, I don't know. Yeah, I don't know the answer to that question, but it would require a fair amount of sit down with Jim and his team to kind of go through. But again, a lot of those funds are built with ratepayer money as well. And so, to the extent that there's, we're delaying a project or a project's been on hold, ultimately those projects will come forward. And we can't be raising rates in a fund and that has an interfund loan against it as well. So there's a whole lot of considerations. And, as Jennifer mentioned earlier, there is that budgeted funds guide, and there's a link to it in the supplemental memo that we put out yesterday in terms of just looking at all the funds and the restrictions that they have. And some of them have some pretty strict restrictions on what the money can be used for.
Okay, but you wouldn't have an answer to my exact question at the moment. To your point, it would take some more digging into.
Yes, definitely.
Okay, and that obviously my interest is would there be some funds that we're not as concerned on that payback period, something we may feel more comfortable with a longer term, and again, I'm thinking of some myself, but maybe we can, for sake of time, as the mayor pointed out, we're still on consent items. This speaks to why I would like to be able to support my colleague's memo and at least allow for an opportunity to move forward, even if it's just with the exploration, so then that way staff can come back and say, hey, we still think this is not a great idea. I don't necessarily want to accept the staff recommendation in the supplemental memo because it just puts an end to it now, and I don't feel I'm confident that we have that enough information for that answer today. The other example I was going to give was in regards to the police hire ahead. I believe there was $7 million that we had for that, and then ultimately we took that out of the budget. Is that right, Jim?
Right, it's 7.2.
And that's something that, although it's an upfront cost, it's not it's not something that we're sort of overspending or somehow we have more officers than we need. The idea is that we're hiring these officers. They're not yet street ready. They're still in the academy or going through the hiring process. And then as we get retirements, boom, these officers may be now done with the academy, done with field training, and they're ready to go out in the street. So then that way we're actually not short on officers. And I know we were talking with the chief about this last week, and I was asking him, what is his projections on retirements, and what do we think that the higher head is gonna do? And certainly the chief expressed some some concern with we're not going to be able to be at that max capacity because without higher head we do lag a little bit behind, right? And so that was the other idea that came to my mind was, well, is this a a valuable place for one-time funds, because those are one-time dollars, right, to put say 7 million, and would we want to do that on this interfund loan? Is that a worthy cause for 7 million? If we could find again the right place to do so, or combining the two, the prior example I gave, which would be rather than using the 5 million or so from the general fund to pay down these other debts, like on the street lights and the Los Lagos golf course. Could we instead do an fund loan and pay those down? And that opens up $7 million for us to do the higher head. That's the kind of, ideas rolling around in my head. And again, I'll now rest and recognize, for sake of time, we may not solve all this today. That's why I want to be able to support the motion and at least ask staff to be able to return with, and maybe I can, sort of narrow some of the focus just with some of these funds that may be the best suited if we were to do an interfund loan, and then maybe with an acceptable dollar amount, right? If staff says, well, we wouldn't want to do it over a certain dollar amount because, again, we're subject to having to pay it back with the general fund. But I would like to have that baked out a little further. And so I do think there's a motion on the floor, correct, Sam? Or someone?
Yeah, this is Tony. We do have a motion from Arenas to move her memo.
Okay, so yeah, I'll rest on my comments, and I do want to support, not ending this today as staff supplemental describes and being able to move forward. Thanks.
Okay, thank you. Councilmember Camas?
Thank you, Mayor, and thank you, Julia. And when I came into office, I had a very similar thinking. I delved into all of these funds, and I think I had meetings with Julia and Jennifer at the time. I talked a lot about looking for ways to save money, including refinancing bonds, and I could tell you this, that I feel as a person with a financial background, financial management degree, an expert on bonds, I think we're already doing the right things, and I have full confidence in our finance department and their strategy and what they're trying to do here. And to me, I know that Councilmember Arenas was thinking about it in terms of how to look at things as a function of a family budget, and I think that's a great way to look at this. And so the way I look at this dilemma here is that the family put together in their checking account a half a year's worth of savings to pay for their mortgage and their kids' braces and the normal payments that you make every month. So you have a 6 months worth of supply here, or even almost a year. And what we're talking about doing here is taking that money and loaning it out to buy a new car or a vacation. And without knowing where we're going to get that, the money for the loan is where it's going to come from. And as far as where the revenues are going to come from to pay for the vacation or the new car. And so I think this is the example that I would equate this to. I don't know if Julia agrees with me necessarily, but sometimes you have to look at things, because finance is sometimes so wonky that you have to put it in terms of what people understand. This is the way I understood these temporary funds, that we need to pay payroll, but we got most of the payroll money up front in January. It doesn't mean we're not obligated to pay payroll. We have a whole mess of money that came in for the airport from payments from the what have you. It doesn't even mean that we can borrow against the airport money either for our general fund. So this is the way I see it. Let me know if I'm wrong, Julia.
No, I mean, that's kind of a way to look at it. I looked at it a little bit differently, but yeah, I mean, the money is sitting there to make scheduled payments that come into the future, and the revenue has a tendency to come in either lumpy or over time. And then sometimes we have payments that are relatively big, like our debt service payments on the airport, happen twice a year, and they're relatively big. So we need to have that money sitting there available to make those payments.
Yeah, and again, I commend you for getting the rate of return that you do on short-term assets. I can't get anything above 0.1% at my bank for any kind of loan on my short-term funds. So I have to take some some points from you on how to manage my money. I could tell you this, that luckily we do have things that we can look at. We may not choose to look at them, but we have Measure E, a lot of money that's coming in. It's a general fund tax that was passed by the taxpayers. We could look at that and put it in towards the general fund. There are, and I really appreciate the amount of work that Lee Wilcox did in trying to get answers on the CARES money and how that could be spent. And I'm excited that let's see if we can find a loophole to keep the programs that I know that my colleagues worry about, the higher ed, which I concur with them. I really am passionate about preserving that program as well. So instead of going into debt, medium-term debt, and taking that away from short-term payments, savings for payments, I think we should look at things that are going to be coming in, like definitely Measure E, and definitely things like the CARES Act, which we are, like I said, I was optimistic from the report that we heard earlier that we might be able to use that to help some of our first responders keep their jobs and perhaps, keep our department at full staff. Anyway, those are my thoughts. I'd like to make a substitute motion just to accept the memo from our staff. And like I said, I appreciate the thought that our colleagues put into their thinking. But I can assure you, years worth of drilling this department, I have found them to be very good stewards of our finances, and I don't want to change course.
Second.
All right, motion and second, superseding motion there by Councilmember Camus. Councilmember Davis, you're next.
Thank you. I also want to thank my colleagues for looking for creative solutions to our budget woes. And for the discussion today, I want to thank the staff, Julia, Jim, and Jennifer, and the supplemental memo. I've been satisfied that you've turned over every rock. And I just want to add, I know a couple of council members have already said that. We hope that the coronavirus relief funds, the relief that it can give us for the budget, that the priority be for the higher ed program. I agree with that, for retaining for keeping our officer level at the budgeted level. So I'm going to be supporting the substitute motion and not the underlying motion.
Thank you. Julia, just a quick question. What year was it that we were borrowing from the Park Trust Fund and the Ice Sharks Fund and all that for the RDA? Do you remember?
I believe it was 2010.
Okay.
It was when that first CRAF, big CRAF
Right.
payment came in from the state.
That was basically because we got hit all of a sudden by the state demand and we didn't have much choice.
Redevelopment didn't have the money.
Yeah, so it was one of those issues where there was really short notice. I think it was also toward the tail end of, it was either in the middle or toward the tail end of our third year of deficits that would have exceeded 300 million. So we were pretty well into our fiscal crisis at that point. And then also, could you tell me the refinancing of the city hall debt that your team's working on, is that complete or is that ahead of you?
Oh, we are deep into it right now. And the biggest challenge we have is our bond disclosure documents and talking about where the city's fiscal position is. So
Right.
we had hoped to bring that to council in June, but because of where we are from a budget perspective, we're anticipating now bringing it into you sometime during August and closing it in the fall. So it's baked into the budget, is getting done, but it won't be done until September timeframe.
And if we have a good bond rating, that refinancing could save us 25, 26 million, something like that?
Yeah, what we're doing is we're pulling out the debt service reserve fund, which is cash. Because we are rated so highly, we can refinance without the debt service reserve fund. And it's that cash pullout that's allowing us to refinance the golf course debt, which then means that we'll relieve the private activity restrictions on Los Logos, which means, as I like to say, we can better monetize that asset in terms of entering into a new agreement, and then pay off the higher paying debt related to the streetlights. So those are all very positive things to do with one-time money to pay off ongoing expenses, and then generates ongoing savings to the city, both the refunding and then paying off those two debts.
Agreed. So before you even talk about repaying the debt, was it 25 or 26 million in one-time money that we're pulling out
Yeah.
through the financing? Okay. So first, thank you for all that you guys are doing. Obviously, that is still uncertain because refinancing has to get through. That depends obviously on having good bond ratings. And I suspect that if we started engaging in fund transfers and loans that the capital markets, bond markets were not crazy about, we might not have a great bond rating.
Well, part of the conversation we'll have with the rating analysts when we bring the project forward to them for a rating will be, how did we solve the fiscal 21 budget shortfall, and what are you doing looking forward with respect to your planning about shortfalls in the future? And that's a big part of what the rating analysts look at, is your management of your assets and your money and your budget.
Okay. So I guess, you know, as I see this, this is not going to be the really fiscally awful year that we have to face. This is a really horribly tough time for our community. But in fiscal terms, I would strongly suspect, though I don't know, but I suspect that the following year is going to even be worse than 2021, based on what we know about property tax and Prop 8 appeals and what that does to the property tax base, and what happens when a retirement fund's contribution has to inflate because of poor returns in the market, and because we know it's going to take a long time for this economy to return. I think, you know, I just saw a report from McKinsey that suggested it'd be roughly 2024 when GDP returns to its current level. The only person I know that's believes that the economy is going to bounce right back is Donald Trump. And he believes a lot of things I don't believe, but every economist I know says we're in for a long, hard slog. And so the critical question for me on any repayment of debt, whether it's interloan fund or anything else, is, do we have an identified source of repayment? Do we have an identified source of repayment? And if we do, if we're 100% certain that FEMA money's coming in, great. I suspect we haven't been so certain in the past. We've had a lot of challenges getting that money. But if we have an identified source of repayment, then it's a short-term loan. And I took a look at the white paper, the December 19 report from the Government Finance Officers Association. And it's a short-term loan, 3 to 6 months, and we've got an identified source of repayment. I'm happy to support it. That's very different than what we're talking about now, where we've got an economy that is at best uncertain and probably very likely to put us in a very deep fiscal hole for several years to come. That means there is no identified source. And as Dave mentioned, even in the good years, we don't run big surpluses, if at all. And the reserves are already below the recommended standard levels. So there's simply no money out there in the future that we can point to say, we'll repay it with this. And that, seems to me, is the linchpin in our decision-making here. So I have concerns about moving forward with more extensive engagement on this topic. The staff is already engaged very deeply, and Julia blew a weekend, I'm sure, putting together a 10-page memo and laying out quite a bit about why it is problematic. There's an extensive amount of time that's already been spent on this issue. And the most important thing any crisis expert will tell you, and I've been listening to a lot of them over at Johns Hopkins and Bloomberg, and all these folks are putting these think tanks together. And the number one most critical thing is focus. You've got to be focused in a crisis. You've got to understand where to spend your very scarce time, how to deal with the fact that you've got a ton of information flowing at you, and you've got to focus what you're able to take in and what you're able to do. And right now, Julia's team needs to be focused on refinancing City Hall debt, because we are depending on that today in our budget assumptions for the $25 or $26 million in savings that we need. That is then going to offer subsequent savings through debt repayment. We also need her team and all the other budget teams, Jim and everyone else, focusing on FEMA and getting reimbursements. We need them focused on CARES Act, making sure we are using every dollar of that CARES Act money before December and making sure it's properly spent so we don't have any clawbacks. There is a lot of work to do in finance and budget right now, not to mention the fact that we've got to go approve a budget with a $72 million hole in it. So I believe that the important thing for us right now is to focus. And if I am more than happy to entertain if my colleagues or others, I know the POA has been very deeply engaged in this. They haven't communicated to me about it beyond the letters I've seen them send in. I am more than happy to consider this if someone wants to identify a source of funds for which there is no immediate need for repayment anytime in the next 3, 4, 5 years, because let's face it, that's how recessions work. And B, a clearly identified source of repayment. If those two things exist, then I think we should examine this further. But I think that's really, really hard to find at the front end of a recession that is already believed by many to be the worst in a century. So I would encourage us to really help our overworked staff who are juggling a lot of really important priorities right now, including on finance and budget, to be able to focus. I'll support Councilmember Camus's motion. I'd even be happy to take a modification that says, hey, if somebody can really identify those two things that I pointed out, we can certainly investigate further. But right now, we really don't have that. And to scour the budget for that funding source and for that magic identified source of repayment, that is a really, that's a difficult venture. And I'm not interested in putting that burden on our staff right now, particularly given everything else at stake. Councilmember Diep?
Yes, thank you, Mayor. Well, I just want to commend, Council members Arenas and Esparza and Jimenez for thinking creatively. I do agree that, at the end of the day, it's the council that gives the direction and for staff to kind of do this, and we're responsible for the budget and all that. So I appreciate their thinking out of the box and coming up with ideas. I don't know necessarily that this is the particular time to go down this path. I'm familiar, not that deeply, but I'm familiar with the notion, and I acknowledge that other jurisdictions do it, and it is a tool to have in the toolbox. So I'm not going to say no to this and foreclose the possibility, but I do think at this particular time, we have not identified a particular need for this. This is kind of an exercise to find potential revenue sources just to mitigate the initial brunt of the harm that we're facing. But I think we're going to face deeper harms ahead. And to kind of play off Councilmember Camus's analogy, for me, this is borrowing money from a family member, from a brother, a cousin, your mother perhaps, and when that other person needs that money back for whatever immediate purpose they were saving it for, and if we're not ready to reimburse them or give them back that money right away, we're not just hurting ourselves, we're hurting someone we care about. So another fund in the city that needs this money, and when the call comes, it's quite difficult when we aren't able to repay it right away. I don't think incurring debt right now is necessarily the right thing to do, but if we were to do it, at least with the bank or through a bond, there's a clear repayment plan, there are clear rules, and if need be, there's a way out if we're short funds, and there's a formal process for that. But to hurt a family member, if you will, to hurt another fund in the city, that is a potential downfall that I'm not willing to take right now. But I do appreciate the outside thinking on that. So I'm going to support the substitute motion. And this discussion reminds me of my high school civics teacher. The way to wealth is to not have a car payment. So to just avoid debt overall and afford what you can. And we still have reserves funds. So I'm going to count on those reserve funds for the time being. Thank you. I'll yield.
Thank you. Vice Mayor Jones?
Thank you, Mayor. Julia, I'm glad that you
Hey, Vice Mayor, I think you just went back on mute. There you go.
I have no idea how that happened.
I don't either.
Anyway, thank you for clarifying that it's not a savings account. It's a pass-through account, and the flow of funds varies from period to period. And so I totally understand that. And I also understand your memo and what you were trying to convey, and that this is not, you don't consider this to be a fiscally prudent strategy. But I want to know all the tools in our toolkit, all the possibilities, particularly to be able to smooth out some of these valleys. And this might be a deep, well, we know it's a deep valley, and it might be a deep, long valley. But either today, this quarter, this fiscal year, or in the future, I want to have a clear idea in terms of what strategies we can pursue to address short-term funding issues. So I'm inclined, based on my fiscal prudence, to not support the underlying motion, but I do have a desire to figure out a smoothing strategy. And whether that's internal borrowing, whether it's going out to the capital markets for short-term funds or bonds, or whatever the strategy is, I want to know what those strategies are and how we can potentially utilize those strategies if we need to. I understand that you're obviously overloaded and you got a lot on your plate. Can you just give me an idea of how much time and bandwidth is going to take for you to come back with the answers to my colleague's memo?
Given the fact that all the MBAs are due by a week from Friday, probably most of Memorial Day weekend. And I'm not quite sure that I would have the necessary staff available to assist me to get there. So it's a lot of work to try to get all those questions answered, within a week.
Okay.
And I would need a lot of help from the budget office as well.
Is there a possibility to not have as an in-depth response to their questions, maybe a more high-level response?
I mean, there's always an ability to, create a response doesn't answer all the questions. But again, I'm looking at Jim on this Zoom and looking to see what his thoughts are.
I suppose I think there's probably an option where, well, we could, I'm probably going to need help on this too, lay out options or alternatives, that I guess couple with kind of answers to some of the questions that are raised. I don't know. I think that, I'll just step back for a second. We're in the budget process. So, questions around kind of alternatives to what's in the proposed budget, are fair game. That's fair game. And so, we're not, it's not like we're not expecting these types of questions, probably expected more in the study sessions actually. And so, how we want to be able to answer council questions. The process for us to do that is by issuing an MBA. We've already put out the proposed budget, and our way of proposing and providing additional information is through an MBA. That's the process. And so, I think certainly we want to be able to answer council questions and do the best we can in the time that we have.
I think we can do something simpler than the detail, because that was requested in there. Maybe it's a menu more of other options, one-time options, and maybe doing what Councilmember Peralta said about what would we could very simply look at a few funds that have larger balances and see what could be possible there, but not doing an in-depth of all the 100 funds, but more of the larger funds, and see what that would look like, and maybe just do a simple menu of other choices. Obviously we didn't recommend those choices, but they're certainly, they are fair game if the council chose to go that way, and just make it a simpler MBA so you can understand. And if you were interested in one or more of those options and you wanted to pursue them more in depth, we could do then a more in-depth look at one of those options. Maybe that's a way to help.
Well, that would satisfy what I'm looking for. So I actually, Councilmember Camus, would you be willing to accept that friendly amendment to have them do a high level look at a few options, just so that we have an understanding or some benchmarks and what's possible?
Well, when it comes down to Chappie, everything that you just discussed was a loan, and all loans have to be paid back in the end. And it doesn't matter which fund. Honestly, I don't care which fund. It all has to be paid back, even if it's a big fund. Let's say it's the sewage fund, and we know that we have to rebuild our sewage system, and we need that money. And borrowing money against that and hoping to get money to repay it is the money to repay it is the problem I'm having, not the where to borrow the money from. You get what I'm saying, Vice Mayor?
Yeah, I totally get what you're saying.
And I don't think that a whole mess of new monies are going to come in, and that's my point. We're going to be borrowing money against something that we, that is a dedicated fund or payroll or something else, and we don't know where I'd like to see us identify where money's coming from before we go down the avenue of looking at where to borrow. I don't know if that makes any sense.
No, it makes total sense. And all I'm asking for is a high level analysis. We're not voting to actually approve an internal loan.
And I guess just to clarify, what I was speaking about wouldn't just be the interfund borrowing concept. I think it would be a listing of our available reserves, the couple of funds you could transfer from, but also with the trade-off question that you'd have to ask yourself.
Exactly.
For consideration. So you could sit there and say budget stabilization reserve. What's the trade-off question that we would want you to think about in using more of that fund? What are the other reserves that potentially you could use? What about those type of the transfers from those other funds that don't require payback? So I just think to have them kind of laid out in one place, because there's certainly things that we think about. Of course, we're not thinking about the interfund loan concept, but I'm talking about giving a little bit more of that menu that's more holistic than just the interfund loans. Just so you have it in one place to let you know that what we looked at when we thought about putting this budget together.
Jennifer, you nailed it. That's exactly what I'm looking for.
Okay.
So I'm not going to support either of the motions on the floor. I'm going to hold out and see if I can get.
If before you say that, I'm also trying to look out for staff, and if staff is interested in doing this, then I'm okay. I've actually been through this process a couple of times, I think, in my own private office where I called in staff in the past, and that's why I'm very comfortable.
Yeah, I obviously we've done this before. I'm talking about a very, very, very high level. It wouldn't take a lot of staff time in order for the council to understand what those choices are without doing an in-depth analysis on each one of them, because we just simply don't have the time.
Okay.
This whole budget's been, but I think we need to make sure that everybody is, kind of have that same sheet of paper that, and that might be helpful in future budget cycles as well.
Okay. And if you're willing to do that, then I'm willing to accept the amendment.
Thank you.
And the seconder, Councilmember Davis?
I'm okay with it. I really appreciate Jennifer having that reasoning for why you didn't do that for like the reserve funds, because as the mayor has stated, this is the first year of likely multiple years, and we've talked about during the budget time, we talked about the pension funds needing to be shored up in future years and needing to retain that. So I think that would be helpful to have that in addition to the funds that are available.
So I think it would be like a brief description of some other strategies and why, and what that strategy could look like and why we did not recommend it at this time. And so I think that's because obviously if it's not in the budget, we didn't recommend it. And considerations for council, what we considered. I think having the benefit of some of that thinking might be helpful here.
Yeah, I appreciate
it. Doesn't mean, and I just want to say, it doesn't mean that down the road, if we're in this for multiple years, that we may need to pull on some of those tools, but we think it's too early to pull some of these tools and like severely pull down our budget reserves at this time. They're already not funded at an adequate level, and we want to preserve that tool in our tool belt if things get a lot worse than what we think they're going to be. So that would be kind of the information that you could see in a memo like that.
Thank you. I almost want to put in the caveat that it also doesn't ruin Julia and Jim's and Jennifer's weekends. Can we add that to the motion?
We'll take that.
Yeah, we have a pretty low expectation of our weekend anyway. So.
Yeah, I think.
Okay, got it.
Just get their spouses flowers. Okay. Are you all through, Vice Mayor?
Yes, thank you, Mayor.
Okay. Councilmember Pross.
Thank you. And briefly, because I think I can support this shift in the motion. I was just going to mention how what actually was just mentioned right now in regards to the fact that this very well as we believe is going to be ongoing. And so although we may not, ultimately come to the conclusion that we're going to use this tool for this immediate budget, we already recognize we may be coming back in a few months to augment this budget. And so I think this is very useful to be able to have this information, and certainly appreciate staff compromising on this. I can support this motion.
I think you're right. I think we're going to probably be looking at this again in September. So here we go. Any other comments? All right, we'll vote then on Councilmember Camus's superseding motion.
Jimenez,
Yeah.
Peralez,
Yes.
Dieppe,
Aye.
Crosco,
Yes.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Yes.
Jones,
Aye.
and Liccardo.
Aye.
Thank you.
Okay, we just have two more items left on the consent calendar. Item 2.18, Councilmember Peralez. Councilmember Peralez, you're still on mute, I believe.
Sorry. Yes, and actually, I just got to pull up my talking points on this. Is there another item that you don't mind calling?
Sure.
If not,
Yeah, we
take me a
can
minute.
jump ahead to 2.19, which is Councilmember Arenas' item, approval of Mental Health Awareness Month.
Thank you, Mayor. And in lieu of a city proclamation, I brought this item to consent calendar, and especially with all that is happening in our society and all the difficult conversations even we are having here on council, I think it's very timely to talk about stress and anxiety. And so the National Alliance on Mental Illness has selected the theme, "You Are Not Alone," for this year's Mental Health Awareness Month. While we continue to shelter in place, even if you feel alone, know that you are not. #not alone. And so I hope that you and my council colleagues will join me to raise awareness and normalizing conversation of mental health during Mental Health Awareness Month. My office, if they haven't already, we will be sharing another social media toolkit with you this week. I wanted just to highlight our Latino community in the East Side who has disproportionately been impacted by COVID. We absolutely need cultural and linguistically competent mental health services. And so I'm thankful for Alum Rock Counseling Center, which has been serving our community for a really long time. And hopefully we can hear some public comment. I think maybe Steve Eckert might be on the line.
Okay, we'll go to, yes, would you like to go to public comment?
That would be great.
Okay, Steve Eckert.
Can you hear me?
Yes, and sir, I'm sorry to interrupt, but we're going to limit public comment going forward to 1 minute because we're still on consent and it's almost 7 o'clock, so we're just going to have to try to see if we can get to the finish line before midnight. Thank you for your patience, sir.
Okay, I'll just edit down to 1 minute. Thank you again for this opportunity. And also, I just want to say a couple of things. As you may know, Allen Rock Counseling Center has been around for 45 years. We serve 10,000 families a year with behavioral health services, but also services funded by BEST, mentoring services and truancy prevention services. And so we really appreciate the city of San Jose. COVID-19 has had a dramatic impact. And right now we're seeing our kids through telehealth. And there's been a temporary interruption in access because school is closed, and that's where we see them. Agencies like ours are second responders. PTSD is beginning to build and show as the pandemic wears on. We should expect a mental health tsunami. Kids are going to act out that stress, retreat into depression, act out with behavioral health issues. Mental health of our brothers and sisters affects us all, and it's affecting our staff. So we appreciate the support of the city of San Jose. We appreciate the best funding that helps do prevention services.
Thank you very much, sir. Robert Aguirre?
Yes, Robert Aguirre here. I would like to point out that even before this month or before the COVID, we had a lot of people that were wandering around the streets that have mental issues, and that continues to happen. And we have a higher concentration now because as people either get housed or they get moved away or they themselves move away, we have a large population of people that seriously need some help. And I think if you just wander through St. James Park on any given day, and I know there's not a lot of people that are out there. So the people that are out there are the people that tend to have these issues. And some of them are dual diagnosed and they're not getting any real attention. So I believe that should be part of this project if you're going to be moving forward with the this month of supporting the mental health. I think this Mental Health Awareness Month, I think we need to do something specifically in the downtown area, probably St. James Park, to show that we're doing something about it.
Thank you. Rovina Nimbalkar?
Thank you, Mr. Mayor. So the shelter-in-place order due to COVID-19 has been very isolating for people living with mental health conditions. We at NAMI Santa Clara County continue our programs in educational classes via Zoom. Our warm line is active 10 a.m. to 6 p.m. and after our family support is available on evenings and weekends. We are regularly updating our COVID-19 support resources on our website, www.namisantaclara.org. May is the Mental Health Awareness Month, and we recognize that people affected by mental illness face additional challenges dealing with this crisis. Now more than ever, it's important to remember that there's no health without mental health. Thank you very much.
Thank you. Blair Beekman?
Hi, can you hear me?
Yes.
Thank you. I've been coming to city council meetings for about 5 years now, and yourselves have provided myself with a nice amount of mental health help, and I want to thank yourselves for that. It's been important to me. I understand that you can't get full mental health counseling from your city government, but I'm making this process to be a process of my own mental health growth. And part of it is how can we describe the term mental health without it being stigmatized in the future? I mean, we all need mental health counseling and analysis and just therapy, just to talk about issues and how to open up and develop thoughts and ideas about issues. And so it's important to me to destigmatize the term mental health, as we all need mental health analysis and therapy. And how we can do that, I'd be excited to see how that can take place in the next few years. Thanks a lot.
Thank you. Catherine Hedges?
Hi, Mayor Ricardo on the council. Thank you. Yeah, I'd like to second what Robert Aguirre said about the prevalence of people who need mental health assistance out on the streets in St. James Park. They're coming in and out of Donner Lofts all day. The people who live here are not practicing shelter in place. They're inviting people in and out of the building. I don't know if all these people are aware of the danger from COVID-19, but There's just so many people out there who need help and are not getting it. And when they're offered help in a way that is not respectful, it's insulting, and so people don't want to accept it. I think the people who are doing the outreach need to do it in a better way. Thank you very much.
Thank you. All right, back to you, Councilmember Ennis.
So I'd like to move my memo and also thank Ravina and Steve for hanging in there. They've been with us from the beginning, Mayor, and so that just comes to show you how important mental health is and their willingness to speak on this topic.
Thank you. Is there a second? I'll second the motion. Is there any objection to the motion? Because it's a consent item, just asking if there's any opposition. Hearing none, that passes. Okay, we'll go backwards then to item 2.18, which is Affordable Housing Month. Councilmember Pross.
Thank you, Mayor. Can you hear me?
Yeah.
Great. So similarly, wanted to be able to pay some recognition for Affordable Housing Month with a proclamation. And as we're not in person doing these, we have this on consent. Every year, thousands of Silicon Valley families and individuals struggle to find an affordable home in one of the most expensive housing markets in the nation, as we know right here at home. And on any given night in Santa Clara County, more than 9,706 individuals experience homelessness, and 6,097 of whom are right here in San Jose. Those most disproportionately affected are low-income, immigrant, and communities of color, in which Latinx make up 43% and African Americans 19% of the homeless population throughout Santa Clara County. Our region needs a total of 53,689 new affordable rental homes, including 38,689 for those making less than 30% of the area's median income in order to meet our existing need. The COVID-19 pandemic will only exacerbate the existing housing and homelessness crisis that had already reached a boiling point. And many regional housing leaders throughout Silicon Valley are collaboratively working to bring the need for affordable housing to the forefront of discussion in our region. These organizations, led by Silicon Valley at Home, came together to successfully pass Measure E in March of this year. And certainly we know that that money is going to be so desperately needed. And I want to just echo that we are displaying the discipline that we discussed with this budget, knowing that none of us expected this level of a hit to our budget in this pandemic. But as we are being very disciplined with the Measure E funds, as we had stated and committed we would, I know that our affordable housing partners out there appreciate that. Also considering the unfortunate decision that ABAG and MTC made yesterday in regards to not moving forward with a regional housing measure, but considering the fact that polling for many of these measures, including the transportation faster Bay Area measure, polling has certainly shown that our community is not interested at the moment in those taxes. But I think we will certainly look forward to more of a regional effort in the future. And so this month, these organizations that have been with us have further partnered with local agencies and community members to organize an Affordable Housing Month to encourage the sharing of best practices, opportunities, and solutions happening all month long. So therefore, I do want to proclaim May as Affordable Housing Month and stand in solidarity with our housing partners to further highlight the deep need for affordable housing in our valley and encourage the continued work to build more safe, stable, permanent, and affordable housing. And I'll move the item.
Second.
Motion and second. Catherine Hedges.
Thank you very much, Councilmember Perales, for representing the need for affordable housing. As a member of PACT and Catalyze SV, I'd like to highlight a couple of affordable housing programs that are going on Thursday at 4 o'clock. Project Justice, which is a Facebook Live from PACT, will be talking on affordable housing, and that's an interfaith discussion. And at 6 o'clock, Catalyze SV is having the present and future of affordable housing funding. And that's everything from the current funding stack to community land trust and public banking. Thank you very much.
Thank you. All right, on that motion, is there any opposition on the council to the passage of that declaration? All right, that passes then without any objection. We are done with one consent calendar. We have one more consent calendar. That's a 10.1 land use consent. I believe Councilmember Jimenez wanted to pull item 10.1A. Is that right, Councilmember?
I did, Mayor.
Why don't we pull that now and we'll talk about it and then we'll vote together on all the consent items.
You want me to go ahead?
Yeah, that'd be great.
So it seems like based on some of the discussions at the Rules Committee that the Planning Department, and by the way, this memo was to a certain extent coordinated with the Planning Department. We brought some of these concerns to them, and it seems like everything's been green lighted except item 3B. I think that's going to be sent to priority setting, which is cool. Totally understand that. And so I just moved my memo. Along with the other additions.
Okay, is there a second on that motion?
Second.
Second from the Vice Mayor. I don't see anyone in the public like to speak. Then is there any objection? Well, would you like to include the other consent items as well?
Oh, yes, please.
Okay. Then let's consider all the consent items on 10.1 together. Is there any objection to the passage of all those items on 10.1, the land use consent calendar? I'm hearing no objection. Oh, Councilor Esparza.
Yes, I'm sorry. I had a question about industrial zoning districts. The expansion in industrial areas on item 10.1B.
Mayor, should I respond, assuming the question?
Yeah, sure.
Okay, go ahead. I just.
So my question was about the we want to expand in industrial districts. Are you looking at taking away existing industrial land? I'm asking because we've had a lot of these discussions with the Monterey Corridor Working Group about preservation of industrial land. And so
yeah,
I just would like some clarity on that.
Yeah, I appreciate the question. I'm going to present an example. Actually, it's in your district. So, for example, the what the heck's the shelter called in your district? Little Orchard. So
the
this
Ricardo Reception Center.
Exactly. So they're and staff can correct me if I'm wrong, right? But they're legal non-conforming shelter, meaning they're in an industrial area. So they can't build out their building and add more beds and things of that nature. So with this in mind, I was just thinking that there are some in our discussions with some of the providers that they were interested in the possibility of adding a few beds without adding or creating a larger envelope for the building. So no additional building or anything like that. They would potentially be able to add a few beds, and that's all it was. But my understanding of staff's concern is just that what you mentioned, and I'm sensitive to that. So it's going to be going to priority setting, and I think I think as staff mentioned in the supplemental memo, I think Rosalind mentioned some of that that they need to do a little bit more studying on that to figure out exactly what's. And I'm paraphrasing, obviously. I need to find it, but that was the gist of it. That was the gist of it.
So you're talking about the density bonus application? Is that it?
No, it was because, for example, right now, the Ricardo Reception Center cannot, at my understanding, cannot add any more beds. They have
okay, if this is just moving it forward to priority setting,
correct.
I'm fine with that. But there are conditions that they're not totally complying with the conditional use permit as it stands because we've had some issues with that. And so those issues would need to be addressed before I would certainly support expanding the usage even within their existing footprint. And there are a lot of issues that I'm happy to discuss with you offline. I'm okay with moving this as an idea for us to study, but there are some very real world consequences to some of the decisions that we make that I think need to be fleshed out a little bit so that all the partners involved would be on the same page with the plan moving forward.
Yeah, I mean, I certainly wasn't aware of that. And that was just, I use them as an example just simply because they're in your district, but no, totally. I totally understand.
Yeah, exactly. They're in my district.
Yeah. And, but this is citywide. It's titled.
Yeah,
20.
I know.
Yeah,
I
so,
know. I
but-
would have to.
And so yeah, I mean, this is going to go to priority setting. So I suspect at that time we'll have a longer conversation about it, assuming it even gets enough votes to warrant moving forward. But
Okay, thank you for bringing
totally-
that up.
No, of course.
I'm happy to support it. Thank you.
Cool. And if I just may add, the other interest, at least my interest, and I suspect all our interest, is anything, I think, in my view, anything we can do to add more beds. Generally, I know there's specific examples that I'm not privy to, but generally it seems like a good idea. But I understand that there's underlying sort of existing conditions that I'm not fully aware of. But that was the intent of it, is how can we add more beds in some of these?
Sure,
That
and
was-
that's the largest shelter in the county. So there's quite a bit of beds already on site. So yeah, but I hear the spirit of what you're saying, and I'm happy to support it.
Cool, thank you.
All right, on the motion, which includes all of 10.1 land use consent, is there any objection from any member of the council? All right, that passes then unanimously. We'll move on to item 3.3, which is the agreement with the county for the cost of distribution of food necessities. Dave?
Yeah, thank you, Mayor. So no presentation, but just wanted to make a few comments as we consider this item. Wanted to start off by thanking our city team and our partners. Today, Angel's here representing that collective, but I just think they've done a phenomenal job and really, really appreciate Angel's leadership on this, but really the whole team. And like I said, our partners, everyone that's been involved. You know, I think from my perspective, this is a shining example of kind of us stepping up and stepping into a challenging situation. And I think probably will go down as one of our proudest moments in terms of responding to everything that we've had to confront. We have been working with the county on this agreement for some time now. And so although this is an authorization to negotiate and execute, I think it represents an opportunity to check in and confirm our direction. And that's why there was quite a bit of urgency on our part and my part to get this in front of the council, recognizing ideally we would have brought an executed agreement. But we're not there yet, but it's important that we have this check-in opportunity with you all. And you'll notice in the staff report, we've given ourselves a pretty short leash. If we're not able to get to some sort of agreement, final agreement with the county by next Friday, we're proposing to come back on June 2nd to check in with you again, to really make sure that we're on the same page and figure out what we need to do to ensure that we're protecting our general fund here. So I'll leave it at that for now. Angel is here to answer questions. Thank you.
Thank you. Dave, I wholeheartedly agree with you. That I'm really proud of how the city staff have really stepped up. Angel and Kip and Lee and Andrew Fleur Shelton and so many folks, 160 employees I know have completely dropped what they're doing. Well, in some cases, they haven't dropped what they're doing. They're doing this and they're doing whatever they were doing for a day job. And it's been an extraordinary effort. 2.75 million meals a week are distributed to our residents, the residents of other cities in need. And I think it's certainly fair for us to expect that if we can't get FEMA reimbursement, which we know we can't for anyone living outside our city, then the county ought to be very clear about picking up that cost and ensuring that either other cities pay or that if it's unincorporated and the county pays, and they seek their own reimbursement through FEMA. I know there have been a lot of advocates who came to speak with us about the financing issue. It came up on consent and concerns about our budget. Well, if they really want to help us on our budget, this would be a one thing to help get over the goal line, which is getting the county to sign off on this agreement. It's awfully important to us. Councilmember Jimenez?
Thank you, Mayor. I'm going to first just move the memorandum. Very supportive of it. So I don't know if there's a
There a
second.
second? I'll second.
Okay, thank you. I just have a few questions. I'm glad Angel's on the call. And I'm very glad at the fact that we're trying to recoup some of the costs and to the extent possible, this agreement with the county is going to create the framework that we're going to use with other cities. And that's sort of tied to the line of questionings I have. And so I was wondering, Angel, if you could just briefly take us through, like, what are other cities doing within the county? Like, say, Mountain View or Sunnyvale. Are they feeding their folks? Is there anyone that isn't feeding their own folks? Are we truly handling all the cities?
Yeah, council member, thanks for that question. We built, we really built this system around, first and foremost, the existing food infrastructure that exists, starting with, and I want to give them a very special call out here, that Second Harvest Food Bank, right? Because they were doing this before COVID, they'll be doing this after COVID. And so what we've done is really built off that existing infrastructure. And similarly, as we reached out to other cities, we looked at doing the same thing. We worked with them to do the exact same thing in their communities, to make sure that we start with their own senior congregate sites, their own food distribution sites, as they have partnerships with groups like Second Harvest. And then once we understood kind of the baseline, then that's when we started to identify, are there any gaps in our system countywide, right? With a very specific and disciplined focus on vulnerable communities, starting first and foremost with COVID impacted, and then children, and of course people with medical vulnerabilities as well. And then within week 2, week 3, week 4 of this, we started to see this new emerging trend as the economic hit started to hit families. We started to see kind of this additional pivot and trend towards other families that just literally 4 or 5 weeks previous or prior, were okay with food, and now they found themselves in a different situation. So the answer, it's kind of a long-winded way of saying, yes, other cities, all cities are doing something about feeding their residents. What we're doing is kind of locking arms with them to identify gaps and fill those accordingly. And sometimes it's giving them access to a resource that we know. Sometimes it's us working with them to develop it from start. And so it really varies from city to city.
Mm-hmm. Do you believe that there's going to be a large amount of money that we're going to try to recoup from some of these cities, or are we talking about relatively small amounts?
Well, right now, the bulk of our food distribution efforts, hands down, is in our own city. Right now, we forecast that approximately 20% of the overall expense, we attribute it to outside the city of San Jose, and that includes unincorporated pockets of Santa Clara County.
What was that percentage again, Angel? I'm sorry.
Approximately 20% of the overall fund. Translation, that would be about approximately $6.5 million of the current food bill.
Okay, all right. But that's county pockets in addition to the other cities, right?
That is correct. County pockets and the other cities. So clearly the bulk of our efforts are in our own city.
Yeah, but with some of the stuff we've been talking about the budget, I think every dollar counts. And so I guess I'm curious, out of that 20%, which is 6.5 million, how much is that do you expect, assuming we get into an agreement with the county, we'll be able to recoup from the county? How much of that 6.5 is county?
Yeah, I don't have that breakdown exactly here, but that's one of the things that we're doing, in terms of just documenting the expenses. We literally have a team that are just literally reconciling the actual food bills. The good news is that from day one, we've been keeping good records, for the most part.
Cool.
So yes, I'd have to follow up with specifics around the county's portion. But I will say this, with respect to the county, for example, the way this agreement is set up here, we made reference to the term loaded costs, and that means all costs associated with the distribution of food in county pockets. And so our hope is that we are reimbursed 100% of those costs.
Yeah. Okay, good. That term caught my eye as well. And I think I even used it in an earlier item, because that really encapsulates for me just everything associated with the cost, right? With the number, instead of just the pure food, for example.
Correct.
Let me just end with this question is because I suspect, there are some other cities that are in similar straits as it relates to their budget like us. And so what I'm wondering is what happens if we approach, say, X city or Y city and they say, you know what, we don't have money to pay you. We can't reimburse you for the money you spent. I mean, what is the process there? What happens?
Yeah, that is a great question, and that's one of the reasons why we've been really trying to get these agreements advanced. Because, for example, the agreement that you have before you here, or at least the request to authorization to negotiate and execute, will allow us to provide a framework for how that reimbursement will take place. Right. Meanwhile, on a parallel track, we're trying to figure out all the FEMA reimbursements, and we're trying to maximize, that funding stream. And that's why we've also set an internal deadline, for example, with this agreement through the 29th, because at some point we got to call the question, right? If in the event that we find that the price is X and cities are unable to, come through with that, we're assuming that they're going to, the majority of this is going to be FEMA reimbursable for them. So it's not going to be a zero-sum proposition, but that way we know sooner than later, and that way we could kind of, raise the flag if we see a flag. But I will tell you this, and again, the devil's in the details, but I will tell you this, all the cities we've been working with have been highly collaborative, and I hope that that's an indication of their commitment to, follow through, because their communities have been positively impacted by this. But again, I also know, a contract is a contract, so we're going to do our best to maximize reimbursement.
Good. One thing I mentioned to Dave that came to mind as I was reviewing this memo is the fact that I think it's the vice mayor that sits on the Cities Association of Santa Clara County. And I was just curious, and it's not necessarily a question, but I'd be curious to know sort of his thoughts around what type of coordination or push that can be done on that end to make sure the cities are holding up their end of the bargain. So to the extent that can be leveraged, I think it'd be good to have the vice mayor poke around a little bit and see what kind of commitments we can get. But
Councilmember, if I could, yeah, I think that may be a lever we may want to pull a bit down the road. I'd rather let this process proceed with the collaborative nature of which Angel mentioned. He actually, I think, convenes or heads up an interagency group. I certainly have my connections with the other city managers that we're on a weekly conference call. But I don't want to dismiss the idea. We may need to pull every lever if we run into kind of some issues, and we're seeing signs that some other cities might be struggling to the extent that they're not able or don't want to be able to follow up on this. So we'll need to keep those options open to us for sure.
Yeah, I appreciate it, Dave. It's just an idea. You all there on the front lines, and I assume you're going to do whatever you think needs to be done to try to make us whole. The very last thing I would just say is that during a lot of these conversations, we often talk about some of the pockets within San Jose of folks that are, quite frankly, been left behind by this economy and have been ravaged by this pandemic. And I think sometimes it's easy to forget that although we are Silicon Valley, if you look at the many cities that I'm sure we're working in, whether it be Sunnyvale, Mountain View, Cupertino, Campbell, they all have similar pockets of similar folks that are struggling just as mightily as some of the folks in the 95111 area code and such, and just like East San Jose. And so I think it's great that, and I'm very proud of the fact that the city that I partially represent, along with all of my colleagues, is really involved in helping to feed the rest of the county. I think it's an admirable task, and I very much appreciate the effort. Thank you.
Thank you. Councilmember Esparza?
Thank you, Mayor. So I wanted to also follow up on food, just some questions. So 20% of the overall food is in the county pockets. Is that correct?
That is county pocket and other cities. So
And
not
other
just county
cities.
pockets. Correct.
So if the cost through December 31st would be 125 million, then are we looking at a total of 25 million? Is that what we're expecting the final cost to be through December 31st?
So if you had to kind of just, use that as the basis, that's how the numbers would pan out. However, we're anticipating, based on current trends, that we're not going to have to max out at that level, right? So what we've done is we budgeted kind of worst case scenario, right? Assuming all loaded costs for food distribution. And then short term, what we're doing is we're managing literally day by day, week by week, right? And what we're doing is we're taking an approach that focuses on how do we maximize other funding sources. So for example, with our school districts, it's how are we making sure that we're tapping into 100% of USDA reimbursements for them, right? So before we bring a penny or a dollar to the table, we want to make sure that we're maximizing USDA. Similarly, we want to do that. We're doing the same with senior congregation meals, right? We're working with the county. They had a baseline. Right now, they've doubled their investment in senior congregation sites. That's going to be reimbursable from that aging services budget from the county that funds senior nutrition sites, right? We have 13 in San Jose, 28 countywide, including the 13 in our city. So we're really maximizing, and that's why we're being very fiscally, I mean, for lack of a better term, just aggressive around how we make sure we maximize the funding that supports this very significant and essential service, right? So if you just follow that math as you're doing there, that's how it would work, assuming worst case scenario. But our hope is that things begin to shift, and we also find other options to offset these costs. And the goal is to drive that final number downward. But again, worst case, it can get there.
So, and we're doing that for everything. So we're hoping that we have 125 million on this sheet on slide 28 from the presentation earlier, but we're hoping that we don't have to allot that much to food. But if it is, then we could expect that 25 million of that would then represent food county for the rest of the county. Is that correct?
That would be correct, assuming that this trend continues at that rate and at that percentage, yes.
And we've already expended 6.5 million, right?
6.5 okay. To date, correct.
Okay, great. Yeah, and no, I agree. I mean, I've certainly been to my share of sites throughout. I think that's an awesome dog. I think I've certainly been to my share of sites in District 7 and know firsthand what a huge difference it's made to families that desperately need it because they don't have anything at home and they don't have $5 in their checking accounts if they have a checking account. But I know trying to guess is really challenging. As soon as construction was able to go back to work, some of the sites in my district saw a dip, which is great. And I hope continues as people who can resume their lives. I had another question about the timing of this, though. So it says on page 4 of the memo that if parties are unable to execute an agreement by May 29th, that this agreement will come back to us on June 2nd. Is that correct?
That's correct, Council Member.
It is.
So can you talk to me a little bit more about the discussions that we're having at the county and what the impasse is?
Yeah, and I think I'm going to ask Kip to join us and Angel to fill in too. I wouldn't describe it as an impasse, and and certainly in my conversations directly, with my conversations directly with Jeff Smith, I've not described it as an impasse. But we also have to acknowledge time is kind of marching on here, and I felt some pressure from you all on this issue, and I think the team, all of us, kind of were really feeling like, hey, we took a pretty big leap of faith here. And I don't think there's anyone second guessing that, but at some point we got to get things kind of lined up and the I's dotted and the T's crossed. So, it was really my decision that said, hey, let's just bring this forward to the council as an authorized to negotiate and execute. I informed Jeff Smith that that's what we were doing. It just, make sure that we were, this is the opportunity that we had to engage you in this discussion. If we wait till we have a signed off agreement, I just couldn't control that. And so here we are. I think Kip is in a better position maybe to describe the status and kind of where things are at.
Thank you, Mr. City Manager. So I have been working with my counterpart, James Williams, who is both the county council and alternately their EOC director, and has been the lead on the county side in terms of the food agreement. In my last discussion with him, the key point that he is seeking clarification on is essentially confirmation of the direction that we got from FEMA about how the reimbursements need to be handled and what was and wasn't eligible for reimbursement. We believe, and we had our folks in the room who were very clear on this, that FEMA was exceedingly clear on those points. And so I am assuming that as soon as he's able to link up with FEMA and understand what they said, that he will be as clear as we were after our discussions. And I'm hopeful that that is the main point holding it up, and that we can then proceed to conclude these negotiations. But that's the status that we're at right now. And I think deadlines have a way of motivating. And I think this is helpful for us to clarify that after having done this in very good faith and very well for 2 months, it's time to sew this up and get the details clarified.
Sure, and as much as, I mean, this has been a huge service to our residents and to our partners at the county, and a definite partnership with a lot of the organizations and nonprofits and community groups that we've been working with. Again, I've certainly seen that firsthand. So I think there's a huge benefit to it. However, I did want to point out that at the top end, Angel did mention earlier that we're hoping to leverage senior food sites and school nutrition programs in order to bring that number down, but we would still be taking on 125 million financial commitment, correct?
Yeah, the Angel, go ahead. I'll let you.
Yeah. I mean, so if you had to kind of straight line it, the risk could be upwards of $125 million in a worst case scenario, right? But again, the built-in assumptions here is that to the extent that a good portion of this work that targets seniors and vulnerable populations, because FEMA doesn't just refer to seniors, but they use the word or. And or vulnerable populations or others impacted by COVID, correct? So our intent is to maximize that funding source. Our intent is also to really do an overlay of the Corona Fund and see what we can capture through that fund, as well as USDA in our partnership with schools. So our goal is to whittle that number down as much as possible in order to to maximize reimbursement and cost recovery, because reimbursement refers to FEMA, but cost recovery with everything else, and then using really astute and shrewd business practices around how do we make sure we tap into the economies of scale. If you take a look at some of the contracts that we've entered into, you can see that we put a lot of intent and strategy and negotiating into making sure that we're getting the best bang for our buck. Right. And the power of leverage, right? Literally thousands of volunteers through Silicon Valley Strong and through others. And you had mentioned, our nonprofit safety net. I will tell you this, and it hasn't, and I'm not going to, sit here and assume that it's all, or, paint a picture that it's all worked out very smoothly. But our nonprofit partners have been invaluable in this. Our work with Silicon Valley Council of Nonprofits and that whole, web of nonprofits. And again, as I mentioned already, the Second Harvest Food Bank as our primary kind of cornerstone. And I'll keep saying that because I've always was a fan, but I'm a bigger fan now. Arms emergency. And last but not least, the staff that we have. I think Dolan Beckles on this call. We have Neil Rufino, Andrea Flores Shelton. And I was getting in danger with naming people because there's so many people behind this effort. And I got to tell you, in retrospect, yes, this could potentially be pretty expensive, but in retrospect, I got to tell you that next to stopping the infection rate, meeting people at their need of food and security is definitely the best thing to do in an effort to really calm things down from a county perspective as it relates to COVID. And so I'll get off my soapbox, but that's, thank you.
Yeah, no, and I think it's been really important because as I mentioned before, in the Franklin McKinley School District anyway, they were unable to give out a week's worth of food at once because so many families in the school district were unable to store a week's worth of food for their family because of the living conditions that they have. So the fact that people knew that there was this system set up around them that would be there is, I think, huge. So I just wanted to commend you, but I did really want to highlight those financial commitments. I think that's important for the public to understand. But it's also a partnership in supporting the work of our nonprofit partners and through the World Kitchen, right? We have some local businesses, correct, that have contracts with that?
That's correct.
And how many local businesses are we using for the World Kitchen program?
Yeah, so you're referring to our Great Plates, and in fact, I see Dolan
I'm
there.
sorry, yeah.
Yeah, I see Dolan there. I'm
sorry.
gonna defer to him because I've done a lot of talking. I'm gonna defer to Dolan, and he can take this answer.
Yeah.
Yes.
Thanks, Angel. So good evening, Honorable Mayor, City Council members of the public, city staff. Dolan Beckel, Director of the Office of Civic Innovation, but currently operating as the Food Necessities Branch co-leader with Neil Rufino. To answer your specific question, right now we have 550 participants qualified through the Great Plates Delivered, 550 seniors who might normally not be getting meals qualified. And we have 5 restaurants that are activated, and we're evaluating approximately 5 more.
That's great. It's really nice to see that we are supporting local businesses and local residents in our community. So with that, I hope it doesn't need to come back. I hope everything moves forward smoothly and the county will sign the contract. Thank you.
Thanks, Councilmember. And just on Dolan on that point, thank you for moving forward aggressively on the Great Plates Delivery. I think that's a really important program, particularly for sustaining some of our struggling small businesses. I've heard from several restaurateurs that they have applied and they are eagerly awaiting news. When might we announce our second tranche of restaurants?
So we have 147 restaurants that applied as of Friday. They have all been, those that have been activated and those that have not been activated have been notified. So everyone's been notified of their status. It's really going to depend, Mayor, we just announced it yesterday. So we kind of have to balance the demand from the seniors and the COVID-19 positive with the restaurants, but we're actively evaluating them right now. I would have to say we're probably 2 weeks, at least 2 weeks away from the next set of notifications.
And my understanding is because of the deal the governor worked out with FEMA, we can actually get much larger reimbursements on these. Is that right?
That's correct. Between Cal OES and between FEMA, the local burden, the local share is only 6.25%.
Yeah, that's great. I really appreciate you guys moving forward. I think we're one of the first cities to do it. It's going to be so important. So thank you. Councilmember Diab?
Yes, thanks. I just had, good job. I support this, of course. I only had one question, just thinking in terms of agency issues. I understand our issue is we're basically the city of San Jose providing food for the entire county of Santa Clara at the request of the county. And our hurdle, as I understand it, is FEMA won't reimburse us for that effort because every city should have their own bill. But to the extent that we're incurring the cost and we just kind of tell, I don't know, the city of Milpitas or the county of Santa Clara, this is our cost. You guys go apply for FEMA for reimbursement, then kind of reimburse us. Do we foresee a kind of agency issue? Like, will FEMA allow us to kind of share our costs with Santa Clara County and let them kind of request the reimbursement and then hand it over to us? Am I thinking too far ahead?
Yeah, no, actually, you're kind of thinking along the lines of FEMA now. Our original intent was for us to be the lead agency, do all the paperwork, get the full reimbursement, and then kind of be the central point of contact. FEMA thinks otherwise. FEMA says that the work to organize and coordinate food distribution countywide cannot be delegated and must be reimbursable city by city. So we had to kind of pivot and change gears, hence this new approach, right? First the city-county agreement, followed by individual city agreements that we'll have to negotiate pretty much similar terms, right? And because from day one, and there was a reference to, for
You gotta
example,
keep an eye on us, so that annoy you.
oh, you're in a meeting.
Yeah.
We can ask everyone to please mute their mics. Thank you. Sorry,
Going back to day one, where in those initial days we actually had citywide meetings. In fact, Vice Mayor Jones had facilitated one meeting. Dave pulled together all his city manager colleagues, and literally for, I think it was like day 2 or day 3, we kind of had these conversations high level, not knowing exactly how we were going to have to build this thing out, but at least coming up with some handshake agreements that, okay, the county has asked us to do this. We'll work in coordination. Again, we're not going to tell you how to do it. We're going to be here as a resource to help you coordinate. And I do want to kind of clarify that point there, is that we're not necessarily providing direct food to every single city. What we're doing is we're leading the coordination of the distribution of that food. In some instances, we are standing up the actual vehicles to provide the direct distribution. In most cases, we're supporting those efforts in these respective cities. So I just wanted to clarify that little nuance, because it is a sensitive issue out with many of our partners. Yeah, so our hope is that they're going to be just as collaborative when it comes down to paying the bill. It's like having dinner and the bill comes, and then at some point we got to reconcile.
So did I understand you right, Angel, that from a FEMA perspective, you kind of need the agreement ahead of time in order for them to recognize the arrangement?
No. I'm sorry if I implied that. No, we just need to make sure that cities submit their own requests for reimbursements to FEMA on their own, right? And in many of those cases, we'll have documentation that we'll be able to share with these different cities to help them with that reimbursement process, and we're open to doing that.
So I guess, and tell me if I'm asking the questions that from a FEMA perspective, you can't kind of step into their shoes, but I'm just thinking if I'm FEMA and I'm trying to reimburse America for stuff, there are things that I'm gonna be very tough about, and I'm going to be very strict and not let jurisdictions kind of from a FEMA perspective, I'm not saying this, but from a FEMA perspective, get a windfall. And so if there's a way to not reimburse some jurisdictions, I might do that because I'm doing it all across America. And I'm just concerned that FEMA is not going to accept a cost that San Jose incurred that the county of Santa Clara is now taking the receipt for and saying reimburse us.
Well, if I could, what we're going to be doing is we'll be passing along the actual cost of what it takes to have supported the feeding of the people.
Sure.
Some of those costs may be reimbursable through FEMA. Some of those costs, they may be reimbursable through other circumstances. Some of those costs may not be reimbursable. So what each individual jurisdiction will do is they'll get an invoice from us based on what actually makes sense. And then we would request they pay us, and then how they get reimbursed is up to them. So that conversation on what are the appropriate amounts and percentages and this and that and the other is between the city and FEMA, as FEMA has requested.
Right. Okay. All right. Thank you. I know this is maddening, so thank you for all the hard work and navigating the federal bureaucracy, which is not easy to say the least. All right. Well, thank you. I'll yield.
Thank you. Councilmember Pross.
Yeah, thank you. I was really hopeful that we were going to be able to come forward with one contract and resolve this, but I understand that's not going to happen now. And we have to go out and seek contracts now with each individual city. What's our timeline when we think that will be complete? And this is just with the county unincorporated areas, right? So when do we think that'll be complete?
Yeah, actually, we have already been talking to cities. Initially, we've informed them that we were going to be the one lead agency. That was before May 3rd, when the FEMA gave us the greater clarification. Over the next 3 days, we're going to be reaching out to every city specifically, talking to the appropriate people in those respective cities to lay out the basic terms. But again, subject to council approval, because we still need to, we will be developing a memo similar to the one that you have here and bringing that back within the next 2 weeks, since we're not meeting next Tuesday, most likely the week right after that, with similar terms. But the actual negotiations that we'll be having in the context of subject to council approval will start tomorrow, Wednesday, Thursday, and Friday.
Okay, thank you very much. I think I agree with a lot of the comments that have been said, and certainly, Angel, as you stood on the soapbox and just talking about the importance of food insecurity and really resolving that issue. And I think it is admirable what our city staff elected to do, our city ultimately did, and our city staff has been out there helping to make happen on food distribution. I think at the same time, we need to be, very diligent about the expenditures, especially considering the shortfalls we're looking at. And so I wish you luck, and I do agree with some of the earlier comments that if need be, right, we should engage whatever bodies if necessary to ensure that we get cooperation across the board. It sounds like so far we're not concerned about that. And so I do appreciate that. And we'll be able to support this action. And I'll just make a note that I think Rob Lloyd today has had some of the most amazing backgrounds.
Yeah, they've been very impressive. Robert Aguirre. Welcome, sir. Mr. Gary, I think you're still on mute. We're not able to hear you, sir. If you could turn your device off mute. Mr. Gary, we're still not, there we go. Oh, let's try that again. Okay, he's taking his hand down. All right, on the motion then, Tony, could you?
Yep. Jimenez,
Thank you.
Yes.
Peralez,
Aye.
Diep,
Aye.
Carrasco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Sorry. Yes. I think I answered too early.
Jones,
Aye.
Liccardo.
Aye.
Thank you.
Tony, I think you missed me.
Arenas?
Yes.
Oh, I called you, but I think Cam, anyway, thank you.
Oh, I'm so sorry.
That's all that matters. Okay, thank you. We're on to item 3.4, which is report on digital access and inclusion and resolution authorizing city manager to negotiate and execute amendment to the contract with the CTF. We have a presentation, I'm told.
We do.
Hi, good evening, council members and mayor.
Hi, Jill.
While Kirsten gets the presentation up, here we go. I'm Jill Bourne, your city librarian, and tonight I'm here in my role as the lead of the digital inclusion branch of the EOC. And I am here with Kip Harkness, who, as you know, is deputy city manager, also has many hats on related to this topic. And we're joined by our partners, Dr. Marianne Dwan, and superintendent of the Santa Clara County Office of Education, and Chris Funk, superintendent of the Eastside Union High School District, as well as Sunny McPeak, our partner, the president and CEO of the California Emerging Technology Fund. Go forward, Kristen. Thank you. So tonight we are returning per your direction to provide updates on potential connectivity solutions, the partnership with Eastside Union High School for the Access Eastside Community Wi-Fi build out, and participation in a digital inclusion collaborative with key stakeholders that is led by Dr. Dewan and includes council members, school board members, and others in the Digital Equity Coalition. Tonight, we're also requesting adoption of a resolution authorizing the city manager to negotiate and execute an amendment to the city's contract with the California Emerging Technology Fund to allow for special handling and distribution of funds that are donated to the Digital Inclusion Fund for the purpose of relieving digital connectivity impacts caused by COVID-19. Next. Okay, so as we discussed during our last update, through the partnership with AT&T, 7 parks in San Jose were identified as having the existing city fiber backhaul that could be used to connect smart controllers and expand Wi-Fi access into park areas. An initial pilot was completed at Seven Trees Community Center, and the city and AT&T are currently planning to scale this work to the following parks that have fiber backhaul: Southside, Roosevelt, Berryessa, Hank Lopez, Camden, and Almaden Community Centers and Parks. But moving on to phase 2, to advance the project further, staff is investigating the process and cost of installing Wi-Fi access points on library buildings and community centers with connected city parks and public spaces. The additional city sites were identified through a review of census data, including the density of K-12 students, households without computers, and poverty rates by census tracts. The city will explore funding opportunities such as public-private partnerships with our telecommunication companies and other resources to fund this work. The locations have been ranked by level of need in order on the slide and in the staff report, so I will not read them all. This is an item that we will continue to advance, and in our next report be able to identify a timeline for implementation of the potential work. Now moving on, in 2016, City Council approved the City and Eastside Union High School District to access district funds for the installation and maintenance of a community wireless network. Wi-Fi deployment for James Lick attendance area was completed and opened to the school community in October of 2017. It then opened to the broader community in April of 2019 and has shown to be very reliable. Based on positive performance of the James Lick attendance area wireless network, we are working in partnership to facilitate the build out of the other attendance areas. So it is my pleasure to turn it over to Eastside Union Superintendent Chris Funk to talk about our current projects and future plans. Chris?
Good evening, Chris Funk, Superintendent, and appreciate the opportunity to address you this evening, and just want to really be very appreciative and acknowledge the continued partnership with the various bodies, particularly the City of San Jose, various members of staff, and with the County Office of Education. And I just want to let you know that there's been a lot of movement in the last 2-3 weeks, and the acceleration plan brought forward by the city, the funding for Independence and Oak Grove is also part of the next slide that we're going to talk about. And we actually, I think I would hope by the end of June, we'll be able to report back to the City Council on a complete plan to finish Eastside Access Eastside and the wireless project. I hope this week to have a draft MOU out to the Eastside Alliance. Every district but one so far has agreed to funding the ongoing costs of the O&M. And I think with another 3 weeks or so, we will all be able to identify the funding mechanisms to complete not only Independence, Oak Grove, but Andrew Hill, Silver Creek, and Mount Pleasant.
Thank you, Chris. Go on. So as council knows, there was a memo that requested a funding strategy, and so we've already begun talking about that, including a timeline for expediting work as well. So that'll be a forthcoming product. So moving on, staff have also convened initial conversations with our telecommunications partners, AT&T, Verizon, and Comcast, to explore partnership opportunities that would address immediate and future broadband and connectivity needs in San Jose. The immediate focus is on accelerating small cell deployment in priority unserved and underserved areas, and exploring the potential for innovative pilots and or new public-private partnerships that reduce or eliminate barriers to access. So we will continue to work with AT&T and Verizon actively to identify areas of need and plan for priority small cell deployment and other potential pilots. We should be able to provide the City Council with an update on these plans in our next update. Next. As also directed by Council, staff have begun supporting Dr. Dewan in convening a collaborative group to continue engagement around this topic. So it's my pleasure to welcome Dr. Dewan.
Good evening, everyone, Mayor, council members, community, and partners. It's really a pleasure to be here tonight and to have this opportunity to provide a brief update about our efforts to schedule an event. We have tentatively scheduled a forum for June the 3rd in the evening. This event will allow us to bring together a variety of stakeholders who are all committed and passionate about digital equity, access, and inclusion. We will be partnering with the members of the School City Collaborative and appreciate Jill and her team and city staff for leveraging the School City Collaborative as one of the entities and partners who will be a part of the convenings. And we'll also be engaging with CETF, our Digital Inclusion Fund Advisory Board members, the Tech Exchange, other community organizations, and other interested elected officials. The initial forum will allow us to provide an overview of the countywide need with some breakdown and clarification about the needs within the boundaries of the city of San Jose specifically, but also while addressing some of the overall countywide needs. We'll be able to discuss the need for access to devices and some of the limitations around connectivity, strategies and ideas around reducing and eliminating barriers, and specifically the different roles that entities, partners, and others can play to help eliminate those barriers. And then we'll also be able to offer a case study of the Access East Side project and how it was developed and the impact of that. So that is the progress that we've made to date, and we're looking forward to hosting this convening and creating a space for all interested parties to contribute to closing the equity divide for digital inclusion. Thank you.
Thank you, Marianne. And then, as you know, the California Emerging Technology Fund manages the Digital Inclusion Fund on behalf of the city. Currently, CETF's contract with the city requires that disbursements to grantees from the Digital Inclusion Fund go through an RFP process. They have to receive a recommendation from the San Jose Digital Inclusion Fund Advisory Board and then be approved by City Council. Since the onset of the COVID-19 emergency, the Digital Inclusion Fund has received donations specifically intended to relieve the digital connectivity impacts that have been exacerbated by the pandemic. City staff and the CETF would like to rapidly deploy these specially donated funds and resources, and therefore an amendment to the agreement between the city and the CETF is necessary to account for special handling and dispensation of these funds and donated resources. So before today, we had received a total of about $62,780, as well as 139 laptops and tablets and 200 cell phones donated to the Digital Inclusion Fund to provide COVID-19 relief. And then finally, we have also partnered with the Tech Exchange to conduct 2 device drives, which are events that in partnership with Tech Exchange, they will receive and refurbish the devices for distribution to our schools through the County Office of Education. And then as noted in the memorandum, the events are scheduled to take place on May 23rd at the Bank of America in Willow Glen, which is hosted by the Digital Inclusion Partnership and D6, and also on May 27th at the Evergreen Valley High School, hosted by the Digital Inclusion Partnership and D8. Thank you to the mayor and the council offices for your work. And with that, we welcome any questions and discussion on this important topic. Thank you.
Thanks, Jill. We'll go to the public, but just before we do, I just want to thank you and on your team, Ann Grabowski and Kristen Olson. And I know Dolan and Kip have been working on this for a long time as well. The whole team, the EOC has been leading the work. I really want to thank Dr. Duan and SCOE for pushing forward this countywide effort. And Sunny, as well as Charlene Tatis on her team, CETF's willing to take this on without any additional fees. Chris Funk, thank you again for the continued partnership, and we look forward to completing that ambitious effort that you set forth on many years ago. And on that subject, I want to thank Apurva Pasrisha and Kailani Mueller-Shaw on our team for their work on the memorandum that several of my colleagues have also supported, and I thank them for their support and their advocacy on this issue. I think we're all in agreement that we want to do this as quickly as we possibly can within the limitations of our challenged staff and their limited time. But I think we're all pushing together, and it's great to see. We'll go to our community members, beginning with Bonnie Mace. Welcome, trustee.
Can you hear me now?
Yes, we can. Fine.
So I'm Bonnie Mace, Evergreen School Board trustee, and I want to speak in support of the recommendation. And thank you so much, the mayor and the city council, for your forward-thinking leadership on this issue of digital access and inclusion, and also to partners such as County Superintendent Dr. Dewan. So as you know, now more than ever, it's really important to create a strong and resilient digital infrastructure in San Jose. And the community wireless network partnership between the city of San Jose and the Eastside Union High School District has been ongoing for many years, but now there's really a renewed urgency to expand and accelerate the process due to COVID-19. And as you know, schools and school districts cannot do this alone, and students and families cannot wait. And we really have an immediate need for distance learning for all students, and many low-income families in San Jose, even in my area, still don't have really strong internet capacity. And we also need a really strong and stable base of funding. And so I fully support the creation of a sustainable funding strategy to continue this process. So thanks again for your leadership and partnership, and we look forward to working with you in the future.
Thank you. Another trustee, Lorena Chavez. Welcome.
Hello, can y'all hear me?
Yes, we can.
Wonderful. So my name is Lorena Chavez, Eastside trustee. Thank you, Mayor Liccardo, City Council, for the time to speak today. Thank you, Jill, team, and everybody who has been recently doing work and has been doing work leading up to today. So I really, really want to say that I appreciate the work that has been done in this past month and a half or so since we started to re-engage in the conversation of permanent infrastructure in terms of wireless. As y'all know, accelerating and expanding broadband infrastructure is vital, and we want to continue to, push on the work that we're doing together. In the memo, I noticed that Independence and Oak Grove are set to happen next summer, and our students and families cannot wait a year for internet access. So we asked the city to tackle this issue and move quicker on infrastructure in these communities. We also asked that Silver Creek and Mount Pleasant are included in the plan to expand Wi-Fi access. There's a lot of need and opportunity in Silver Creek and Mount Pleasant areas. And a way to accomplish this, as you probably know, is to have more than one company do installation and do multiple at the same time. Either we expand vendors through a competitive bid process, or maybe ask SmartWave to ramp up so they can do multiple neighborhoods at once. Lastly, it's becoming clear to me that the city, at least to some extent, agrees and understands that it should take lead in funding broadband infrastructure, because the digital divide impacts city residents beyond the classroom. Schools do not have the capacity to meet this crisis alone. And so while this conversation a few months ago, it seems started with this being a digital divide, learning divide issue, and being a big reason why we move this forward, I ask that we really reconsider and think about this as a resident issue, as a City of San Jose resident issue. Again, thank you for all the work and the collaboration. Look forward to continuing the collaboration. Thanks.
Thank you, trustee. Next, we have Nina Nguyen.
Hi, good evening, Mayor and City Council members. My name is Nina Nguyen, and I'm a Student Governing Board representative for the Eastside Union High School District. Over the past 2 years, I've worked with students from across the district in Eastside San Jose. I'm here to advocate on behalf of our community and students. I appreciate the city's efforts to expand internet access, and I would like to thank the council for making significant progress this past month and a half. I believe expanding long-term broadband infrastructure is important and want to urge you to not ask the communities of Independence, Oak Grove, Silver Creek, and Mount Pleasant to wait for a year to complete its infrastructure. These communities cannot wait and should not wait until next year. There's too much at stake. Many underserved and vulnerable families in San Jose are significantly impacted by lack of internet access. This COVID pandemic really shows how inequities exist in our cities and students from underserved backgrounds suffer in their academic endeavors. I know students without adequate resources who have to overcome overwhelming odds to succeed in school during this time. We need to ensure that the playing field is leveled and fair for all students, regardless of their socioeconomic background, and this means increasing internet access for families in need. This is a city responsibility, not just a school responsibility, as schools are in a huge budget deficit. Thank you so much.
Thank you. Next, we have Robert Aguirre.
Yeah, Robert Aguirre here. I'd like to point out, yeah, certainly I want to support what's going on the east side, especially the schools that are being supported by this program. But I also like to point out that I live on the west side, and here on the west side, I'm getting very poor connection. As a matter of fact, I've had to connect about 6 or 7 times just in this meeting alone because I keep getting kicked off because the internet is so poor in this area. And although I'm not a student officially at any school or anything, but I'm a student of life, and I'm a participant in the city government and the process of what's going on. And I find it very difficult to be able to participate in these types of things when my internet is failing constantly. I've now switched over to another company, and I'm still having these same problems. It's supposed to have been a faster speed, but I can't get the kind of service that I really need in order to be able to do the work that I need to do from home. And that's especially right now having to stay at home. This is a real difficult problem. So I think District 1 needs some attention as well.
Thank you, sir. Blair Bakeman? Oh, I think Mr. Beekman pulled his hand down. Ken Pyle? That was accidental, Blair. Just raise it again.
Whoops.
Welcome, Ken.
Well, thank you, Mayor, and thank you, Council. This is a topic that's near and dear to my heart. Just on Friday, I talked to a company in Florida that something like 50% of their members that they serve, their telephone cable company, they are impoverished. They actually are providing hotspots in churches, in schools, and they did it very rapidly. And I think the city, instead of looking at building infrastructure, they really need to focus on the infrastructure that is there. I contend that we already have fiber there, and I sent a document indicating that there's fiber, there's broadband. The challenge is probably within the homes and the affordability of that. So I think it becomes a county issue as far as making sure that all the areas have the ability to get the broadband. And I would work with Comcast. They have 25 hotspots within a kilometer of Yerba Buena as an example. The infrastructure's there. Let's work with what's there. Thank you.
Thank you. Jeffrey Buchanan.
Mayor and Council, good evening. First, I'd like to thank the staff and those on Council who've really been leading this discussion for the progress that's been made so far in moving forward with these projects on the east side. Would like to echo the comments about trying to find a way to expedite Oak Grove, Independence, Silver Creek, and Mount Pleasant. Additionally, as staff and the Office of Ed start to look at a funding plan, a couple of things that are worth your attention. Thinking about some of the Economic Development Administration funds within the CARES Act could be an opportunity for the city or optimally the county to pursue up to $30 million in funds for infrastructure. Additionally, the city, it's worth reviewing whether or not perhaps remaining funds from Measure T could actually be applicable here, given the kind of emergency and broadband issue that was embedded within what the voters approved back in 2018. So just to think broadly, it's great the progress we've made. Let's see what more we can do. The students, workers, everybody needs this in this moment. So thank you so much.
Thank you. Mr. Beekman?
Hello, can you hear me?
Yes, sir.
Thank you. I hope the efforts of digital inclusion and Vision Zero can remember how better openness and accountability with technology can add to local neighborhood safety and stability, and offer good definitions to the term equity to help bridge the digital divide. In a massive push by the federal government towards broadband and Vision Zero technology at this time, and the need of teleconferences and learning from home, digital inclusion should be getting most of what they want at this time. Yet it simply feels government is being given a free pass to continue decades of experimentation on the health of people from lower incomes. I hope that in the least, the digital inclusion community of San Jose is comprehending how minimal use practices for the future of technology and broadband in San Jose can work almost as well as oversaturation, and that ideas of technology and its public accountability working well together at the local level can be an incredibly good way to ask for peace and for an end to shock doctrine practices at the national level and of the UN. I think there's a new ideas of proactiveness that can be talked about and shared with this community at this time. And what I'm talking about, I hope will work toward those ideas. Thank you.
Thank you. Tessa? Tessa, if you could remove the, there you go.
Oh, good. I'm so excited. Thank you so much. It worked. Good. Well, yes, it's been great being on the whole council meeting and being able to be home and do that. And I just had input about how our digital communication could be improved. And, you know, I'm totally in support of it being online and getting more digital access for everybody. And that's so important. But I feel that the city could do better, even in terms of our council meetings. That, first of all, I think it needs to, our council members need to really communicate to the public how to get on the Zoom, that it is that we can be working together and be more involved in our democracy. And that needs to be a more outreach. And then even in the documentation of the Zoom abilities in your online, you know, going to the council agenda, it was just so small and tiny. It could have been larger. You know, this is how you go online to talk, you know, and, you know, and how you get the Zoom or whatever. That could have been better to create more outreach to the community. So those are the main things, is that we really need you to do that better, to let us know how to, that we can reach the community through the digital and be online with issues of the city in terms of your council meeting.
Thank you, Tessa. Welcome, Maimoa.
Yes, can you hear me?
Yes.
Hi, my name is Maimona of Alberta, Vice President of the Franklin McKinley School Board and Public School Teacher. I want to thank staff and those working on council who are working to expedite the community wireless project. The COVID-19 pandemic is a really heavy burden for residents who already rely on government services like CalFresh, CalWorks, Medi-Cal, and WIC benefits. Residents need internet access to meet these basic needs, and students also need internet access to participate in distance learning and not fall further behind their peers. There's so much uncertainty about when things will return to some level of normality, and therefore we need the city to act quickly to move to phases 2 and 3 in parallel with the existing projects. And Andrew Hill, Independence, and Oak Grove communities cannot wait until 2021. And we need to ensure that communities like Mount Pleasant and Silver Creek are not left out of the solutions that the city is working on, and specifically they need timelines. I implore the city of San Jose to make the financial investment to urgently move on these long-term projects, to complete them before the end of this year. School districts can also not afford to foot the bill on this alone when it comes to internet, because internet serves so much more than just distance learning. Our students, families, working individuals, businesses, and residents need city leadership to act swiftly and responsibly. Thank you.
Thank you. Forrest, welcome.
Thank you, Mayor. Can you hear me okay?
Yes.
Mayor and Council, my name is Forrest Peterson. I'm a graduate student at Stanford University, School of Engineering. In that capacity, one of my responsibilities is to organize a high school building trades themed program. We call it the Workforce Virtual Design and Construction. This is mostly non-university pathway students who then use some of the graduate student level curriculum and are absolutely unbelievably talented students. Oftentimes, I'm told these students appear to be better than the master's students that we have at Stanford. One of the limitations that we have, because it's a virtual program that brings the students together online, is of course that internet connection, and that's constantly been a problem. And going forward with the current situation, I would just see this program that the city council has proposed as being absolutely essential. Thank you.
Thank you. Peter Ortiz. Welcome.
Hello,
Peter.
Honorable Mayor, City Council. Peter Ortiz here, and I'm speaking as an individual trustee on the Santa Clara County Board of Education. I'd like to speak in support of the memorandum that has been introduced by the Mayor and City Council. I thank all parties who have contributed to the efforts of digital inclusion in San Jose, the city, the county, and of course our County Superintendent, Dr. Dewan. I see this as an equity issue that affects our most hard to reach families, including many that reside in my trustee area of East San Jose. As someone who graduated from Independence and went on to represent the Mount Pleasant School District, I'm familiar with both these communities and understand the vast needs of our families and students. This is an amazing step forward and should be celebrated. And I'm also hoping that there is a way we can expedite this process in order to secure infrastructure to all students who need digital access. Once again, thank you for your efforts, and I hope you'll support this memo. Thank you.
Great, thank you. Hong Ha Wang, welcome.
Hi. Thank you so much for giving me the time to speak. My name is Hong Ha. I am a high school math teacher in San Jose Unified. First off, I want to thank everybody for all the work that has been done. Since COVID-19, I've sort of seen the deficits, especially in my students. A large chunk of my students don't have access to internet or even the devices to participate in distance learning, and this has caused them to fall behind in their studies. And I'm concerned that we're not going to come back to normal anytime soon. School districts cannot do this alone. They've already done a lot to provide our students with the devices they need for distance learning. And I don't think that our districts can support any support internet. So I hope there's a way that we can work together to support our community and to support all students in learning. Thank you.
Thank you. Chava Bustamante, welcome, sir. Chava, you're still on mute. If you could unmute your device.
Okay.
Thank
Can
you.
you hear me now?
Yes, we can. Thank you.
Yeah, Mayor Ricardo, members of the council, good evening. I'm Chava Bustamante with Latinos United for a New America. First, I want to thank you all for your ongoing support for our communities during these challenging times. I frankly wouldn't want to be in your shoes if I had to deal with all the big issues that you've been dealing the whole day today. But tonight I'm here to express Luna's support for the general concept that more students and community members have access to internet. We support the 3 additional community Wi-Fi projects proposed because they are the type of long-term investment we need to make sure more people in San Jose are not left out of vital resources only because they are not connected to the internet. Being connected these days is essential, especially during these times of crisis like the present COVID pandemic. I personally know dozens of families who were not able to apply for the emergency funds offered by Sacred Heart and other organizations simply because they do not have internet at home. As a community organization working to improve the lives of our members, we hope the city will continue to work towards its goal to close the digital divide and partner with other organizations to strengthen its digital infrastructure. Thank you very much.
Thank you. Catherine Hedges? Catherine, you're still on mute. There you
Hi. Thank you, Mayor. Yes, I'd like to echo what the previous.
go. Uh-oh.
Oh, shoot.
Catherine, we'll
I'm
we'll
not-
try to get you back up in just a moment here.
Yes, you can talk on it.
Hello?
Okay. Go ahead, Catherine. We'll start you up again.
Thanks. Yes, thank you, Mayor and City Council. I'd like to echo what the previous speaker's been saying about how we have such levels of inequity with the broadband connection, and it really affects people's ability to participate in the civic process and educate their kids and do their work and get telemedicine. And that's going to be really important until everything, gets back to full, safe healthiness, not the way it was before, but the new normal, when people can actually go do everything in public again. And it's also really important for people with disabilities to have the option of working at home and doing things remotely if possible. So expanding broadband would be a big disability justice issue. Thank you very much.
Thank you. Priscilla Cunha?
Good evening. My name is Priscilla Cuñamena, and I'm on the policy team at Working Partnerships USA. I wanted to express our support for the proposal to develop a funding strategy for the 3 additional community Wi-Fi projects, as well as the possibility of community Wi-Fi projects beyond those. These are the type of long-term infrastructure projects that we need urgently to ensure that students and community members alike have access to the internet, a need that, as we all know, is critical in this moment of emergency, but which will also be needed well beyond the pandemic. I also want to encourage staff and council members to consider the pockets of need that exist in other parts of San Jose, including beyond East San Jose, and wanted to express my support for efforts to identify those areas. So thank you to staff and to our leaders for all the work they've done on this, and have a good evening.
Thank you. Jorge Pacheco Jr.
Hi, everybody. I'm Jorge Pacheco Jr., school board member for the Oak Grove School District and fourth grade teacher for Mountain View Western School District. I'm here also to advocate for the acceleration and expansion of broadband infrastructure and its vitality for not just our families, but for all residents and children in every school district in San Jose. We already know, and I really hope that all of our public officials are holding the belief that broadband and universal Wi-Fi should be a human right, especially during a time of crisis like this. I'm urging that the city collaborate with the Santa Clara County Office of Education, and as they are geo-mapping the dead zones in San Jose, and work to find and figure out what exactly the infrastructure can be and all the funding strategies that will be used to ameliorate this problem. So thank you again to staff and for the city for your advocacy, and I hope that this continues to move forward. Thank you.
Thank you. We also have a caller on the phone. So I'd like to ask the person with the phone number ending 2896. 2896, welcome.
Howdy. So yeah, my name is Mike Mattingly. Listen, I drive around for essential work, and I've been watching all of this stuff go up, and I'm really concerned that you guys are putting towers on top of light stanchions at football fields. You're putting cell phone towers in all the low-income districts. Everybody knows that this stuff is got EMFs, and people, especially me, who's EMF sensitive, has a real predisposition for you don't ever get to rest. You never get to rest when Wi-Fi is in the air all the time. I turn it off at my house. If you guys put this all over my neighborhood, I'm not going to be able to sleep, which means I'm going to have to move. So I'd like you to consider the health risk factors that go into this. And putting these things, like, I don't understand how you guys got released to do this, but the FCC says that you can't have cell phone towers within 1,000 feet of a house or a school. And I'm seeing them on every street light. I see them all over town. I see this is the only thing that is going in around this whole community. We got telecom, and we got people delivering food. And that's what passes for work. And it's very disturbing to me because my kids are going to be inundated with 5G technology and all of this cell phone baloney constantly. I love the fact that you guys are going to try to install not Wi-Fi, but internet into all schools and make sure that every kid has access to that. It should be wired. Go to the California CDC page and you can find a study that shows that Wi-Fi in particular is
Thank you, sir. Okay. All right, back to the council. And just for clarification, I know there was some concern expressed about cell towers. What's actually being deployed throughout the city are thousands of small cells, and those are on existing towers. So I want to make sure we're at least clarifying what some of that work that's underway, which may in fact be helpful to this digital inclusion effort. We know that there may be some ways of leveraging that technology. Councilmember Arenas? All right, Councilmember Arenas, you appear to still be on mute. There you go.
Okay, I clicked it so many times. I guess anyways. Thank you, Mayor, and thank you for acknowledging all the folks who have been part of the digital inclusion work in these last how many ever years. It's just been a while, and I want to thank you, Mayor, for your leadership, as well as your staff, and Dr. Dewan, as well as Chris Funk, and the school board members. I think they all called in, and these were the folks who actually sent us a letter about a month and a half ago, and that's school board member Jorge Pacheco, Kristen Arismath, Lorena Chavez, Maimona Afsal. And they saw something that was happening in the community, and I know we have a lot of things to take care of. I think Chava Bustamante said he is not envious of the position we're in and all the issues that we have to discuss to get the city continue to have the city running. And so I want to thank them for the letter that they sent in and for prompting all of us to once again get this on our work plan. And Jill, for your leadership and just your really quickness, diligence about getting on board. Of course, you were always on board, and just moving this work plan through. I think what I heard from folks is that the need for this digital connection is no longer just connected to our schools. It is now part of our economic recovery. If we want a job, we have to be connected to the internet. The folks are just not taking walk-in applications. That's just not the way our world is going to really work for a while. Or if you wanted, it's mental health awareness, and if you wanted to have a counseling session, you'd have to be connected to the internet. Or if you wanted to ensure that you're not feeling isolated and connecting with other folks, this is the way that we're doing things nowadays. And so it goes really beyond all of the schools. It really is part of an overall recovery and the well-being of our community and our neighborhoods. And so I absolutely support our memo. I did hear that there was, I think there was some advocacy to make sure that there were some of our areas that wouldn't be forgotten. And I wonder, Jill, if I could ask a couple of questions about that, because I think there's some sites that are in phase 3 that I think we could start maybe the design phase. And if it wasn't too much, would it be something that would be amenable? If it's not, I'm willing not to suggest it, but I just heard enough of that feedback from our community.
Yeah, and I'll also ask Superintendent Funk to chime in as well. But we are working together to look at all the next 2 phases and what is needed in terms of this funding strategy, both in terms of the capacity to do the work in an expedited fashion, but also the funding to obviously to make sure that it happens in partnership with everyone that we need to be working with. So I don't know, Chris, if you want to comment on the phase 3 attendance areas and your thoughts about those.
Yeah, I think the biggest key is if we can come back to the council in by the end of June or sooner with a formal built out of the funding plan, that won't slow down the overall project. In fact, I think it will actually speed it up and expedite phase 3. I think once that's all locked in, then it's just a matter of how quickly can staff design and then how quickly do the RFP and get it out there to start installation. So the biggest key is the funding. And so for Eastside, our board meeting next week, we will be passing the resolution for the next round of our tech bond. Those bonds will be sold in early June. We'll have that money by July. And so if we can clearly identify the funding stream to complete Independence, Oak Grove, and Andrew Hill, ideally through the city, then Eastside will be picking up Silver Creek along with Mount Pleasant. The 2 issues with those 2 schools is for whatever reason, we don't have black fiber from the district to those 2 schools. The question is, what's the quickest way of getting that done? And our commitment is if the city finds the funding stream for Independence, Oak Grove, and Andrew Hill, that we will fund then Mount Pleasant and Silver Creek, as well as Oak Grove School District will also pick up some of the neighborhoods out closer to Santa Teresa that have been identified as hotspots that they need taken care of. So I think as long as we can get the funding stream wrapped up in the next month, then maybe the staff will be able to expedite the acceleration of getting all of them started and move forward in a much quicker time.
Something else anyone else wanted to add? Or Jill?
No, I just want to make sure that answered your question and that we are looking at an expedited timeline to go with a funding strategy and bring back options for consideration that weighs the different costs versus the benefits that we all want to see. And I just want to make sure that answered your question.
Yes, it does. Mayor, I saw you leaning in.
Oh, no, I wasn't. No, just leaning.
Okay, wonderful. Well, I think there's an opportunity for us to come back once that that funding strategy is developed. Chris, it sounds like, and you said it's next week that you guys are all talking about that, and you're gonna have it approved. So maybe just prioritizing moving phase 3 forward could be something that we could do in the meantime. So in addition to the accepting your memo and of course moving our the mayor's in our memo, I think maybe prioritizing moving phase 3 forward.
Okay, we were going to include phase 3 in the funding strategy. So it would be for the whole thing.
For the whole thing.
Yeah. But for consideration at that time. So I think we're saying the same thing. That's all.
Okay. So beginning the, okay, I think we're saying the same thing too. All right,
Okay.
so that's my motion.
Is there a second?
Second.
Okay, thank you. Anything more, Councilman Arenas?
No, other than actually, yes. Superintendent Flores wasn't able to hang on the phone for a while there. So she asked me just to reflect, also supporting the build out in Silver Creek and Mount Pleasant. And even though Silver Creek might impact some of the Evergreen School District, Mount Pleasant definitely does not, but she wanted to advocate for those areas. And so hearing loud and clear that many of these areas, some that have dead zones, some that are just not well connected or not connected, are priority. And so I'm just really proud of the work that we're doing. This is a great collaboration. I think everything is lining up really nicely. So I appreciate everybody's work. Dr. Dewan, thank you so much for your leadership. And thank you, everyone. If I haven't mentioned you, Sunny, of course, thank you so much. Thank you for supporting all of us. I know that you've heard many of our concerns and included and also supported a lot of what we've been saying in the last week. So thank you. And that's it, Mayor.
Thank you. Councilmember Sparson?
Thank you, Mayor. So I just wanted to echo my Councilmember Arenas' comments and thank all the people that have been working so hard, both in the last few years and over the past few months. And so thank you, Jill, for bringing your team on so quickly, and Kip and Dolan and all the other school board members who actually started off this sort of last spurt because of concerns about digital learning with what's happening with schools. There was an article today that schools may actually in LA and some other districts may even start later, putting the need for online learning, making online learning that much more important. So I just wanted to also emphasize the fact that and thank Chris Funk and the Eastside Union High School District for their efforts with Oak Grove and Andrew Hill and leading those projects and having them align with the wireless infrastructure projects in this next phase. So I look forward to working with everyone as this much needed project moves forward. Thank you.
Thank you. Vice Mayor Jones?
Thank you, Mayor, and I'll make my thank yous really quick. Thank you, everyone who's been working so hard on this effort. I still have August 1st on the top of my mind, and I want to ask the group: is there an anticipation that school is going to open back up for the upcoming school year, or that we're still going to be in a mandated shelter in place? I guess I'll direct that to Chris Funk.
Well, of course, we are working together with all 31 superintendents of Santa Clara County and with Dr. Dewan. I think our commitment based on the shelter in place or the new governor's orders, executive orders, when they finally come out, as well as with public health, that the goal is that we will all open school at our respective times that have already been established. So for East Side, that would be August 10th. Now, what that looks like is totally still up in the air, whether it's 100% back at school like it was on March 13th, which I highly doubt, or 100% still online distance learning, or a hybrid approach where we're allowed to have some students back on campus. And it's our hope that we have students back on campus in some shape and form. But we're all committed to doing it together in Santa Clara County. I'll defer to Dr. Dewan for more.
Thank you, Superintendent Funk. That was well said. And I think that the important thing to note is that the virus is going to be around for a long time, and that there will have to be safety measures in place if we're allowed to be in person. And some of those safety measures come with a price tag. And we don't know if we'll be able to do all of those things or when we'll be able to do all of those things. So we're engaged in deep planning around all those possibilities, and we are committed to be ready when it is permitted for in-person instruction.
The reason why I asked that question is my anticipation is that schools are not going to be allowed to open in August. I'd be surprised if they were. And once the school year starts and we have literally thousands of students who will not have access to an education, my concern is that I still want to see a plan that's going to address when school opens, how those kids are going to get an education or access to online learning. And I have not seen that yet. And I acknowledge and appreciate my colleagues who have come up with a recommendation to develop a strategy for the East Side, but there's other areas of the city too that have the same issues. And I need to see a plan in place, or at least a strategy on how we're going to accommodate those students when school opens in August.
If I could comment, Councilmember or Vice Mayor, this is exactly why it's such a huge issue, and the solution may look different in different parts of the city. And so, we're really hoping to move forward with East Side, get that going. As I always say, like, get it onto a work plan so that then we can be problem solving some of the other areas. And I think some of the other solutions that we presented, we will be able to come back and say, now this solution is going to help us in this area of the city, or this pilot is going to help us in this area of the city. And again, using that map to be able to see where the gaps are and the needs, and working closely with our partners at the county office to really be able to start, through the distribution of the Digital Inclusion Fund, starting to see that gap getting filled in. And so hopefully, like, each time we have this conversation, we'll be able to advance it a little bit further. But unfortunately, it's not a one solution problem.
No, definitely. So would you be able to come back, or are you developing a strategy to come back to fill the gap between now and say August 10th?
We're planning to come back with regular updates, either through the EOC, format, or any other way that we can provide updates, but just keep the work moving. And as we have new solutions, be able to provide those.
Great. Well, that's all I have, Mayor. Thank you.
Vice Mayor, if I could just also offer, I think we have to acknowledge what we have today is not enough resources. And obviously we're going to do everything we can to find more resources. And I know you know that already, but it would be hard for folks to really articulate a clear strategy without knowing exactly where those resources are. I think, we started on the East Side back in 2015 because for two reasons. One is there was a huge concentration of need there, and because Chris and East Side had really gotten a big head start by getting out there with an E-bond. And that meant it was really lower hanging fruit. And obviously it's taken a long time just to get to this point, but I think we can see that work accelerating. I appreciate very much the fact there's a lot of need in West San Jose and other parts of the city. And, I know Kip is working on some very creative options, but still working on them, and all that stuff needs to be tested. Now, I'm hopeful that in the weeks and months ahead, we're going to start talking about some other solutions. But I think to put the expectation on staff that there would be a clear strategy citywide at this point, beyond simply being able to say there is a need right now that we don't have resources for us. I just want to be honest about what I think our expectations can be of staff right now.
No, I respect that, Mayor. But I'm looking at the start of the school year.
Yeah.
And having those students not have access to an education. And again, my expectation is, I know it's complicated. I know there's a lot of moving parts. But as a council, as policymakers, we need to have a clear understanding of here's the outcome, the end goal.
Yeah.
We all know what that is, that every student has access to an education online. How do we get there? What's going to be the cost? What's going to be the resources that we need? At least have that information. And I know there's not a one size fits all, and I know there's multiple different options and solutions.
Yeah.
But in order for us, again, as policymakers, to be able to solve the problem or address the problem, we have to know what the obstacles are as well as what the challenges are and what the resources are required and the funding that's required.
Fair point.
Have that clear picture.
And I know we certainly a year and a half or 2 years ago, I think we did a first cut at that. And obviously we're refining it more and more as we get more information. Kip, you look like you wanted to jump in.
Yeah, but I've also make sure I'm listening. I think, the work that we're doing on the East Side with Chris Funk and others' leadership is extremely important. It's also a fairly infrastructure and public sector intensive way to solve the problem. The other simultaneous bet that we're making, and I think it's an and both, not an either or, is that we have inked our deals with Verizon and AT&T for $500 million of private sector investment. And so the crucial gap there is two things. One, can we build that infrastructure out in the neighborhoods that need them most first? And two, can we find an affordable way for students and school districts to have access to the devices and technology they need to have access to that form of connectivity, where Wi-Fi is not going to be a viable solution? And so that, in my mind, is the other large bucket of work that we're doing. And I will, there's a lot that's still being cooked on that. I will say that we've had very productive conversations with both Verizon and AT&T. Both of them have indicated a willingness to prioritize their build out to deal with connectivity issues. And both of them are interested in innovative pilots around bridging the digital inclusion gap that exists for students. I think one of the things that we've also been very clear on is not trying to get too far into the turf of the schools and the school districts, and to allow them to be thinking through the larger question of what is distance learning and how does that work, and stay largely in our swim lane of both connectivity and assisting with the digital inclusion. So I think that the strategy is the and both of accelerated Wi-Fi, where we have partners and we have funding streams between the two of us, and working with our private sector partners and figuring out innovative ways to getting connectivity for everybody across the board where that's possible. And we'll come back with more information on that. But my only kind of my one big request is give us more than 2 weeks, and don't give us a definite date to return. Let us work together and come back to you when we either have decisions for you to make or policy questions that we need you to wrestle with. Because part of what we've got is we've got ourselves in a little bit of a loop of working to update rather than working on the work. And because so many of the staff that are doing this are involved in so many different things. Jill's also working on childcare, for example, which I know is extremely important to many of the council members. And I want to make sure that we have enough space for the team, including Marianne and Sunny and Chris and the other partners, to do the work well, with the promise that we will come back with you very, very quickly when we have decision points and we have policy issues that we need to wrestle with.
No, I definitely appreciate that. And thank you, Kip. And I acknowledge that everybody is wearing multiple hats and you're overloaded. And that's one request I have of you and your team is, if you feel that you don't have the bandwidth or the resources to move this forward, and based on our expectations, let us know that as well. Again, that's another roadblock that it's upon us as policymakers to try to figure out how to overcome. So you have to let us know if that's a roadblock or an issue that we can address. That's all I ask. But thank you.
Thank you, Vice Mayor. I just want to acknowledge that I think Marianne has to go to yet another meeting.
Yeah.
So we want to thank her.
Thank you, Dr. Jawan.
Thank you, Mayor. Thank you, council members and everyone. Appreciate the opportunity to serve. Thanks.
Thank you. Councilmember Esparza?
No, I don't think it had been lowered. Let me lower it
Okay,
now.
that's a prior hand. Got it.
Yeah.
Councilmember Foley?
Thank you. Really important topic, really important that we are, that COVID has shed a light, actually, if there's anything positive that's come out of COVID, it's the need to create digital connectivity for all of our students throughout San Jose, and through the help of the County Office of Education. And I really want to give a shout out to Chris Funk, because Chris, you may not remember it, but it's been 10 years since you brought forth the equity policy that San Jose Unified adopted while you were there. Were you aware of that? 10 years. It's still a wonderful piece of legislation, and I know the school board is still looking at it, deciding whether they should change it or not. And I think they've determined that it's held the test of time. So thank you to your leadership, and to your leadership. That is why the digital divide will go away or be diminished in East Side and Evergreen and Oak Grove school districts, because of the leadership you have in leading the bond and then making sure that the funding is available in the East Side schools. But we can't stop there. That's phase 2 and 3, but there are other areas within San Jose that need the hotspots too, and more importantly, need the devices. So I know resources is a huge situation, financial resources, and I've looked at the wish list of the technology of the devices needed. It seems like the list is all the latest and greatest technology. Can you work with less than the latest and greatest technology? Because there are school districts, private schools, who may be upgrading their technology, who have old devices available that might be able to be used and repurposed. Could you use those?
I can answer, and then maybe Chris can clarify if he wants. But from our work with the county office, who's been the center point for all the districts with us, I think the list is rather extensive, and there are different options. We are definitely working with the Tech Exchange to refurbish used devices. I think so. There's probably a threshold of old versus used and refurbishable for use at the schools. And I know we don't want, I know that they can't use certain devices, and we don't want to be sending them things that then just have to be recycled. So I don't know if you want to comment on that.
Yeah, and I think the biggest thing is, Chromebooks are one of the cheapest items you can purchase, and they're great. But particularly at the high school level and middle school, you can't do computer science classes on Chromebooks, and you can't do digital photography or multimedia on Chromebooks. So you're going to need the iPads, the iMacs, and all those. Now, can it be refurbished? Of course. But that's why you see kind of that variety, because the diversity of courses that are offered nowadays needs the technology to match that course.
That makes sense. So if we had a lead on someone who had devices to donate, where would we go with that?
Yeah, so the process that we have set up now is going to be that the Digital Inclusion Fund, or the CETF, and the Digital Inclusion Partnership at the city is the recipient, as after council's action tonight to amend the contract, will be the recipient and the contact for any devices or funds that are going to be donated potentially. And then we're working together to quickly be able to assess the match between the devices or the funds and the district that needs them, and then work with the County Office of Ed to do distribution.
Okay, I appreciate that. And Vice Mayor, I appreciate your frustration in this issue, and August 1st, expecting everyone to, or us to have a plan on how everyone will be back in school and ready to go. But I imagine that the teachers are just as ready to be teaching in person as anyone, because there is that energy that the teachers are missing by not being face-to-face communicating with their students. So it's a difficult world for anyone who's in education, I think, in particular, because you're trying to get feedback from your students and you can't get feedback. And certainly we want to start the school year in a real strong, positive way. This second half of this year is just an asterisk on the school's students' transcripts, but we need to make the next year one that's really important and impactful for them, particularly if they're incoming senior or eighth grader, because that's really, really critical for the incoming seniors. But I appreciate your frustration, and this is a huge step in the right direction. And hopefully we can get you some devices that will help some of our students. But thank you. I'm happy to be part of the council members who signed on this memo. Thank you.
Thank you for doing so. Councilmember Carrasco.
Thank you so much. And I know it's late, and at the risk of sounding redundant, I just wanted to make sure that I thanked everybody. So I'm not going to name everyone because it's a huge list, but I do want to give one shout out. So forgive me, and that's to my former superintendent, Mr. Chris Funk. And I think it's just noteworthy for a couple of things. You may all not know this little secret, but Chris and I go way back to middle school. We were classmates back then. So greatness runs in our blood. We were both in seventh and eighth grade at Hoover Middle School. But better news is that he really showed such great leadership when I was serving on the East Side School Board. And I know that everyone has thanked him, but I really want to acknowledge his creativity and ingenuity and real leadership at a time when I think folks were speaking about connectivity, but not in the same way that we are now. Who would have thunk it that that COVID-19 was really going to highlight what we already knew, the disparity and the academic and educational gaps that we were looking at, that we were trying to address. And in the middle of Silicon Valley, where we were experiencing such a disconnect on the east side of San Jose, in Santa Clara County, where we were, where East Side is really the home to the largest high school district in Northern Cal, and yet our kiddos didn't have access to one of the greatest technologies or ingenuities in the probably in the 21st century. And so, Chris, I want to make sure that I acknowledge you and really thank you for your leadership, and also thank the voters because they had the kind of faith that they did, and belief that our students deserved to be connected. And what was really, I think, noteworthy about this bond was that it wasn't just about the infrastructure, but it was also about the hardware. And we know that, within just a few years, the hardware is outdated. It's moving so quickly. And so this gave us an opportunity to upgrade it as fast as we needed to upgrade. And so I want to acknowledge your insistence and really your vision at a time, like I said, when folks were talking about it, but I don't think they were nearly as excited as everyone is at the moment. And so uh, now sitting in a different chair and seeing how it's come to fruition and allowed for a foundation of partnerships throughout the county, but most definitely in the largest city in the county, which is with San Jose. I know it's not the first partnership that we've had with Eastside Union High School District, and it won't be the last, but it's most definitely one of the most significant relationships, in my opinion, which is to make sure that that not only our students are going to be connected, but so many other residents in the city are going to be connected as a result of what was birthed. What was that? Maybe 5, 6. What was that? 7 years ago, Chris? Maybe. So I want to thank you. But now I need to give you, your props for something that I just learned thanks to my council colleague, Council Member Foley. You birthed the idea of an equity policy that I think is, again, it's something that we're talking about, and we're going to really have to examine just throughout the city and how we look at issues. So again, a visionary of Hoover Middle School, and one that a legacy that I'm very proud of. But thank you so much, because again, I think what's happening is that COVID-19 is just really highlighting and emphasizing so many of the issues that we're all dealing with. And when we've been talking about how COVID-19 has been impacting certain zip codes, it's not a coincidence, an accident, or a mistake that the same numbers that COVID-19 is impacting, that we're seeing also where the disparities are in terms of the education and the schools that we're looking to make sure are connected and up and running. So I want to thank also the school board members that sit on this council that know how important it is to get connected and are pushing as well. Pam Foley, what is it? Sylvia Arenas, Maya Esparza. Who else are my other school board members?
You.
Oh yeah, me. Okay, thank you. But I thought Deb Davis was also a school board member. Sorry, I apologize for that. But also all the school board members that have been here from Franklin McKinley, from San Jose Unified, that have been part of it, Eastside Union High School District, and they serve because they believe. They serve because they have such faith in the future of our students, and it's really been an honor to watch them and to see everybody advocate with such an incredible amount of passion and dedication. They don't get paid a stipend to, now of course we're Zooming, but a stipend to drive once or twice a month to their meetings or school sites. It's a stipend. You're basically doing it on a volunteer basis. So I want to thank everybody for that. And of course, our staff and the staff that works from all the other districts and offices. So thank you so much, Mayor, for allowing me to indulge a little bit. And thank you again, Chris, for your leadership. I really applaud you, and I will make sure that you're consistently acknowledged as a former Hoover Hawk.
Well, thank you for your kind words. Mayor, move me off this, please.
We know you're just buttering him up so he doesn't spill the beans on whatever happened in 7th grade.
That's enough.
Yep. Councilmember Rennes. Councilmember Rennes, I think you're still on mute.
Yeah, I apologize. Thank you. I wanted to also highlight that last week, that's not me doing that.
That's okay. You can talk. We'll listen.
Okay.
And
All right. I just want to let you all know.
Yeah.
I'm messing it up. So I just wanted to let you all know that if you hadn't, you probably have already heard, but there was the county approved 11,000 devices and hotspots for and that's countywide. So Vice Mayor, I heard you loud and clear. This I know is an issue that's a concern to you, and since this partnership between the City of San Jose, the Eastside Union High School District, and all of the stakeholders, we're not bound by the Brown Act. I think there's a number of council members that can join. I think you've been one of the leaders in voicing your concerns about the digital divide. I think Deb, Councilmember Davis, you had also expressed that in rules. Anyway, so I just wanted to make sure that you knew that, so that you can continue to advocate. I absolutely believe that everybody in San Jose should be connected, because it's not just only for school educational purposes, but it's really our lifeline right now. It's our jobs, it's our mental health, it's our overall well-being, and so it's absolutely now becoming an essential service, I think, for the City of San Jose. So I know that we have this in our memo already, Jill, but I just wanted to ask you, when you're talking about putting together a funding strategy, what are you considering? What are you putting to? What sources are you considering?
We're starting with the agreements that we've had in place before. Obviously, Eastside brings the funding from their tech bond. We're leveraging the community development block grant funding for at least 2 of the service areas. And then I know that Chris is working with some of his other the feeder schools, I think, to look at commitments there to contribute. And then I think that we need to look at what the outstanding amount is and what are some of the options. I know we've stated last time that we spoke that although the schools may receive CARES funding, our understanding from working with the county office is that that funding is overtaxed to begin with, and it is not, it's unlikely that there will be a significant amount left over, but we will have to work with the superintendent to fully vet that. And then we'll have to explore other possibilities that could be contributed, possibly from the city or other resources.
Well, I think that if we vet their CARES funding, we should also vet our CARES funding. And I think you should be able to connect with Lee at the very least to figure out how that could be just one of the many options from the funding sources that you already listed. By the way, I love the fan on your hair. You look like Beyonce.
It's very hot in here, and I have to keep the door closed because of the dog. So I get warm after 8 hours.
I have to give credit where credit is due. Thank you.
Okay, and we also have to give relief to people who've been sitting here for 8 hours. So I think it's time to vote, right? Councilmember Esparza.
Yeah, I'll be really quick. So on the including some of our own CARES Act funds, I believe that was in the presentation in the COVID report. I'm looking at it now, where it did include the possibility of $4 million for digital inclusion and telework. Correct. So perhaps we can continue to explore our own CARES Act funding as this moves forward.
Yes.
Yeah, I think that's always been the plan, but I think the expectation was that we'd be doing this in partnership, and other school districts that are receiving the CARES Act money would also participate.
Great. Thank you. I'm ready to vote too.
Okay, great. Let's vote, Tony.
Jimenez,
Yes.
Perales,
Yes.
Diep,
Aye.
Carrasco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Yes.
Jones,
Aye.
Liccardo.
Aye.
Thank you.
Okay, we've got 9 items to go here before the midnight bell. So I'm going to institute a 5-minute rule here for all of us on the council, unless someone wants to suggest something otherwise by motion. But it's important for me that we get through all these items, particularly since many media items are at the very end relating to tenant protections. So first, item 3.5, San Jose al fresco. There is no presentation here, but there is a memorandum from Councilmember Davis and myself. Councilmember Davis.
Motion to approve.
Thank you. I was just going to move approval and give a few comments, but it sounds like everybody's ready to go. Just would like to say that just for the benefit of the public who may be wondering, I got a couple of emails about this, and just wanted to make sure everyone is aware that we're not saying that restaurants can open or anything else can open. What we're trying to do is to have our policies all ready to go for when we get the go ahead from the county and the state. So we're just trying to be forward thinking and planning ahead, and to be ready for, the governor had his guidelines, released his guidelines last week, Tuesday, for reopening in-person dining. So we're wanting to be, and those encouraged having outdoor dining and having a lot of physical distancing. So we want to make sure that our policies are ready to go. So that was the impetus for this memo, and I will move approval.
Second.
Councilmember Perales.
Thank you, Mayor. And briefly as well, the second recommendation on your memo stated, explore ways to permit low-cost infrastructure, designate service areas, 3D printed barriers, paint, plotted plants, etc., particularly for legal alcoholic beverage consumption outside of restaurants in accordance with state law. And for those that follow, the state law is allowing the consumption and sales of alcohol to expand out into the public's right away. And so this actually was a major hurdle when we had our pilot on San Pedro last year, both ABC. So it's great news that we have that out of the way. But the other issue was with our own local police department ensuring that we didn't have these, sort of large outdoor gathering areas that didn't have really distinguished borders or barriers for both being able to manage and maintain people so they didn't just walk off with alcohol. And then the other purpose was so that if we're using what was the road right away previously, that we didn't have cars accidentally barrel down some of these areas. And so I do really appreciate that, and I hope that we can resolve that, because I think in resolving that in itself now seems to be, for me, from the pilot we did last year, the final remaining hurdle to make this actually something that is cost effective and feasible and that will be beneficial to our businesses. So I look forward to that.
Thank you, Councilmember Paulson. I think I know from my former role that you only really appreciate these issues at great depth when you are a downtown council member. And you just understand how important it is to try to get past ABC. So we have many members of the public who would like to speak, and I haven't called on them yet. So let me do that before I go back to council. John Herringer?
Yes, can you guys hear me?
Yep, John.
Fantastic. Well, thank you so much for having me. I'll tell you what, so I have a fitness studio in San Jose, California, and I thought that I do pretty well with fitness and endurance, but you guys have been here for hours. I've been off and on, and I got my hat's off to you for all the endurance of this event of a council meeting. So I wanted to bring to light with this, I know the alfresco is mainly about the dining is what I hear, but there are a lot of fitness studios and yoga studios, just like myself, that can't wait for this to get through and pass. So I just want to stress the urgency for not just the restaurants, but for other businesses like mine, specifically fitness, that are drastically affected by this closure, especially since we're being lumped, boutique fitness studios are being lumped in together with large big box gyms, which is severely impacting us in terms of reopening. Pushed out to phase 3 instead of an early. So I just want to stress that hopefully the council can move this ordinance through a lot faster and make sure that we can open in some capacity, whether on public property or even private.
Thanks, John. Nate LeBlanc?
Thank you, Mayor, and hello, distinguished council people. Quite the consent calendar today, but I won't waste my time on that. I just want to take my 52 seconds here to urge you all to think about this differently, try to allow as much as possible to happen by right, and to set as low of a barrier as is conscionable, to let the businesses figure this out for themselves. They're not going to endanger their constituents. They're so safety focused now. They've had 10 weeks to think about how they're going to do this. Let's trust our entrepreneurs and our small business people that we haven't been able to help much through civic actions up to this point, that they can figure this out for themselves to do safely. Let's use sideways, paseos, parking lots, streets when applicable, and allow people to spread out. And I just want to take this last couple of seconds to say, please just stay out of their way, and as much as humanly possible, allow this to happen by right, at least in downtown.
Thanks, Nate. Welcome, Blair.
Hi, thank you. I wanted to quickly offer that it was a very nice explanation by Councilperson Davis. She described it, so I guess what the last person just spoke about, we know how to work off of what she's just spoken about. So I just wanted to thank her for that, and good luck with this issue. Thank you.
Thank you. Tessa? Tessa, I think you're still on mute there. You need to take your mute off.
Mute. How about that? Can you hear me?
Yep.
Oh, you can? Good. Okay, my own concern, of course, is public health, and that the role of government is to protect us from harm. And to say that businesses will do the right thing is the wrong thing. It has to be government over business. And so what I'm saying, my concern about this al fresco issue is that it will take over the public space for the corporations, and that we as individuals will be losing our safety because it will infringe on our ability to walk and to walk safely because they will be in our public space. They're, making money, and that we will be exposed to their, potential COVID-19 because they will be so close to us because they have taken over our public space. So this concerns me, and that we really need to make sure that the public has right of way to walk and use our public spaces without selling it to businesses. So that's one of my major concerns, is that we really make sure that we have safe passage in our community and don't sell our public.
Thank you, Tessa. Former Vice Mayor Rose Herrera, welcome.
Thank you, Mayor. So I'm also president of Involved Evergreen. I come here tonight from both perspectives. Thank you, Mayor and Councilmember Davis, for this creative and innovative proposal to allow businesses to expand into outdoor spaces, parking lots, city public spaces, and including streets. Our small businesses have been hit hard by the economic disaster created by this pandemic, resulting in financial hardship and unemployment. This proposal can really help businesses bring back customers to a safe environment. San Jose has some of the best weather in the United States, and it makes sense that we take advantage of this by allowing small businesses to utilize outdoor spaces. Restaurants, shops, exercise, maybe even a haircut can be done outdoors. Businesses throughout San Jose could be encouraged to expand outdoors as long as we are clear about the rules and requirements and do not make it cost prohibitive to these businesses to participate. I think there would be strong interest. I just want to suggest that we make sure that businesses all around the city have that opportunity, not just in downtown. In my neighborhood, for example, Evergreen Village Square has the potential for businesses to expand into the sidewalk, parking lots, and streets if there was a program that allowed it. We need to move on this initiative as quickly as possible. Thank you.
Thank you. Jason Allred.
Hi, everyone. Thanks. I just wanted to echo what Nate LeBlanc said, and I think that we don't need to worry about businesses doing whatever it is they think they want to do and taking over sidewalks and stuff. That's not what's going to happen. You guys are going to come up with the appropriate guidelines, and like Nate said, just let us get out there by right. We will do what we always do, which is we'll be involved with our communities, and we're going to be safe about it. So I just want to echo what he said, and thank you for this. So it's going to help us out. Thank you.
Thank you. All right, returning. I'm sorry. On
2896.
Oh, okay. The telephone caller with the number ending 2896. Welcome.
Welcome. Hey, thank you. My name is Mike Mattingly again, and yeah, this is going to be good for drivers like myself who do Uber and Lyft. I'm looking forward to you opening back up. By the way, you guys should check out Event 201. I encourage each one of you, because you said earlier that you were waiting for Bloomberg and St. John's College or John Hopkins, and those people put on this event that explains exactly what's happening right now. So check out Event 201, and then you'll see if this is even worth doing. But the rights of the people should be respected, and the business owners know what they're doing. Thank you.
Councilmember Arenas.
Thank you. Awesome. So I have a couple of questions. What are some of the costs? I know, and I want to make sure that I'm supportive of small businesses. I agree with former Vice Mayor who's just on the phone. Evergreen Village Square is a perfect place. Actually, it is a place where a couple of times and during the summer, we have these festivals. We also have Mamapalooza. We have all kinds of stuff happening there. And anytime they close off those areas so that people can walk, there's a little alcohol, it's a wine walk. It costs about like $6,000 to block off. And I don't, it's not even a street, it's a little loop. So I'm just concerned about where the money is coming from for some of these fees that will waiver.
I'm sorry, was that a question for me, council member, or for
No,
staff?
no, it doesn't. It's not for you. No, whoever can answer it. I don't know who will be able to answer.
What would be the source of funding for a waiver? Is that essentially it?
Yeah, what's the source of
Yeah.
funding?
Let me just take a first cut, and because I know staff may be occupied right now. I just say that first, I think as we think about creative ideas like the one Councilmember Perales thought of around using VTA funding that otherwise would have gone to this year's Kaye, if we could maybe kill two birds, pardon the bad pun, I know, but the idea of, putting up barriers that could close lanes, that could enable us both to expand bike and pedestrian access as well as on a closed lane while we're moving cables out to sidewalks. That could be one way of using that money twice in some locations. I would also suspect that if we're able to get to the point where we're able to create, and I know there's some pretty creative designers out there, urbanists like Jeff Speck, that have thought a lot about this, create some basic designs and patterns that we can tell business owners, look, if you guys can pay for building this out, you guys can just do it. We'll make the fees go away if you guys meet this basic standard. And hopefully, if there's a minimal amount of touching on our part, that would justify us charging less fees. I know that's a much longer conversation we need to have with everybody in the budget team and everyone else, but I'd like to believe if there's less city engagement, it may mean less city costs as well. I see Blog A and Kim have actually joined. Forgive me. You guys want to jump in?
Yeah, hi, this is Kim Wallish. I would agree with what the mayor said. The city has fees and charges that you adopt every year in the budget. They're generally related to the number of hours that staff need to be involved in reviewing or approving something. So we're going to work really hard to try to minimize the amount of staff involved as one strategy to get fees down, and look for other sources to cover costs, whether it's city costs or costs that the business would need to assume.
Okay, well, I guess that'll come back in this budget.
Probably not.
Probably not that quickly.
Okay.
I think we're trying to get this back in summer, but I don't know, it's part of the budget. And the council member, just it may be, and I'm not familiar with the event you spoke about, but we may be talking about special events and special event permits. And those fees are a lot more. They're one-time fees, and it costs for the city staff and police and anything else we need to accommodate that. This is taking a different approach to do it by right and to do it on a temporary basis, but to at least open it up, and it's more permanent than just a special event. So I think it's a different animal, I think, but that's something we're going to have to come back with.
Yeah, but Rick, it still involves alcohol consumption outside.
Oh, I understand. And,
right.
And the police are going to have to be involved, and that's why we got to sort of vet it amongst staff and bring it back to you.
Okay, got it. Okay, yes, and I agree with Councilmember Perales. I think it's the consumption, the alcoholic beverage consumption piece that really gets us to have more police presence in some of these events. And so, yes, I'd like for us to be more sensitive to that. Over in Evergreen Village Square, we had, I think, Sophie's Grill and Curry Pizza both received storefront grants. I know that my office worked, I think, the first year that we were around to make that a citywide grant. So that because I think it used to be exclusive to the downtown area. Now, I think that's a really good pairing for this program is the storefront grant. And I don't know if maybe we can make some changes to the storefront grant so it could fit the alfresco idea and uses. But I think that we should explore to see how we can kind of marry those two programs together.
Yeah, agree. We made some changes to it a number of years ago so that you can use it for tenant improvements inside the space or outside the space, including sidewalk cafes, and just making the outside of a building nicer and kind of place you would want it to hang out and maybe have a restaurant on the sidewalk.
Yeah, I would, and I know this is not exclusive to the downtown, and so I really would love for us to, as you're thinking about the ideal geographic locations for alfresco, to think of all of our districts. My district is huge, so we have a lot of outdoor space and a lot of possibilities. So alfresco and evergreen, we'll use it in a hashtag and get it going.
Sounds good. We're really glad that this direction is to look at it citywide.
Yeah, thank you. Those were my questions, really. But otherwise, I love the idea of this. I love the program. I think we have to make sure that we support our businesses and enjoy the outdoor weather and cure the cabin fever that people are kind of getting sick of being inside. So thank you for bringing this forward, Mayor and Councilmember Davis.
Thank you, Councilmember. Councilmember Esparza?
Thank you. So I'd like to thank the mayor and Councilmember Davis for bringing forward this creative proposal. And so I just had some questions that my community had asked me, which is, what neighborhood outreach are we going to do in communities where we do put al fresco dining?
I think that's a really important question. So, we'll have to figure that out now that we're getting direction to dive in on this. Clearly, because it's citywide, like I said, we're very excited about that. We're going to need to partner with neighborhood organizations, neighborhood business districts, community organizations that really know the communities to figure out where is the best place to focus these efforts.
Okay. Yeah, no, it's really exciting. And are we, so in doing that kind of matchmaking, you're looking on where it's appropriate for the community, for noise levels, all that kind of stuff as well?
Yes.
So, great. And so I had another question is, as this is hopefully will encourage and support our businesses in opening up in a socially distant manner, are we also looking at the workforce in terms of PPEs, or not PPEs, the masks, and including outreach so that businesses know how to support their workforce as we do reopen?
That's really the part of the work of our EOC, including the liaison branch that Blage and I are both very involved with. It's really our responsibility to help push out all the information that the county is providing to businesses, including restaurants, about how to operate safely, and then to understand where there's gaps and try to fill in and answer questions.
And so as we do go to offer al fresco, are we going to kind of make that extra effort so everybody kind of knows what they need to do in order to reopen or expand their footprint so that they can still open up?
Absolutely, yeah.
Okay.
Well, that's really been our core work, and we'll be continuing that work definitely over the next several months, probably through the rest of the year as the situation continues to evolve.
Okay. Great, thank you. That's it.
Vice Mayor Jones?
Thank you, Mayor. I want to commend you and Councilmember Davis for a really innovative idea. I know that even psychologically for the small businesses, this is going to go a long way. They're looking for a ray of hope, and I think this is going to give them some of that. I also want you to consider the areas like in my district where we have the big shopping centers with large parking lots that can be underutilized right now, and how we can utilize that and expand that into something that's going to support the businesses, create a destination for our residents, and be able to spend outdoors and get fresh air, have a bite to eat, have a drink, and enjoy themselves. So I don't want the more suburban or residential areas to be forgotten when we roll out this plan and the strategy. I also want to say that the Small Business Advisory Task Force also submitted a letter, and they commended you, Mayor, and Councilmember Davis for your support of small business and opening up the economy for for these businesses to be able to at least maintain and hopefully continue to operate in the future. So thank you very much for that.
Thank you, Vice Mayor. And I just wanted to offer, so you know that we are very interested in the more suburban parts of our city. Joel Develcourt, who's on our team, who is actually the one who coined the term San Jose al fresco, his observation a few days ago was that it may be in the strip malls that this is the easiest to actually implement, where you've got just a bunch of private parking spaces and someone can put a yoga studio out there pretty quickly without a lot of city involvement and hopefully with fairly simply. So I think this absolutely is something we can take to all corners of the city. Obviously, there are going to be harder geographies than in some places, but there's no reason why we shouldn't be able to see this in every district. Great. Any other questions? All right, then let's vote on Councilmember Davis's motion.
Jimenez,
Yes.
Peralez,
Aye.
Dieppe,
Aye.
Crosco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas. Arenas, you're muted. Yes. Okay, I think she's nodding. I'm going to put Arenas down as yes.
Yes, I'm sorry. I don't know what that keeps happening. I apologize.
Foley,
Aye.
Camus,
Yes.
Jones,
Aye.
Licardo.
Aye.
Thank you.
Okay, we're on to the, thank you. The urgency ordinance and companion ordinance to require fabric face coverings is item 3.6. Now, do we need a special vote on this, Rick, since it's urgency ordinance?
For the urgency ordinance, you'll need 8 votes.
Okay. So, Vice Mayor, should I go to the public first or?
Yes, let's take public comments first.
Okay, great. Former Vice Mayor Rose Herrera.
Thank you so much, Mayor. It's been worth the wait. Not really, no, kidding. I strongly support Vice Mayor Jones and Councilmember Jimenez's memo, the urgency ordinance and the requirement to wear face coverings in San Jose. Until we have a vaccine and or a treatment for COVID-19, wearing masks and social distancing, along with hand washing, are some of the only ways to protect ourselves from this virus. And especially when we know that some people are contagious and yet show no symptoms. We need to educate our community about how and why it is important to wear masks. Launch a public relations campaign to encourage people to wear masks. Creatively involve the community in promoting the practice. It doesn't come naturally. Most of us don't really enjoy it, but we do it because we know it's important. If we want to open up our economy, getting more people wearing masks will enable us to do so more safely. It relates to the previous topic we just discussed. If we have businesses out in parking lots, people are going to feel a lot more comfortable when they see people wearing masks, even outdoors. San Jose is the largest city in Santa Clara County with the most cases of COVID and the most deaths. We need to set an example. Other counties are requiring masks be worn. Other cities within our county are also requiring masks. San Jose needs to take this step to protect our residents. There's no higher priority for all of you than to protect residents. Please vote yes to protect all San Jose residents by passing the urgency ordinance and requiring mask wearing. Thank you.
Thank you. I have Rachel Cooper.
Hi. As a constituent in Sergio's district, I do not support this mandate. On principle, individuals should be responsible for making choices that match their personal risk tolerance. Practically speaking, by changing this guidance to a mandate, it will require a level of enforcement. And I wonder if the council has thoroughly thought through questions such as, what would enforcement look like for this mandate? Do you have support from our law enforcement to carry out this mandate? How will you ensure that this mandate won't disproportionately affect low-income individuals in our community? And what are some of the unintended consequences that could be a result of this mandate? quite frankly, I'm disgusted by the amount of gloves and masks I'm finding littered everywhere in this county. As someone who works in a biosafety level 2 infectious diseases research lab, I cringe watching people use and dispose of them improperly, and it makes me question their effectiveness of mitigating the spread of the SARS-CoV-2 virus.
Thank you, Ms. Cooper. Mr. Beekman.
Hello.
Hi, Blair.
Hi. Thank you. Thank you for bringing this to council. We're at an awkward time to work on this issue. It's nice that Councilperson Jones is trying to ask about it. I'm hoping today that you can talk about some reasons exactly why masks are not being used, are not mandatory in Santa Clara County, whereas they are in most other Bay Area counties. A simple explanation, I think, would be helpful to clarify things for all of us. And I hope we can work on those terms. I guess that's about it. I wanted to apologize for my words at 3.1 today. And, it's an important learning experience we all go through. I've really enjoyed public comment today. And thank you.
Thank you. Catherine Hedges.
Thank you, Mayor and Council. I think it is important to mandate masks in San Jose. And honestly, San Jose businesses are losing sales for me because when I go to a hardware store and most of the people are not wearing masks, or I go to the grocery store and they're not wearing masks, I feel unsafe. If I go to an adjacent city like Sunnyvale or Milpitas that does have masks required, I feel much safer. And those cities probably don't really want me coming over in case I have COVID-19. And regarding the person who talked about people and their individual risk tolerance, I mean, as much as I think of myself being protected, really the masks are most effective at protecting other people. But people are taking a long time to understand that, and they don't really care if they're protecting other people or not, and they don't really understand that they could be infected. Thank you.
Thank you. Tessa.
Unmute. Thank you so much. One of the things in the French Revolution was 3 issues, and one is freedom, equality, and fraternity. But what the definition of freedom is, you can do whatever you want as long as it doesn't harm anybody else. And we have to really take that to re-understand the definition of freedom, as long as it doesn't hurt anybody else. And yes, I am a big supporter of the mandate of wearing masks. And I see it as, when I see somebody wearing a mask, I feel solidarity. I feel like they care about me. And that is a good muscle for us to use, that I care about you. And that's what wearing a mask shows. And when I've asked, like even our farmers market, to require that, they said, it'll be like socialists and communism or whatever. And these are not the issues. These are science. This is health. And like the Mercury News says, public health has to be our #1 concern. And so requiring the masks is very essential for our public health.
Thank you. Robert Aguirre.
Yeah, I'm concerned about this mandate of requiring people to wear masks. And I understand from the general public that's probably a good thing. But if you're unhoused, where are you going to get a mask? How are you going to keep it clean? How are you going to be able to go from place to place if you don't have a mask? And what is the risk of being somehow arrested or cited or somehow punished for the fact that you can't afford a mask or don't have a mask? And unless we provide masks for all the people that are living outdoors, I don't see how you can actually, enforce something like this. And through no fault of their own, they have no access to these safety precautions. And I know I've been working with a group to try to pass out masks, gloves, hand sanitizer to people out in the streets, but we don't have the capacity to cover everyone. So that's something you seriously need to consider. And I would say that we need to have people that are unhoused working with the city so that when these things are come up, that we can have that perspective.
Robert, I hope you'll stay on the line. We'll address that issue pretty squarely, so please stay with us. M. Alvarez?
Hi, can you hear me?
Yes, we can.
Hi, great. Thanks for taking my call. I want to come at this from a unique perspective. I have a health and wellness practice, and I've seen tremendous strides in my patients with raising their fluid pH. There's a clear correlation. You can ask me, you can ask my colleagues, but with low pH and poor health outcomes. My concern about the mask mandates is that the overuse of masks will, I guarantee you, raise carbon dioxide levels in the blood, decrease oxygen, which lowers the fluid pH, which makes us more susceptible to infection. Infection does like more acidic blood levels, and I see that. I see that so much in my practice. Mandatory mask wearing is really short-sighted, and it's actually a narrow approach. If you want to talk about preventing disease, we're talking about not spreading droplets. So if we're not sneezing and we're not coughing, I think it behooves a person to be able to breathe oxygen and keep their health levels up. 25% of our population suffer from anemia, and that's just a condition of varying origins of not being able to have enough blood oxygen, not having enough heme in their body. So, what would it do to place a mask on an individual who's anemic, who may not know they're anemic, who may be a chronic fatigue patient, and this is many people, and sticking a mask on them and expecting them to walk around? We're really looking at this from a short-sighted perspective.
Alvarez, thank you.
Not looking at it from the view of health. Thank you.
Thank you, Ms. Alvarez. Brennan Alvarado?
Mute myself. Can you hear me? Can you hear me?
Yes, sir.
Great, thank you. Mayor San Licardo and council, thank you for your time. This is obviously a very big topic, and I want to point out that I am not in favor of the mandate and that I would like to provide a potential alternative to not having an enforcement tactic. I guess I'd really like to hear the why we are creating a mandate that we don't expect maybe a lot of people to follow. Not to mention, if I think I heard correctly, Mayor Sam Licardo, you had said that even our chief of police isn't interested in the enforcement aspect of this. So there really realistically isn't going to be a strong presence of that. But I did really want to point out that there's a lot of anxiety, confusion, and stress and conflict among community members. And if we make this mandate, I'm concerned that a lot of community members are going to continue to raise conflict among each other. And I think instead of creating a mandate to criminalize this not use of using a mask, which has a lot of reasons why you don't want to use it, from health, sanitation, anxiety, and other reasons, just definitely incentivize people and make a campaign for people using masks. That's all. Thank you.
Thank you, Brandon. Okay, we have a caller on a phone number ending 6137.
Can you hear me?
Yes, thank you.
Okay, yes. So I want to ask you to vote no on the mandatory mask. Mask can only block 0.03 microns. The COVID-19 virus is 0.0125 microns. So that would be like using a chain link fence to keep out mosquitoes. On the box of face masks, it says that this product will not provide any protection against COVID-19 or other viruses. Dr. Jen Ashton, a surgeon, says that masks cannot block the tiny particle size of coronaviruses or virus. Those viruses can pretty much go right through the mask. Requiring a face mask is no small ask when it is completely ineffective. And it does not come without health risks when you have to wear it for an extended amount of time. We are not meant to breathe our carbon dioxide. It can lead to headaches, dizziness, and passing out. And
I'm sorry, ma'am. Oh, okay. Okay. Mike Mattingly?
Hello again. So yeah, just check out Dr. Russell Blaylock's face masks pose serious risk to the healthy. It's a comparison study and basically shows like 14, 15 peer-reviewed studies, and they all point to the same thing. By the way, the deaths in Santa Clara, it's 135. The total cases of COVID is 2,470. Hospitalized is 90. New deaths is 0. Available beds is 2,235. In use is 1,320. Available ventilators is 1,231. COVID patients on ventilators, 0. Surge beds in use, 0. We don't have a health crisis. This is baloney. Please stop the nonsense. Check out Event 201. John Hopkins and Bloomberg were put on by Bill and Melinda Gates to run this program that you guys are instituting. Please understand, we know what's up.
Thank you, Ms. Mattingly. Phone number ending 1367.
Yes, this is Lillian, District 6. I'm sorry I had to laugh a little bit. It's not something that gentleman is making out to be. It is a real thing, and people are dying. So I hope the general public doesn't fall for that. But anyway, under the portion of where it says face coverings, I read it. It says individuals are not required to wear a face covering in a space not visited regularly by the public or coworkers, but that individual must put on a face covering when coworkers are nearby or anywhere members of the public or other coworkers are regularly present. Personally, I wear a scarf with something inside of it when I go out. I feel protected by wearing the face covering, and I just feel better about it. When I look at the rest of the world, everybody else is wearing some kind of a mask or a face covering. You are specific in how you wrote the face coverings, and there are exemptions for it. I really hope our city workers and our city construction workers on their sites also wear them. Thank you.
Thank you. Finally, last caller is 4642. Welcome.
Hello?
Hi.
Hi, Kylie Modiri here. I strongly oppose this mandate simply on the following. Death masks are being used by the majority of the public, as we can see. On the box, it clearly states this product is an ear loop mask. It will not provide protection against coronavirus, COVID, or any other contaminant. So that seems pretty counterproductive. It's really just giving the public a false sense of security, especially when we're talking about, toddlers and young children. That's not the kind of norm that we want to create. If this is really, really about health, we know now that cloth masks are creating too much moisture, and that's causing a breeding ground for bacteria. Dr. Baylock has discussed by wearing a mask, you exhale viruses. They'll not be able to escape, and they concentrate in the nasal passages, which can enter into the brain. So we know this information is out there. If we're talking about a virus that has such high success rates, especially among the healthy and young, why aren't we talking about herd immunity? Why, if we're really looking at a preventative measure, why aren't we discussing how people get exposed, create antibodies, and we establish herd immunity?
Thank you. I just want to say thank you to all the members of the community who came out to speak. I know there are a lot of strong feelings, I should say, about this issue on both sides. I'd like to thank Councilmember Jimenez and Vice Mayor for bringing this forward. I'm going to support it. I'm going to do so for a few basic reasons. One is it is clearly the best practice throughout the world in dealing with this virus and other viruses where we have outbreaks and epidemics to be wearing masks. No, they do not serve primarily to protect the mask wearer. They serve to protect everyone else. And that is a critical, important public health objective right now. And it's far less intrusive than a lot of other things we'd have to do if we end up getting a second spike in cases. And we know, as we're seeing right now, and spikes right now going on in Texas and elsewhere, we are certainly not out of the woods. So taking these very modest measures will go a long way. Appreciate the concerns raised by Robert Aguirre about potential police enforcement, particularly on homeless. I'm confident, based on my conversations with the chief and others, that we are not going to be engaging in proactive arrests or citation for the most part, unless there's some incredible willful disobedience. I would imagine that overwhelmingly it's simply going to be a warning, hey, why don't you put on a mask? And obviously, if a person doesn't have the ability to get one immediately, I think most folks will understand. The reason why we would have something like this, knowing that we're not going to be out there arresting people or issuing fines at every violation, is because it is important to establish norms of behavior, and laws do serve to establish those norms, even if they are not perfectly enforced or enforced to the maximum. And I think we all know that from our daily experience, whether it's driving or jaywalking or anything else. So I am supportive of this effort. I think this is a very modest step to ensuring that hopefully we can all get more people back to work. That is my most important priority, is safely getting people back to work so they can earn a paycheck, because we've got thousands of families struggling on the edge right now. And we've got to take these basic minimal steps to ensure everybody can get back to work quickly. Councilor Camus. Rick,
Yeah,
you want-
Mayor, sorry.
Mayor, can I interrupt? I thought you were going to call on Councilmember Jones.
But he didn't put up his hand, so.
There's an important development that's taken place since we brought the ordinance forward, which was on short notice. And that is the county health officer has issued a new order. And the revised order, which is effective Friday, has a mandatory requirement for face covering. That's different than what the situation was with the April 29th order.
Right.
So, and this new order supersedes the prior order. With that, our urgency ordinance and ordinance references the April 29th order. It's really based on the assumption that while the county strongly encouraged the wearing of face coverings, it wasn't a mandatory requirement. Now, with the revised guidelines for opening businesses and allowing curbside retail, at least deliveries, that mandatory face coverings are now the requirement. What I would like to do is be able to go back, try to reconcile if there's anything missing that we would want in an ordinance, and come back on June 2nd, which is the next council meeting, because this may be moot in large part. And if it isn't, it's at least outdated, the draft before you, because of the new county order. The good news is that to the extent that people want mandatory face coverings, it's now a requirement. A lot of people are saying it's not mandated. As of Friday, it will be mandated in Santa Clara County. And that includes the city of San Jose. But the ordinance needs to be reviewed, and we would come back with, to the extent there are any gaps, to the extent there are areas where we would want to maybe add some additional provisions. So that's what I wanted to throw out there.
Thanks, Rick. And I do remember seeing that in the order that came out on Monday. I had assumed that there were gaps that this was filling. You're saying that we're not sure about that?
No, this was filling the gap on the April 29th order, not the most recent order. So the May 22nd order, which we call it, which is effective Friday, covers pretty much what we think is in the ordinance, but to the extent it doesn't, we are asking to come back on June 2nd with any revisions, and we would be prepared to have something then.
Okay. Vice Mayor Jones, would you like to make a motion to defer?
I'd like to speak to that first, Mayor, if that's okay.
Okay, sure.
So, Rick, we did a follow-up on the county's guidelines, and there are areas or gaps with what their mandates are and what we're proposing. So my preference would be not to defer it, but to talk about it and discuss it today, and then give direction in terms of how we want to move forward.
Let's proceed then, Vice Mayor. I mean, we've gotten this far. Let's go ahead and get something rolling, and then Rick can tell us if there's something wrong next week.
Yeah, the only concern I have is the draft ordinance is all referenced to April 29th county health officer order, and that's outdated.
So we could have a motion that would change that, right?
Well, it is, but it's sort of based on that order, and so there's a lot of rewriting. But you can tell us to come back with something that addresses the concerns you have in the May 22nd order. So we're here to take direction.
Okay, Vice Mayor?
Okay, well, first of all, how this all came about was one, well, first of all, we're not talking about, bleeding edge or cutting edge. We already have 5 counties in the Bay Area who already have implemented mandates for face covering. The CDC has recommended face coverings. Other organizations and government entities have recommended face coverings. We did some significant research, and I'm not a subject matter expert on this, but based on all the research that we've seen, based on Johns Hopkins studies, International Journal of Nursing Studies, other studies that I'm becoming very familiar with, terms like dose and time. High infectious dose may lead to a higher viral load, which can impact the severity of COVID-19 symptoms. I've become familiar with terms like ingress and egress. How if you're wearing a face mask and you're not necessarily out protecting yourself, but you're protecting others from the load, the viral load, and the distance that the virus travels, and the intensity of the virus infection. Those are key scientific terms that we've learned about that really made me want to propose and move this forward, because I go out to the store to go shopping and I see elderly folks who don't have masks that are in proximity with other folks who aren't wearing masks, and it's putting them at risk and at danger. And that's a real concern. It's been, the studies have shown that 25 to 50% of infected individuals are asymptomatic. So we have a lot of individuals who are out there who are in the early stages of the infection, who aren't showing any symptoms, who are, in close contact with others and are potentially infecting them. So this is not, what we're proposing is not radical. It's not infringing on people's constitutional rights, because there's an old saying that your rights and privileges end where my rights and privileges begin. And if we don't have these types of safety measures as we open up the economy, then we're going to have a spike in cases. We're going to have more deaths. The gentleman that spoke earlier that commented on the fact that the number of deaths and the number of illnesses and number of individuals in ICU is way down or non-existent. Well, that's just a testament to all the measures that we put in place already. He made a statement of the success of what we've been doing, and we have to continue that. We can't let up now. We need to have facial coverings. We need to have social distancing. We need to have testing. We need to have tracing. We need all of those tools in our toolkit. I know there's a concern about enforcement, and the intent is not to have Eddie and his officers out there arresting people or spending a lot of time and dedication to, harassing people or apprehending them. That's not the purpose. The purpose is what we want to do and what we've done with social distancing. We want to educate, inform. We want to provide people with access to face coverings. And when we think about face coverings, we're not necessarily talking about masks, or, traditional face masks or PPE. A face covering is a bandana, it's a scarf, it's a t-shirt. I've even seen reports where you can use paper towels as a face mask. So there's really nothing that's preventing someone from covering their face and being engaged in what Sam called the social norms and expectations, and eliminating the confusion and conflict. When I go to Cupertino, I want to have the same rules as when I go to Milpitas, when I go to San Jose, when I go to San Mateo County, when I go to Alameda County. I know what the norms are. I know what the rules are. And then the final point is,
Vice Mayor, if I could ask you to make this the final point.
Okay.
Because our rules and norms are now 5 minutes. Thank you.
The final point is, I don't have an expectation that every single person is going to follow the rules, but the expectation is the people who are honest and want to do the right thing are going to do the right thing. And that's the final point. Thank you, Mayor.
Thank you, Vice Mayor. And again, I'm sorry for cutting you off. We're just, again, racing against the clock here. Councilmember Camus.
Thank you, Mayor. And just to let you know that I'm serious about face masks. Here's my Star Trek one. I got a lot of other designer ones, but my first point, quite frankly, was that the county did pass a mandate already, and I didn't know how this memo differed from the counties, and that was my first question. And the other point that I wanted to make is I think, the way it's written, it says that as soon as you're outside your own home that you're required to wear it. And I think, that might be a little too stringent. If I'm going out to the mailbox to get my mail and I have to cross a sidewalk to do so, then I'm on public property and I'm breaking the law if I didn't wear a mask to get that. And I think that I totally I know that the county is said I think the county's ordinance is very specific about public places, parks and places where people gathered. I'm 100% in favor of that. I just don't know about it. It seems like it's actually bigger than the county ordinance, because on item number 2, it mandates wearing face coverings as soon as you step outside your home. And that's the only place I differ with this ordinance. I think the ordinance from the county actually is a little more succinct. If nobody's read it, I know it's new, but it does accomplish what this memo, I think that what the vice mayor was trying to accomplish, unless the Rick says otherwise. I think that the intent is there.
Yeah, Councilmember, just to clarify, paragraph 4 the county orders, as you said, mandates face coverings at all times when at a business facility or using public transportation. Otherwise, it's just strongly urged. So yes, there is a difference.
Right, and our mandate, Mayor, does require if you're out in the public generally.
Right. So
yeah.
you're correct.
Well, I'm okay with it if it's in parks and other things like that. But if I'm walking my dog just down the block, I don't want. Excuse me, I don't mean that. A police officer to come up and point their finger at me. I know my name. It's like very few. When I walk on my sidewalk, if I see somebody coming, I actually step away 6 feet and walk a different direction already. I personally wear a face mask, but I don't think it's, anyway, that's where I'm heading. I think I would be supportive of it if it was in parks and other places where people gather.
Council member, if I could, I assure you, a police officer won't be coming under that scenario. Eddie's here and can talk about what enforcement would look like. And it's going to be an extremely soft touch. There's not going to be police officers dedicated to that sort of thing. I think we were struggling with really how the enforcement would look. And so he's here and he can talk about that, but we're not going to be able to stop things like that.
I'm not thinking that he would, quite honestly. But the law, as it's written, says as soon as you step out your front door, and I would rather that sentence say as soon as you are in a public place of gathering, and that could be interpreted as parks, trails, whatever. But if I'm on my sidewalk, I don't feel like I should be in violation of the law. And believe it or not, I get emails all the time, neighbors telling on other neighbors, and that's not what I want to deal with. They're like, "Hey, I saw my neighbor walking his dog without a mask. Should I report him to the police?" Kind of thing.
Hey, Sam, can I respond?
Sure, Vice Mayor.
Johnny, I totally agree with you. The intent of this ordinance is not for you to feel like you have to wear a mask or feel mandated to wear a mask when you step outside to get your mail, or it definitely is there's no expectation for you to have to wear a mask when you're walking your dog or hiking or walking or riding your bike is when you come in contact with the public.
Right. Could you change the line number 2 to say just exactly what you said instead of walking out, because it specifically says as soon as you step out your front door in your memo.
I'm amenable to that change.
Okay, so if you could change it to, if you're in a place where you know, where there's public, a public place, then I would be in favor of it.
Okay, Rick, I think we're gonna have a challenge here because sidewalk is a pretty public place.
Yeah, it is. But I think the intent, so the county measure addresses any business facility. And this is one of the concerns I have. So that's the new order. We reference the old order, which only allowed essential facilities or essential businesses to, and those serving essential businesses to open. And as a result, we required it in our ordinance that you had to wear the mask in any essential business. So it's much more narrow than what the county order says now, which is, you know, any business facility, because they've opened it up more. So this is where the disconnect is between relying on the old order, getting a new order after the ordinance has already been released, and which is why we're saying, let's get direction as to where the council wants to go, and let's come back with a clean ordinance that makes sense.
Well, my intent is to not criminalize people who are walking their dog to alleviate him or herself, and getting your newspaper, you know. But if you're in a public space, yes, you know, where gatherings are permitted, like parks. So
Or
that's
or a public space, Johnny, like a corner where there's 5 people in the corner and you walk up.
well, I walk around. Yeah.
We have exceptions in the ordinance for outdoor recreation, such as walking, hiking, bicycling, running. Those are exceptions from the mask requirement. So
Okay.
that's fairly standard throughout the various counties.
I wear mine while I'm walking. I'm just saying that so it's already exempt, is what you're saying.
Yeah, I mean, if you're walking your dog for exercise, you know, it's exempt.
Okay, thank you.
What if it's the dog's exercise and not, well, anyway. Councilmember Foley.
Oh my gosh. Face masks. You know, it's my personal preference to wear a face mask when I'm out in public, and it's been a requirement, and it will be as of Friday for all businesses to require any customers coming in their doors to wear a mask and any employees in the business to wear a mask. You have to post that at your door, both for the employees, and you also have to post it for your customers that a mask is going to be required when you enter the place of business. That's for my little mortgage company, and that's for anybody in business right now. And with the expansion of businesses that are being able to open on Friday, that'll just be more businesses that are required to use to have face masks, and customers to have face masks. But I'm grappling with this from a point of view of enforceability. I understand the importance or the desire to feel personally comfortable in having a mask and protecting yourselves, or actually protecting others from droplets and that. I understand that, but I'm having difficulty with agreeing to put another policy on the books that is unenforceable. So I'd like to hear from the police chief as to what his thoughts are on this proposal. I've already heard that everyone's saying he's not going to enforce it, but how can he not enforce it if a neighbor calls and complains? And so does he have to send a police officer over there? I don't know. I'd love to hear from the chief.
Thank you, council members. Everybody hear me?
Yeah.
I finally got the mute button. taken care of. So, thank you for that point. One of the things, and I'll try to keep my comments brief, but one of the things that I've always talked about often is that the only thing worse than not having regulations or having regulations that you can't enforce. And obviously we can say what we will, but I can tell you from day one that these orders came out, we can say that they're not going to be enforced, that we're going to treat it with kid gloves, but we're going to get inundated with calls from the community. It's happened. So I'm not guessing that it's going to happen. I've spoken to other fellow law enforcement officials. San Mateo County is an example. They say that they're enforcing, however, their DA wants 4 warnings before they issue a citation. I can tell you in a city of 1.1 million people, 4 warnings is not enforcement. I do fear that enforcement would impact our most vulnerable, the homeless, the less affluent communities, and others that English is not their first language, that may not understand the regulations. From a law enforcement perspective and how we enforce it simply is not our role. Oftentimes, what's lost in these decisions as they're made is what the cost of doing enforcement of these orders. It's akin to the expectation that some have had with us breaking up crowds due to the social distancing order. We've said that we weren't going to do it, but I guarantee you people assume that we would. And the cost that we're willing to accept if enforcement is to take place and someone's uncooperative. If an officer has to give chase, use force, give a citation in the end, when COVID-19 is gone, we're going to be left to deal with the credibility of this police department on how we enforce these laws and regulations. And I know I've made comments in the past with regards to criminals being released on zero bail and for us to be enforcing these type of ordinances on law-abiding residents. But I'll give you a better example that resonates with me the most. When it comes to credibility of law enforcement is that, thousands die due to drug addiction a year, thousands. We all know the impacts that drug influence has in our neighborhoods, yet we, in essence, in the state have decriminalized drug use and possession. Why? Because even with its nexus to crime, under the guise that it's a public health issue and not a public safety issue. And so now to have calls for service and have officers respond for individuals not wearing masks is, again, treating a public health issue and making a public safety issue. And those are serious concerns that I think every police chief has. And I'll leave it at that.
Thank you, Chief. I appreciate that. And I see that my time is up, but with the ending, I will say that the Chief's argument is very compelling and I'm going to have a hard time voting in favor of this. Thank you.
Thank you. Councilmember Jimenez. Councilman Jimenez, I think we're having a problem again with your mic. No, still problematic. Do you want us to come back to you or? Okay. Councilmember Perales, why don't you give it a shot and we'll come back to Councilmember. Oh, wait a minute. We got you now. You there?
I can hear you, but I didn't know if you went on to the next person.
No, we can hear you now. Great.
I apologize. The damn AirPods. So I just have a question, mainly for Rick. I appreciate everything that's been said and agree with everything that Vice Mayor Jones said. The question, Rick, is my understanding is that this this ordinance would expire with the end of the proclamation of local emergency, right?
Yes.
Okay. So to the extent we extend it, it gets extended, right?
Yeah, I think the issue, yeah, exactly. The county,
Okay, all right.
the county order has no end date at this point.
Yeah. So I guess one of the things that came to mind for me, because Councilmember or Vice Mayor Jones and I were talking a little bit, I guess what I'm curious about is does the attorney's office, have you guys thought of a way to maybe trail the, can we fashion this in such a way as it trails the county order and it sort of modify, make that sort of the attachment?
Well,
so
that's what I was trying to clarify. I mean, in terms of the county order, what I was suggesting is we look at the county order, and to the extent that we want to go further, we could come back with recommendations going further. But otherwise, the county order is pretty broad. I also wanted, there was some confusion though. I mean, I think Councilmember Canvas, you were working from the memo from council members Jimenez and Jones, which talked about if you step outside your house, you have to wear a mask. The ordinance doesn't go that far. The ordinance sort of tracks, and this is essential if you're in an essential business, if you're doing essential infrastructure work, if you're doing any healthcare operations or public transit. So it's much more narrow. It's not just you went outside your house to get the mail or whatever. That's the language that was in the memo. We didn't put that in the ordinance. We had it crafted more narrowly to cover what we thought was the intent, which is going into businesses. The county order, again, is broader because the order doesn't just cover essential businesses now, it covers any business. And we would need to change definitions in this ordinance because of the new order that's just been released.
Yeah, so can you envision a situation in which we give direction today, you go back, create an ordinance that's in line with what the county has said, what we have said, and then let's just say a few weeks later, the county changes the order?
That's up to the council. I mean, we can certainly do that. It's duplicative. I mean, it doesn't mean you can't do it, but the county order is in effect countywide, including the city of San Jose. And whether the police department enforces it or not, they're authorized to enforce it.
Right.
And that's, but we can certainly come back with revisions and on the second,
Okay.
if that's the direction.
All right, thank you. And I just thought it was important because to relay, because I think Councilmember Camus was talking a little bit about, walking the dog and doing things of that nature, that there are exceptions built into this, right? Exercising outdoors, and I'm paraphrasing here, children 6 years old and younger, anyone who has trouble breathing, anyone who has been advised by a medical professional not to wear a mask, and any worker to the extent wearing a face mask covering creates a safety hazard. And so there are exceptions as I see it. And so someone put it very succinctly, I think, in a few emails that I think we all might have gotten, but that really, and I think it encapsulates my feeling, and that is that I prefer to err on the side of saving someone's life to the extent the covering is going to do that in some of these circumstances. And I think that the numbers that were cited by a gentleman earlier, I very much appreciated the comments by Vice Mayor Jones in stating and really lifting up the fact that really does suggest that what we've been doing has been working. And so I very much appreciate that. I'm supportive of this. I realize that, and I think a wise man said, and it might have been Vice Mayor Jones, that we pass a policy, and to a certain extent, I'd like to think that the majority of folks are going to follow it. I don't expect our police department, they have a lot of things to do. I hope and don't expect it's going to diminish their credibility, but I do, and I also don't expect that they're going to go out and enforce this, but I'd like to think that the majority of residents are really thinking about not me, but we, and really taking a very community broad approach and thinking about the health of our community. And so I'm supportive of this going forward, and look forward to see how it saves some lives. Thank you.
Thank you. Councilmember Perales.
Thank you. Can you hear me?
Yes.
Great. Also using an AirPod. So, I have some concerns with this. And the first one was namely sort of the confusion between what the county orders are and then what our local orders are. And that one already has come to light now with the county's order. And so I appreciate that Rick is saying, hey, we're going to need some time regardless to be able to try to pair these up. And I think we should be conscious of that. If something does pass, that we need to make sure it's in a way that it always stays sort of paired up with what the county is doing, because I think it just gets a little bit more complicated. And I think as much as I respect I think the thought here with certainly the mask coverings, we've seen this done, as Councilmember or Vice Mayor Jones stated. This is not anything new. We're seeing this done all over the country. But at the same time, I think being in maybe conflict with our own county health official that is attempting to make these decisions, sort of wanting to allow them to make some of those decisions, and not necessarily get in the way of that, or cause some conflict with it, as we're seeing now. The other, and I think more concerning, was really having to do with equity, and what we've seen in some places. I know recently in New York, where you're seeing individuals be arrested, and in some cases potentially rather violently, for not wearing mask coverings. And I appreciate the chief stepping in and saying, hey, that's absolutely not their intent. But I think, to his point, regardless of whether the police is going to be actively enforcing this, that it will be their authority to do so. And I can absolutely guarantee people will be calling about it and expecting some level of enforcement, whether there is or not. And I think certainly there's already going to be a challenges that the chief has laid out of what our police officers are focusing their time and attention on. I think the other aspect, and I brought this up at the VTA board, was as we required them on public transit, and Robert Aguirre mentioned this, a lot of our individuals that either are homeless or low income, especially those using public transit, may not have the means to be able to acquire face covering as easily as all of us, or wash them as frequently as we may. And I appreciate the leniency on what we may consider a face covering. Just somebody being able to place some sort of material or cloth over their face. But even that, too, in itself, I think could be a challenge as you go out to some of our lower income communities, not having the means to have adequate access. And so I think that's just a concern. I think we don't necessarily have to worry about proactive enforcement on that, as we've seen in some of these other cities, as I provided the example of New York, but still a concern on being able to have this move forward. So I still am a little torn. I appreciate that the county is trying to make some of these decisions with the public health in mind. I feel that that's where they've gone with this latest order, considering we will have some loosening of the shelter in place and some businesses reopening. I think it is a good idea to begin to add in some of these requirements and do so strategically. So I think I'll want to support this moving forward with Rick kind of looking into it a little more, but wouldn't necessarily support outright just accepting this today.
Yes, thank you. So let me begin by saying that wearing masks is a best practice. Can you still hear me, or does this not work? Can you still hear me?
Well, we can hear you, but no, it doesn't work.
All right. So wearing a mask is a best practice. I've been going around and giving out masks to my residents who've asked for them. And I agree with the intent of the Vice Mayor and Councilmember Jimenez. But I must admit, I'm quite relieved to know that the county has taken it upon itself to issue this instruction from the county. And I feel that kind of saves us the trouble, because we've said from the very beginning that the county is the public health agency, and we follow the county's lead on that. And I see no reason personally beyond the order to wear a mask out in public for the city to play the role of gap filler and hold a higher standard of mask wearing when and where in the city of San Jose beyond anything that the county has issued. To the extent that San Jose is lagging behind Cupertino or Milpitas or other cities that don't have an order to wear a mask, now the county will be entirely covered. And I think that resolves the one concern that I had in favor of this. Now, of course, we should wear masks, but I think the mechanism for doing that is public education and being seen outside as public officials wearing masks, on social media wearing masks. This morning when Mayor Liccardo and Supervisor Chavez and others were at the announcement for the opening of BART on June 13th, I want to say, they were all wearing masks. And those images have an effect on people consuming media, and they want to emulate that. But my concern about chiseling, into law, certain requirements, acknowledging that we have exceptions, is that people just know that you have to wear a mask, and they don't know about the exceptions that, like, when you're running, exercising, riding a bike, maybe you shouldn't be because it could potentially slow down your breathing. Children below a certain age, although we have it in the ordinance, should not necessarily be wearing masks because it might cause a problem for their development. And there are all these exceptions, but on the whole, what you create is the stigma of, if you're not wearing the mask, you're somehow doing something wrong. When I was younger, like I couldn't afford cleats, I couldn't get on the soccer team or whatever. There are these things that masks are relatively cheap, but still there is this kind of, call it equity or call it whatever you want, but there's still this kind of outsider status for the people who don't have the thing that you're supposed to have. And I think about other countries, Asia predominantly, this is a social norm. And it's a social norm not because that there is a law that mandates it. It's a social norm because the people there believe in science and they recognize that this is a best practice about what you need to do. And they voluntarily do it because there is still this sense of social cohesion that you don't do it because your individual liberty and rights are at stake, but you do it because we all are our brother's keepers. And we have a responsibility to our brothers and sisters in our community to keep each other safe. And the debates that we're having in America are not quite that. They're more very grounded on the individual and what our individual rights and Constitution, this and that, protect us from. And I think until we're able to somehow, bridge that divide and kind of readhere that social glue that we have, having a law, it's good to know that there's a law, but that won't in and of itself make people want to wear the mask. And that's really the kernel that I'm trying to drive at. So for my personal belief, now that the county has it covered, I'm fine doing that. I'll be fine if we want to do a duplicate ordinance to just mirror what the county has. But personally, I'm not interested in gap filling. And I'll leave it at that. Thanks.
Okay, Councilmember Esparza.
Thank you. So again, I thought that the county order would cover it. So was a little confused and am amenable to looking at some gaps. What really caught my attention was the chief's comments about this essentially not being enforceable. And so I wanted to ask the chief some questions around some situations that other cities are finding themselves in. Chief, are you still on the line? Thanks. So are some of the other cities finding themselves in situations like, for example, if a restaurant had a bunch of people come in and none of them were wearing masks and they didn't want to leave, they would be forced to call 911, correct?
If they have an ordinance, yeah. I mean, that's what, if people didn't want to leave because they weren't wearing masks, they would call the police more than likely, yes.
So that's the type of situation that we would be forced to respond to probably anyway, right? I mean, even by the county order. I'm a little confused on where we would sort of choose to enforce and then not enforce. Can you talk a little bit more about that?
Yeah, well, in situations like that, if people aren't getting served, as an example, because they're not wearing masks, that's a decision that the restaurant or the property owner makes. That would turn into just a disturbance. This is the way we would handle it. We would handle it like any other restaurant manager would say if he wanted individuals not there. And we would handle it that way, but we certainly wouldn't handle it from citing them for not wearing masks.
And so how are some of the other cities kind of dealing with this in terms of enforcement?
Well, I've spoken, not to give up too many, I've spoken to some chiefs in the last couple of days, and they're not. The reality of it is it's on the books, but they're really not enforcing it. I know up in San Mateo County, there's a couple of cities that haven't issued a single citation. As I mentioned, in San Mateo County, their district attorney, what I've been told, requires 4 different warnings on one individual before even a citation is given. I mean, obviously, that's something that's not really enforcement. And so I haven't heard from any chief that I've spoken to that they've been enforcing this rule. Maybe there's others that have been, but the ones I've spoken to have not. I did speak to a particular chief that said one thing that they've done is if individuals have been arrested for another type of crime, that this may be something that they would add on. Although, again, in my opinion, I'm not considering, the way our criminal justice system is enforcing laws. I don't know exactly if that's productive as it is, but there's not a lot of enforcement going on, council member, from the chiefs that I've spoken to.
Okay, that's helpful. Thank you.
I just want, if I could, clarify this issue with the county, because I've had conversations with the county executive and President Chavez about this, and, as other cities were considering it, Jeff Smith made it clear, Dr. Smith, that he's perfectly fine with cities moving ahead and doing it. And obviously, that's the case now in 5 counties throughout the Bay Area, at least. So I think, as the point was made by Councilmember Diep, if anything, this just ensures there is a uniform rule that we see throughout much of the county and virtually the entire Bay Area. I do want to address the concerns raised by the chief. I appreciate those concerns. I don't agree with them. I spent enough time as a prosecutor being surprised by cases that were brought in under penal code sections that I don't think were ever enforced, except once in the 8 years I was a prosecutor. And if you go through Title 12 of our Muni Code, you're going to see a lot of violations in there, in which 99.9% of the perpetrators don't get a ticket or citation. Fireworks, public loitering, sitting, lying on sidewalks. We could go on and on and on. It does not change the fact that we keep these on the books, in part because it enables social enforcement, the setting of norms that enables someone, for example, an elderly couple, to be able to say to someone who's being inconsiderate around them, hey, there's a law against that. And that is relevant, it seems to me, as we are trying to get people to wear masks. This is not a case, I think the comparison to drugs is not well founded. The decriminalization of marijuana was fundamentally because we recognized if marijuana was harmful to anyone, it was primarily harmful to the user. In this case, COVID is harmful to others. And the reason why we encourage others to wear a mask, and hopefully encourage them so much that everyone will wear one, is because we've lost 90,000 Americans to this. More people died in 7 weeks in the United States from COVID than died in 7 decades of wars in this country. So this matters. It's a pandemic. And so it's not simply like any other health issue we might enforce or not, or some other provision of the Muni Code. This matters to life and death, and also critically matters to our efforts to get people back to work. Because if we know more people are wearing masks, it doesn't mean everyone has to wear one, but if more people are wearing masks, it will reduce the infection rate to a level that enables us to expand and accelerate the reopening of the economy. And right now, we've got thousands of families that depend on our ability to continue to reduce and drive down infection rates. So both for the pocketbooks of a lot of struggling San Joseans and for the lives of San Joseans, I think we ought to put measures like this on the books. And whether the chief chooses to enforce or not, I am not going to weigh in. That is his choice. But nonetheless, it's important for us to set the norm. All right, returning to any other council members like to speak? Okay, Vice Mayor, I believe the motion is yours.
Yeah, so I'd like to make a motion to direct the city attorney to return on June 2nd with a revised ordinance, taking in the input from Councilmember Jimenez, as well as the additional observations and input that you presented to us, Rick.
Okay. Second.
There's a second? There's a second. Okay. All right, on the motion, let's vote, Tony.
Jimenez,
Yes.
Peralez,
Aye.
Diep,
Aye.
Crosco,
Yes.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Yes.
Jones,
Aye.
Ricardo.
Aye.
Thank you.
All right, thank you. We'll move on then to item 4.1, actions related to Berryessa North San Jose BART Station, law enforcement. Chief? Is this going to Captain
Thank you,
Kim?
Mayor. I'm going to have Mike Kim open up for us and walk us through, and then we'll be here to answer any questions for you guys.
Great.
Mike, you there?
Yep, I'm here. And can you guys see the PowerPoint? I have it on shared screen.
You haven't shared it yet on mine, at least.
Okay. I may have to have Tony put it on her screen. Let me.
Okay.
Can you see it, Tony? On mine? It's not on your screen.
No, just give me a second and I'll pull up the PDF.
Okay.
Is this the same one that's in Granicus? Because if so, it's in Granicus. If that helps.
I guess so. I don't know. I put shared screen. Let me just try it one more time here. There it is.
I got it. There you go.
There you go. So I'll just let you know when to switch the page. All right. Good evening, Mayor and Council. My name is Mike Kim. With me is obviously Chief Eddie Garcia, and also on the line is our Assistant Administrative Officer Heidi York, who pretty much runs our fiscal department. So quick recap, in 1972, BART started services in the Bay Area. In 2012, they broke ground here on the Berryessa area, and in 2020, they are going to open the doors. The jurisdiction we're talking about, you can switch the page, Tony. So just to be clear, the jurisdiction that the San Jose PD is going to be taking over is everything outside of the BART station, of the operating corridor. That's the bus area, the parking lots, the surface lots. There's a multi-level structure and all easement right-of-way areas. BART PD will handle everything inside the building, pretty much inside the turnstiles, if you could visualize that, everything on the train, on the platform, and on the tracks. Next slide. Timeline. So just over a year ago, VTA issued a request for proposal to all law enforcement agencies in the area, and we were allowed to bid on that BART station to do police services for VTA. This is a first for our agency that I know of there, where we've actually proposed and bidded to be a supplemental police service for another agency. I worked collaboratively with the city manager's budget office, our PD fiscal, and the city attorney's office. And on April 17th, we submitted the RFP response to VTA. Fast forward, it went back and forth with the sheriff's office and us as the final two agencies to win the bid. And on May 7th, we were awarded the contract via VTA. Effective July 1st is when the contract begins, although they may start passenger service on June 13th. Fast forward, next page. Qualifications. The reason San Jose PD put in the bid is number one, it's consistent safety priorities, both the station and the outside surrounding areas. What that means is, for example, if a crime occurs in the parking lot and it carries through into the neighborhood, it's best to have one police department police and investigate that situation. You don't want it to go from BART PD to another agency and then end up being San Jose PD. It avoids the duplication of police services and responses, and also puts everything in accountability for our own city. Lastly, we are the largest police department in Santa Clara County, as we all know that. Response times are immensely minimized, being that it is in what we call District Robert, where we have a full supplement of officers. We have a special operations unit that's out every day. In addition, we have over 60 community service officers in our department. And so they handle all low priority calls, which gives us the best bet to qualify for this station. Next page. The VTA contract is going to cover on an annual basis 6 police officers and a full-time sergeant, equating to about $2.1 million a year, and supplies and equipment. The contract is guaranteed for 2 years with extensions thereafter up to 4 years, which we are hoping to keep. Next page. Finally, we're requesting the city manager and city council to authorize us in executing this agreement, 2 years as stated, with 4 one-year extensions as stated. And that is it. I am open to questions, as well as the chief.
Thank you, Mike. And big thanks to you and the chief. This has been a long battle for us, I know, to get this contract. And I think it's really important. I just had one question, which is, our contract begins on the 1st and service begins on the 13th. What happens for 2 weeks?
So we worked it out already, and I'll let Heidi chime in, but we worked it out with BTA, also working with the city manager's budget office. We will bill. So when revenue service starts, we will bill BTA for our services there, and they will be reimbursed.
Okay, that's great. And I know that Councilmember Dieppe is very appreciative because there's a lot of neighborhoods in his district that are going to really depend on SJPD being there. So thank you. And Councilmember Dieppe, thanks for pushing.
Thank you, Mayor, and I want to thank the chief and all the police officers involved with this, and of course your vision and leadership in getting this through VTA. I know it's not typical for a city police department to take over patrolling a VTA site. Traditionally, it goes to the sheriff's office, but like was mentioned in the presentation by Michael Kim, it just made a lot more sense to have BART police inside and then SJPD patrolling the outside. So a victim of a crime wouldn't have to potentially deal with 3 different agencies. And I know that the riders will be appreciative of that, and certainly the residents in Berryessa around the station are appreciative of that. So good news all around. I'm excited that BART will begin service finally on June 13th, and I hope that all the end of line fears don't come to pass. And I know that with SJPD on the case, we will be well patrolled and well served regarding that. And so my morale is boosted because of this. So thank you, Chief. And with that, I'll move to accept the report.
Second. All right, motion. Councilmember Esparza?
Thank you, Mayor. So I was happy to vote along with everyone else to apply for this grant or this RFP, but I had some questions on how this is going to work operationally. So how will this affect our ability to provide service in neighborhoods, particularly given our patrol, the size of our patrol?
So
there we go.
I'm sorry, let me chime in here before Mike gets on how this is going to look operationally. I just want to say, and I know Councilmember Dieppe alluded to the end of station issue. You know, from a police department perspective, and I know things and decisions that we made pre-COVID to post-COVID, and I completely understand that. But as you know, in talking to other chiefs and other places that have had end-of-line BART stations, the reality of it is we either pay now or we're going to pay later. There's going to be increased calls for service. We know that. And so from that perspective, we just needed to tighten up our belts to ensure that we're going to be able to respond to those. Because had we not added these positions, it would be an added burden to the patrol team that's currently out there to have to deal with the issues and the calls for service that are out there. So I just wanted to get into that conversation where it's just the right thing to do. We should be responsible for this, not only for the impacts on the surrounding neighborhoods that it has so that we're better able to address them, but the fact of the matter that it is going to be busy. You know, if it's not, and I, trust me, I hope it isn't, but if it's not a busy end of line station, it will probably be BART's first non-busy end of line station from the talks with chiefs that I've had. Mike, if you want to get into just how it's going to look operationally for us and some of the funding that we're having for it.
Well, actually, I wanted to go back to the officer issue. So my question was, what does this mean operationally in terms of the number of officers in patrol? So I'll give you an example. So as you know, I have District Lincoln, right? So how are we ensured that District Lincoln or District Charlie or any of the other districts are adequately patrolled, that this is really just another piece of the puzzle as opposed to we're pulling officers off of other districts.
Well, I'll say this first of all. From again, going back philosophically, it's more productive for us to have this one way or the other. The other districts aren't going to be impacted and shouldn't be impacted. District Lincoln, District Mary, Charles, Edward, the rest of the districts, officers aren't going to be necessarily getting pulled from that. I'll draw you this right now. Our street ready sworn, as I made mention last week during the budget hearing, is in the low thousands, about 1006. In about October, it'll rise to about 1068. So we will actually have more street ready officers in 3-4 months because we're going to get officers out of the FTO program than we currently have today. Now, the negative part of it, because of the lack of hire ahead, once we get to 1068, that's probably where we're going to stay until we're out of this. But what I'll say is it shouldn't be impacting our other districts as we we get these positions. So, I mean, from that perspective, that's, I guess, how I would leave it at that.
Okay, thank you.
Yeah.
The only,
I'm sorry, Mike.
He's answering the rest of the question, I
Go
believe.
ahead, Mike. Yeah, sorry.
No, I'll be very quick. So the only other thing I can add to Chief is that we're also collaborating. So the impact to the northern part of San Jose will be little to none. We're adding and working with homeless response teams, where I have meetings coming up with BART PD as well. They're going to have agencies involved. They have like a CSO program as well. So we're hoping to minimize the impact, especially to that immediate community. We know homelessness is going to be the main concerns. And so I actually have a meeting this Thursday with our homeless response team, as well as BART's team that works with the county.
Thank you, Mike. That's it. That's all I have.
Thanks. I just want to also add, because Councilmember Esparza raises a really important question: is this going to dilute police service in any way? And as my perspective was, particularly representing the downtown, when at the time I don't think we had the same level of sheriff enforcement and support and VTA line. Basically the San Jose PD was responding anyway, even though the sheriff was covering the line at the time. And I think, I'm guessing that the reality is a lot of calls are going to be coming from the neighborhood about whatever's happened at the BART station. San Jose PD is going to be the one that call. We're going to end up responding either way. In this case, at least we have money to support that deployment. And that's really important for us to maintain our numbers and make sure that we're responding with resources that are appropriate. So I appreciate the concern that Councilmember Esparza has, but I really think this is going to be a positive for us and net for the whole city. Blair Beekman.
Hello, can you hear? Hello,
Yes,
hello?
sir.
Can you, yeah, hi, thank you. For this item, I think this item's been brought to the VTA recently. I'm better understanding it now. I know that within the parking garages of the San Jose BART parking lots, they're going to have APLRs that are going to be controlled by the VTA. And what I love to do is talk about, they've created data collection practices from 180 days down to 90 that can still be down to 45 in a couple years. So I just wanted to remind yourselves that, I still hope, we can work towards our better practices and our better thinking. And that's how we build our future is good democratic practices can define our civil rights and civil protection ideas that we can work on together. And I think that's how we create our good future for technology and data collection and everything. And thank you.
Thank you, sir. All right, back to the council on Councilmember Diep's motion. Tony?
Jimenez,
Yes.
Peralez,
Yes.
Dieppe,
Aye.
Crosco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley. Foley, Camus,
Yes.
Jones,
Aye.
Ricardo.
Aye.
Going back to Foley. Okay, absent.
Okay, that passes unanimously. Thank you. Item 6.1 is the commercial solid waste customer service rates. There's no presentation.
Move to approve.
Second.
Motion and second. I have one member of the public who'd like to speak. Oh, Carrie, you're in the public now. Hello, Carrie.
Hello.
Carrie, would you like to say something?
No, we're available for questions.
Oh, okay. You had your blue hand up in the public, so okay, good enough. Well, I just wanted to say thanks, everyone, I know it's been hard to keep the rates down, and we still have very low rates compared to other cities in the comparison. In the 3 cubic yard, we're the very lowest, so I appreciate everyone being mindful of that in these tough times when residents have a hard time paying the bill. Deb, I'm sorry, Councilmember Davis?
Thank you, Mayor. Carrie, just because we are trying to do everything we can to make sure our businesses are able to get back to work and get back to profitability. I just have to ask before we vote, have we done everything we absolutely possibly could to keep this to a minimum increase?
Thank you, Councilmember. We have contractual calculations in the agreements that we established about a decade ago that have the formulas and the buildup that land us at this 4.9% rate increase today. We did ask Republic if there was room for any adjustments in that, but as you might imagine, their business has been impacted by COVID-19 as well. Unlike residents, businesses can actually suspend their contract for a period of time as they're closed.
Okay.
And we are very appreciative of the fact that Republic has been out there doing and collecting solid waste for us without any interruption during this time, and that has been a large effort on their part as well.
Okay, I wasn't aware that they could suspend their contracts while they were closed, so I appreciate that. Thank you.
All right, then, on the motion, Tony?
Jimenez,
Yes.
Peralez,
Aye.
Dieppe,
Aye.
Carrasco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Aye.
Jones,
Aye.
Ricardo.
Aye. Thank you. On to item 7.2, which are actions related to the digital literacy program quality standards. I know there is a presentation, but Jill, Samantha, whoever might be presenting, I was hoping you might abbreviate it because I know we've got a lot of stuff still to talk about.
You took the words right out of my mouth, Mayor. Good evening, Mayor and council members. I'm Samantha Kramer, and I'm the Education and Programming Services Manager for the library. We will be foregoing the presentation today and simply giving a summary of the digital literacy quality standards. And I will be joined also by Charlene Tatis from the Digital Inclusion Partnership, and she will provide a brief update on the Digital Inclusion Fund. So as you know, as part of the Education and Digital Literacy Strategy, Council directed staff in partnership with appropriate networks and agencies to establish evidence-based quality standards for all programs that are city funded, sponsored, or endorsed, and align those program standards with existing standards and assessments wherever possible. The standards that we have brought forth today will ensure that all residents receive high quality programs. Sorry, had a little technical issue there. Will ensure that all residents receive high quality programs and services offered by the city and its partners, creating a continuum of education. The digital literacy quality standards will offer both program staff and participants the tools necessary to increase digital inclusion and literacy across San Jose. Similar to our experience with the early education quality standards, a lack of existing comprehensive standards in the area of digital literacy necessitated city staff and partners to create the standards that are presented today. To that end, in fall 2019, the library created and chaired a digital literacy quality standards ad hoc committee comprised of subject matter experts and key partners to craft a set of standards that would ensure quality educational experiences in all city-sponsored programs. A list of the committee members is found in attachment A of the memo. Includes representatives from a wide variety of organizations and city departments, as well as 2 Library and Education Commission members. The digital literacy quality standards and framework themselves are in attachment B to the memo, and they are designed to serve as an overall programmatic guide and continuous quality improvement tool by defining standards and identifying strategies to improve the quality of all digital literacy programs. This document is intended for programs that promote digital skills for students and community members, which are city-sponsored, meaning programs that are operated by, funded by, or offered in partnership with city staff or using city assets. An overview describing the general expectations associated with each standard area across the quality continuum is provided on pages 1 and 2 of attachment B. And the detailed quality standards document is provided in full on pages 3 through 13 of attachment B. The 8 standard areas are also reflected there and show the focus areas that are associated with each standard. Year 1 implementation of the standards, if they are approved and adopted, will involve an assessment of current and future city digital literacy programming by utilizing the digital literacy quality standards to ensure alignment and adherence by both the library and PRNS. In addition, both the library and PRNS will begin a full implementation of the quality standards through their respective Digital Inclusion Fund grant programs. We will now have a brief update on the Digital Inclusion Fund from Charlene, and then she and I will both be available for questions.
Great. Thank you, Samantha. Thank you, Mayor, council members, the community. I'll just quickly go through my slides here. In February 2019, the city selected the California Emerging Technology Fund as the city's implementation partner. And in February 25th, of this year, council unanimously approved the $1 million in grant funding for 23 community-based organizations to achieve 4,000 adoptions in the first year of grant funding. Essentially to connect 4,000 unconnected households to affordable broadband, computing device, and digital literacy skills. There are also on March 17th and so grantees are launching their work plans to achieve the 4,000 adoptions I mentioned just a minute ago. And they're achieving those adoptions through training and support provided by the California Emerging Technology Fund, CETF. On March 17th and 24th, CETF provided virtual affordable internet offer workshops for grantees to support households with connecting to broadband offers. On April 30th, a virtual community of practice was also provided to support grantees with developing their internal infrastructure and procedures to achieve the adoptions. And I will hand it back over to Samantha now.
Thank you, Charlene.
Thank you.
Our recommendation to council today is to accept the staff report on the development of the digital literacy quality standards for city-sponsored programs, as well as the Digital Inclusion Fund update. We further recommend that council adopt the proposed digital literacy quality standards citywide and direct staff to report on their implementation in spring 2021. Thank you so much for your time and attention tonight, and we'll happily take any questions now.
Thank you. Okay, from the public, I have somebody on the phone, Mike Mattingly. Welcome, Mike.
Yes. How's it going? So
Good.
yeah, the digital inclusion. No, I'm gonna actually. The vice mayor challenged my data analysis, and I'm gonna say that my rights don't end where his fear begins. He said that the numbers are so low because of success that have been put in.
I'm sorry,
that
Mike.
May
I
be,
think you're talking
that may
about.
be. I guess we'll
You're talking
never
about a
know.
different
But
item,
if we
Mike.
were hey, no, he challenged me. I'm challenging him back right now.
Mike, I'm sorry. We're talking about the digital.
No, I'm challenging him right back.
All right. Mike, you're free to talk about this item, but we gotta get moving here. All right. Councilmember Rennes.
Gosh, I wasn't sure I was going to be first. I just want to move the memo and thank the staff for their hard work and for adjusting to COVID as they're delivering the different in connecting our communities when our communities aren't connected. So they really have to think outside of the box. To ensure they figure out who still needs that internet connection. So thank you for all your work, and motion to approve.
And a second from Councilmember Esparza, I believe. Councilmember Esparza, you also like to speak?
Yes, thank you. I just also wanted to ask that just given the importance of digital learning at this point and with what's happening, I wanted to see if it'd be possible to have just an info memo on where we're at the beginning of the school year. Nothing super
Poverty in the
extensive,
Bay
but
Area. Study included San
hello?
Jose.
I'm sorry, could I ask everyone to mute, please? Okay, sorry about that, Councilmember Esparza.
That's okay. Just an info memo at the beginning of the school year as we head into the year one implementation, that we can get an update in particular on where the grants and how that is coming together, because we'll still be recovering from COVID, and this work will be launching in that kind of environment. So I just wanted to echo my colleagues' thanks, but also to ask that we just get a brief info memo giving us a status update as we head into the year one implementation.
Okay. Would that be included in the motion, or? Councilmember Rennes, you want to include that in the motion?
Sure. And the report, Councilmember Esparza, is about. Is it about how the quality standards have been adapted during COVID pertaining to education?
Just actually an update of the year one implementation, because by that point, the digital inclusion fund grants that were issued, there will have been some work that will have already been taken place. And I think it would be helpful for all of us to get that information as the school year starts.
Oh, absolutely. Yes, I accept that amendment. Absolutely.
Okay.
Thank you.
Accepted. I just want to thank, in addition to Charlene and Samantha, who we've heard from, I know have been working very hard on this, the entire library team, led by Jill Bourne and Lauren Hancock, for all their great work. Dr. Marianne Duan, again, she seems to have her hand in a lot of this. Laura Busso and all the members of the ad hoc committee, and Candice Lay and our team. I really appreciate everyone pushing together. Are there any other members of the council who'd like to speak? All right, let's vote on the motion from Councilmember Rennes.
Jimenez,
Yes.
Peralez,
Aye.
Dieppe,
Aye.
Carrasco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Polley,
Aye.
Camus,
Yes.
Jones,
Aye.
and Licardo.
Aye.
Thank you.
Thanks. We're on to 8.2, which are actions related to the refinancing conditions for El Paseo Apartments. There's no presentation.
Move to approve.
Second.
All right, there's a motion. There's nobody from the public would like to speak. Let's vote.
Jimenez,
Aye.
Peralez,
Aye.
Dieppe,
Aye.
Carrasco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus, Jones,
Aye.
Licardo,
Aye.
going back to Camus.
Yes.
Absent.
Yes, no,
Yes.
I'm here. I'm here.
Got it. Nick of time. Thank you.
All right, thank you. Item 8.3 are amendments to the eviction moratorium ordinance and extension of the moratorium. There is a presentation here.
Yes, there is a presentation and Rachel is going to share it, the screen, since I failed miserably last time.
All right.
You also seem to be in a very dark place, Jackie.
Because it's bedtime.
Oh, well,
Just reminding you all how late it is.
I recommend a nightlight or something.
Yes. All right. So, good evening, Mayor and Council members. My name is Jackie Morales-Frand, and I'm the Director of the Housing Department. I also have Rachel Vanderveen, who's the Deputy Director of the Housing Department, and Deputy City Attorney Chris Alexander, who are both here with me. We will be presenting to you amendments to the COVID-19 eviction moratorium ordinance. These amendments implement the City Council direction received on April 14th of this year. Approval of these amendments to the eviction moratorium will increase housing stability for San Jose residents who are continuing to struggle with the financial ramifications of the COVID-19 pandemic. As I was waiting for this council meeting to start, I was reviewing a study that was just published this week by Tipping Point, which looked at poverty in the Bay Area previous to COVID-19, beginning in 2019 and ending in 2020. And the study did include San Jose as part of it. And what they found was that millions in our community, even those who are considered to be living above the poverty line, are struggling to meet ends meet. 40% of the households didn't have 3 months of savings going into COVID-19. Latinx and African Americans were disproportionately impacted. And I was talking to Nancy Klein earlier today, and 40% of people in the retail service industry have lost their jobs. And I think I'm adding all this because it just really shows the impact to a particular group of which many of these people live in our rental housing stock. As a background to the discussion, I also wanted to just remind you of what you've done with the eviction moratorium. The moratorium prevents eviction for all tenants living in San Jose who have been impacted financially by COVID-19. The ordinance provides protections for tenants living in all types of rental housing, including single-family homes, duplexes, condominiums, and apartment buildings. During the April 14th council meeting, the City Council provided direction to amend the eviction moratorium ordinance to include the following provisions: to 1, extend the period of tenant notification; 2, protect against harassment and retaliation; and 3, include a repayment period. The proposed amendments, which we were bringing for you for your consideration, were designed to address the City Council direction. Rachel Vanderveen will provide an overview of the proposed changes.
All right, thank you, Jackie. The following outlines the most significant amendments to the eviction moratorium. The first amendment is to extend the notification period from 3 to 7 days for a tenant to notify that their landlord that they have been impacted by COVID-19. Extending the notice period provides additional time for tenants to notify their landlord which is critical for many of our families who are monolingual and may not initially understand the notification requirements under the eviction moratorium. The second amendment is to include the anti-retaliation and harassment provision, which will help ensure that landlords serve eviction notices with good faith and not an attempt to influence an effective tenant to vacate their apartment through fraud, intimidation, or coercion. Additionally, the amendment clarifies that late fees, interest, and penalties may not be charged on unpaid rent amounts accrued during the eviction moratorium period. This amendment is recommended by staff after receiving several inquiries from residents regarding this issue. The Santa Clara County's eviction moratorium does not allow late fees or interest, so this provision clarifies that both the city and the county are consistent on this point. Finally, many other eviction moratoriums include a repayment period. While the San Jose eviction moratorium currently does not include this provision, the Santa Clara County eviction moratorium allows tenants an additional 120 days following the end of the moratorium for tenants to repay the rent accumulated during the eviction moratorium period. The City Council held a lengthy discussion about the proposed duration of both a moratorium on rent increases and the proposed repayment period. And after discussion, Council directed staff to use the date of December 31st for both the duration of the moratorium on rent increases and the repayment period for affected tenants. You can see that the eviction duration highlighted in the rust color on this chart. So what you can see is that there are three sets of legislation that impact residents in San Jose. We have the city, the county, and the state. All of the eviction moratoriums line up and are all ending on May 31st. The city is proposing in green a repayment period that will run until December 31st. And you can see in the green for the county, their repayment period runs for 120 days following the eviction moratorium. Right now, that will run through the end of September. If their eviction moratorium is extended, then that repayment period will also extend with that time period. And then finally in purple, you can see how the moratorium on rent increases, which was also recently passed by the City Council, runs through December 31st as well.
So while you did not provide us the direction to extend the moratorium, we did want to bring to your attention that this would be your last day to move forward an extension of the moratorium if you didn't want it to have a lapse. The eviction moratorium will expire on May 31st, consistent with the expiration date of both the state and county eviction moratoriums. Due to the upcoming Memorial Day holiday, today is the last regularly scheduled meeting for the City Council to extend the moratorium prior to its expiration. Last week, the Board of Supervisors met and decided to wait until May 26th, when they will be holding a special meeting to determine if they will extend the Santa Clara County eviction moratorium. The resolution prepared for your consideration today will extend the moratorium by an additional 30 days to June 30th, 2020. Since the moratorium was adopted on 3/17, the Housing Department has received 395 inquiries from tenants and 225 inquiries from landlords. Staff have fielded 875 questions with a breakdown of 563 phone calls and 312 emails. So we've been having ongoing conversations with both landlords and tenants regarding the eviction moratorium and have been responding diligently to their questions.
Now, as we were preparing for this extension and amendment to the eviction moratorium, staff took a long, hard look at our fee structure for the rent stabilization program for the coming year. We recognize that As many residents are unable to pay their rent, they are also leaving property owners with growing financial obligations. We wanted to carefully consider the proposed fee levels for the coming year. Over the last year, the rent stabilization program had several vacant positions, resulting in a fund balance for the fiscal year 1920. This fund balance may be used to provide a one-time reduction in fees for the program in the upcoming year. This reduction in fees will provide relief to all property owners and mobile homeowners covered by the multiple ordinances managed by our program. Utilizing the accumulated fund balances will allow the rent stabilization program fees to be reduced for the coming year from 17% for mobile homes to over 30% for apartments covered by the apartment rent ordinance and the tenant protection ordinance. Considering the economic hardships faced by the entire rental housing community, staff will bring this one-time action forward as part of the annual budget process. Additionally, staff's been working closely with our partners at the Santa Clara County Office of Mediation and Ombud Services to launch a new mediation program. This would be in addition to the current mediation and administrative hearing process that is provided by the rent stabilization program. The county pilot program seeks to facilitate repayment agreements between tenants and landlords that lay out repayment plan for the accrued rent during the eviction moratorium period. The program would be free and voluntary for both parties. Concurrently, the rent stabilization program will still hold its mediation program, which is available to tenants and owners covered by the apartment rent ordinance. This concludes our presentation, and we are available for any questions that you may have.
Thank you very much, Rachel, and thank you, Jackie. Before we go to the public, I just bring everyone's attention to a memorandum that I've submitted very belatedly, and I apologize for the very belated submission. The crux of it, I think, if you haven't had a chance to look at it online, is it would allow for a longer period of time for repayment of back rent. I think we all recognize that many tenants will not be able to pay the back rent in time. We appreciate talking and working with, as Nathan Hose on our team has been working with the Apartment Association to see if there are ways in which we can encourage workouts between tenants and landlords. We know many landlords have already proactively done that. We appreciate it very much. We also want to give tenants a chance to be able to get out from under all this. So this would essentially be a 6-month extension beyond December 31st, as long as at least half of the back rent could be paid by that date. So that is what is proposed in that additional memorandum. Let's go to the public now, and then we'll come back to the council. Robert Aguirre.
There we go. All right, Robert Aguirre. Again, I appreciate what you're saying about people that can't afford to pay this, and even if you extend the date to December, it's still going to be difficult, and many people will actually lose their place if the landlord decides to evict them if they can't make that payment by that time. I would recommend, and I know you probably can't do it today because you got to pass something. I would recommend 120 days for every 30 days of inability to pay the rent. And most of the people that I know of that are living in apartment complexes, the majority of people that live in that complex are paying the rent. It's only a few people that can't really afford it. And that may not be true in all cases, but it certainly has been my experience in going around to other apartment complexes. This is a recipe for disaster. No matter how you slice this cake, it's going to be terrible. And I think there has to be some way to try to put pressure on the federal government for more funds. Thank you.
Thank you, Robert. Anil Babar.
Can you hear me?
Yes, sir.
Okay. Good evening, Mayor and Council. Anil Babar with the California Apartment Association. I want to thank the Mayor for addressing the challenge facing tenants and rental housing providers. The California Apartment Association recognizes the importance of striking a balance between providing tenants sufficient time to meet their rent obligations while ensuring property owners can continue receiving their rental income that they need to pay for their expenses, maintenance, staff, and the financial obligations which they are still responsible for. Additionally, I'd like to express our concerns regarding the affidavit that was produced for those who can't provide documentation. We have concerns that we want to make sure that there are clear parameters on who can and cannot use it. How can we be sure that those who can provide documentation are not using it, and those that need the documentation are using it? So I want to urge you to support the mayor's memo, and thank you.
Thank you, sir, and thank you for your partnership. Catherine Hedges.
Good evening, Mayor and Council. PACT supports the provisions as presented by the Housing Department, and we are also very, very concerned that there's going to be a wave of evictions after the grace period for repayment ends, and anything that the city can do now or later to extend this or provide financial relief to tenants is going to be necessary if we don't want to have a complete disaster on our hands. Thank you very much.
Thank you. Julene Gomez. Welcome, Julene.
I'm so sorry. I would like the city attorney to address how in the ordinance the past due rent, if it is still past due at the end of the year, would be treated. I'm getting some legal advice that it will be converted to consumer debt, and unlawful detainer actions will no longer be available to a landlord as a remedy. This is extremely expensive for landlords to have to go through small claims court. I have one tenant in particular I know that will owe me over $12,000 worth of rent, and which would require me to spend thousands and thousands of dollars to reclaim this. And actually, I can't even do that in small claims court. So I would like that addressed. And to the extent that it's going to be consumer debt, you can expect that there will be a lawsuit by many landowners who simply can't deal with that. I have numerous other concerns, but that's probably my biggest concern. Thank you.
Thank you. Mr. Beekman.
Hello, can you hear me?
Yes, sir.
Thank you, Mayor. I had a planned speech. I'm going to kind of speak off the top of my head. I hope that this can go okay. I thank you very much, Mayor, for what you just talked about. You want to extend forgiveness periods for another 6 months. Into June 2021, that should allow time for state aid packages to come through. If everyone can look up what's going on at the state of California level right now, I think they would be incredibly impressed about, serious rent forgiveness that can happen for both owners and tenants, mortgage forgiveness for owners and tenant rent forgiveness for tenants. Robert Aguirre said a very nice thing. How do we wait for those packages? And my point is, how do we address ourselves? We're making steps, and how do we make the steps that this pandemic is not the fault of everyday people, and they should not at all have to be blamed in the next few years. And I hope we make the efforts towards really good practices that can allow us to forgive ourselves fully and not just halfway. And really take those steps, and want to take those steps, good steps together.
Thank you, Mr. Beekman. Michael Trujillo.
Good evening, Mayor and Council. My name is Michael Trujillo, and I'm an attorney at the Law Foundation of Silicon Valley. We'd like to thank City Council once again for its leadership in passing the COVID-19 eviction moratorium. The modifications proposed today provide critically needed additional protection for tenants, and we are grateful to Councilmember Carrasco for championing these important amendments. We'd also like to thank Mayor Liccardo for proposing an extension of the time that tenants will have to pay back rent unpaid during the moratorium. However, we have serious concerns about the memo as written because of the possibility for a voluntary agreement to apply in place of the extended repayment schedule, which defeats the purpose of this amendment. During the COVID-19 pandemic, we've already been seeing a lot of landlords pressure tenants, and particularly monolingual Spanish speakers, into aggressive repayment plans. So therefore, we urge council to approve the mayor's memo without section 2D or with an additional provision clarifying that any voluntary agreement cannot abridge a tenant's right to repayment period provided for in sections 2B and 2C of the memo. Thank you.
Thank you. Tessa?
Yes, hi, thank you. The issue that I'm having, because my husband and I are renting to a person who is almost homeless, and we extended our home to her pre-pandemic. And then the pandemic hit, and the issue is that having to follow the health and safety rules. So if the city decides to extend the moratorium, which puts a real hardship, not economic, but health and safety issues, because we are co-living. We are renting a room in our home on our property. And therefore, we are at risk in regards to the health issues of an essential worker. So the issue is not payment of the rent, because that is not her issue. She's an essential worker working. But her exposure is so high as an in-home supportive services. So we need that the ordinance, if you extend that and don't allow us eviction, then at least that we have protections that they must follow health and safety rules of living, co-living with us.
Thank you, Tessa. Mike Mattingly?
Yeah, so for us who are making 30% of what we were making, based on the actions of Santa Clara County and the state of California, extending these exemptions for rent are encouraged, but at the same time, people who have homes should be given money in order to exchange that, because they need to live too, and the banks are not going to be so forgiving unless you guys really put the hammer down. So please do that. And Vice Mayor, I challenge you to any kind of debate you want.
Okay, Bruce Roberts.
Oh, unmute. Can you hear me now?
Yes, sir.
Okay. We had a meeting with, a number of us had a meeting with Dave Cortese this afternoon. And what we got out of the meeting is we're just really in such an unusual situation that everyone is just trying to do their best to walk a dangerous route. I think Robert has a good idea. I have a problem with extending the notice for 7 days. I look at myself. I'm not sure 7 days would be enough. I think possibly maybe we ought to think of extending that notice to maybe 10 days. Thanks.
Thank you. Matthew. Matthew, are you able to?
Sorry about that. I am Matthew Reed from Silicon Valley at Home. We want to thank staff and actually the mayor for the additional memo. This is this is a really difficult time. Figuring out how to respond and resolve this issue without sort of tipping over the cliff is going to be an ongoing challenge. We want to reinforce the need for state and federal stimulus. This is going to go beyond the back rent. It's going to continue to be an issue going forward. Ideally, tenants, we're going to work with property owners to come up with good faith agreements on how to make this all work out. Unfortunately, we also appreciate staff's work at translating the direction from Councilmember Carrasco, and I think it reinforces the fact that this is a challenging environment. There's a lot of confusion and uncertainty about what the rules are and how they should be applied. And we're therefore concerned because we've talked with multiple community-facing organizations that at the margins of this right now, there's a lack of clarity and people are entering into an agreements that don't conform to either the intent or the rule of the eviction or moratorium or existing contract law. And we don't believe that good faith voluntary agreements need to be exempted from this ordinance. We know this is difficult, but we need to really look at the implications of some of the details. Thanks.
Thank you. Jeffrey Buchanan.
The Mayor and Council, good evening. Would like to support the staff recommendations and appreciate all the work to date. I really think as a city and certainly as a county, this issue around the tens of thousands of families who are going to be in a position of how are they going to pay back this back rent, and what, likely 12 months out, we will still be dealing with this virus, and what the implications for public health. So while I appreciate the spirit of the proposal from Mayor Liccardo, this is literally an 11th hour memo that we're discussing at 11 p.m. And it looks like the only author is a, industry association of landlords. So I hope that this isn't the final word on these issues. I think it's asking some of the right questions, but hope that we look to a wider set of possibilities, including our neighbors in Alameda County who've looked at a protection for eviction for this issue of not being able to pay back rent immediately. I think when you think about families making $50,000 a year, coming up even in a 12-month period with back rent is going to be exceedingly challenging. And so hope that we continue to look at this issue because it's bigger than.
Thank you, Mr. Buchanan.
Thank you.
And I'll just clarify about who the author of that was, because I've never had any industry or anyone outside my office write a memo for me. It was drafted by Nathan Ho in collaboration with the city attorney's office, and I revised it. All right, going back to the council. Council member Esparza.
Thank you, Mayor. I'll be quick. I actually wanted to get a little bit more detail on our enforcement mechanisms for this, because it's taking place in my district in terms of the harassment and retaliation. And so I wanted to know what the enforcement measure is and what proactive steps can we take in addressing this.
Question for housing staff, I believe.
Yes.
Okay, this is Rachel Vanderveen. So I can begin to address this. So the enforcement that we have, the first line of defense is really our legal system. So if someone is being harassed or retaliated against, they can claim protection in court against using this as their defense. So that's the first line of defense. I would say the second line to that is anyone who is experiencing these types of challenges can reach out to our offices. We will talk to them. We will take a look at what's happening, and we will do everything we can to educate all the parties involved just to help them understand what all these rules and regulations are. There's definitely we found there are people who don't even necessarily understand that there's an eviction moratorium in place and what it means to them. So we are actively working with all the parties every day to help them understand.
Okay, thank you. So I wanted to talk about, we've gotten some pushback. I think we've gotten to a point today where we have the mayor's memo, which has brought a lot of different groups, people together. But when we've heard from landlords, they've talked about the burden that they have to carry. And I think that there's some truth to that. And we haven't seen the kind of action on mortgage relief that we saw with TARP funds, for example, during the Great Recession. And so I wanted to ask a question before I got to my motion, which is, just over a month ago, Representative Omar introduced the Emergency Rent and Mortgage Cancellation Act, which would suspend rent, which would suspend rent and mortgage payments nationwide and provide a federal relief fund for landlords and mortgage holders. So my question is Lee still here?
No, council member, I don't think Lee's still on with us.
So I wanted to ask that we consider supporting this legislation as a city, because the bottom line is we do need federal action for mortgage relief, because there are just some economic realities that we're all trying to balance. And so having said that, I wanted to make a motion to move the mayor's memo, but I wanted to just make an edit given what we've heard from the Silicon Valley Law Foundation, as well as experiences in my own district with some large landlords that do own ARO units. And so I wanted to ask Rick, so we saw a couple of samples, but I would like to just actually move it forward with staff to figure out a way to look at item D on the mayor's memo so that we don't incentivize people to make agreements that do intimidate renters and get them to make agreements against their own rights and interests.
Well, council member, I think, this contemplates a voluntary agreement. There's a freedom of contract and two parties negotiating. I understand bargaining positions and leverage may be different. I guess we could always try to address something, similar to serving a notice, that requiring an agreement under duress or threat. But I think this was really intended to contemplate, purely a voluntary agreement that the parties agree to a different payment structure, and that takes them out from any ordinance requirements. So those are my thoughts.
Okay, yeah, I'm interested in, as this moves forward, that we just include something that keeps the spirit of it. We're not deviating from that at all, but has something along the lines as along the two suggestions here, any agreement by a tenant to waive their rights would not, could be void, right? Or we don't want people waiving their rights.
This is Jackie. I'm just wondering, we do something in Ellis where the landlord has to provide to the tenant their rights before they actually have a voluntary buyout. There's some sort of a notification that says, you have rights under this ordinance. And in this case, it could be something like you have rights that would allow a potential extension of repayment until blah, blah, blah. You are waiving those rights and entering this agreement, but you understand those rights exist.
That at least gets, make sure that they're informed of their rights.
Can I make a suggestion?
That would work.
Can I make a suggestion, Councilmember?
Sure.
Yeah, I'm very supportive of language like that would have to be perhaps in the agreement or presented to the tenant somehow. You probably need to remove the words "or previously have been reached," because obviously if this passes and an agreement was reached before this passes, then the tenant would not have knowledge of those rights. So probably need to modify 2D in that regard and include whatever additional language that Rick and Jackie would come up with.
That works for me.
Okay.
So I guess we have a motion.
Okay, is there a second?
Second.
Okay. Thank you. Anything more, Councilmember Esparza?
Nope, thank you.
Councilmember Foley?
Thank you. And Mayor, thank you for your memo. I think it's important to include an extended payback period for the rent forgiveness or the rent deferral. This is not rent forgiveness. This is rent that was deferred, that evictions couldn't occur during the moratorium period, which if we adopt this will be extended to June 30th. It's really, really important that we talk about the repayment of the deferred interest or deferred rent for landlords is deferred mortgage payments, because there are tenants, there's a couple of types of tenants out there, and I'm not going to put them all into two separate easy buckets, but one of them is a group of tenants who are working remotely from home and can pay their rents, but are choosing not to pay their rents. So they're the ones who may have the financial means to pay their deferred interest, and I'm not worried about them. The ones I'm worried about are those who cannot pay their rents, they've lost their job, they've been laid off, or their hours have been cut back substantially. And under the county's order, and even ours that extends it to the payback period to December 31st, that just isn't sustainable for most of the tenants out there. Of course, the property owners, the house providers want to get that back rent paid back, but the easiest way for them to get it is for it to be affordable for the tenant. So I really like the mayor's memo in that he offers a few options on how that deferred rent should be paid back or could be paid back. And actually the provision that is most important to me is 2D. So, and that is because the other provisions lock in a tenant to pay back a certain amount at a certain amount of time. The D offers total negotiations between the tenants and the landlords. And I hear that there are bad actor landlords out there. There are also bad actor tenants out there who may go through the whole 6 months, December 31st, don't pay any of the arrearages or the deferred rent, and then they take off owing the landlord whatever that deferred rent was or any rent that was due to the landlord. So, I want to balance that, and I want to balance good intent by allowing two willing people who have full knowledge and ability to negotiate the best payback terms for both of them. If it's a 12-month period, it's a 12-month period. And that makes more sense because it's not the financial burden that a 6-month period would be. So just for clarification, Councilmember Maya, sorry, it's late. Esparza, can you clarify what you intend in paragraph D?
So in paragraph D, the mayor gave a suggestion around removing language that said previously have been reached, and Jackie proposed including some language that the housing department uses for the Ellis Act, where the landlord would provide information to the tenants about their rights. Did I capture that correctly?
I believe so.
Okay, so you're not removing the paragraph, you're leaving it in there that it allows the ability of two interested parties to negotiate independently.
Correct.
Okay, then I can support that motion going forward. I think this is a good alternative to the original staff memo, because I really believe strongly we need a longer payback period than 6 months. It is not sustainable for tenants. It puts them in an unfair burden. And just briefly about mortgage relief and suspending mortgages. Lenders aren't suspending mortgages. They may be forbearing mortgages, but that means that the mortgage payments will be tacked on and paid at some point. And usually when there's a forbearance, it's paid all in one lump sum. There's not a negotiation where you're paying back the deferred mortgage payment over time. So we have to be really careful what position we take when it relates to mortgages, because it's the banks, it's private lenders, it's a lot of people who are benefiting or putting out that money and then expecting that to get those funds back. So it's not deferral, it's a forbearance that the payments will have to be paid back in full at one big lump sum typically. Just wanted to clarify that as it relates to mortgages, but I'm totally in support of the motion and the mayor's memo. Thank you.
Thank you, Councilmember Perales.
Thank you, Mayor. In fact, my concern was around this item as well, and I believe this current language in motion may address my concerns. I was worried having and felt pressured potentially, and so if we can resolve that with having some education tied to it, some disclaimers that we think will actually make a difference and not necessarily just accept prior contracts that have been made and be able to make this a little bit more I think protective for the tenants moving forward, at the same time allowing for some honest negotiation to occur between landlords and tenants. And I can support this motion. Thanks.
I'm sorry, Councilmember Kim is having a problem with my mute button.
No problem. That usually happens to me. I am concerned about all the uncertainty and all the grievances that may come out on repayment and all the burdens that are being accumulated here by both the tenants and the owners. Every time we do an extension, I'm afraid that that as Councilmember Foley alluded to, that there's bad actors on both sides, and I can't imagine if a tenant actually skips out on paying payments and then at the end that they never pay back the payment that they owed for their rent. I want to ask staff if they heard about the city ordinance in Glendale that was passed, where where if a tenant has income that they should be paying it towards the rent if they're working and to work to supplement their monthly additional income later on.
Yes, council member, we did, we took a look at the Glendale ordinance. That was one of the things we reviewed this past week. And so we did take a look at the provisions in that ordinance, and actually it was kind of helped us think through the proposals with the mayor's office that were presented in his memo today. So yeah, it was actually very helpful to see what they had done there.
Yeah, no, I appreciate the mayor's memo as well. I just don't, we've done so much for our renters, and I think it's important that we have. But if I think somebody said, who one of the commenters said, hey, what if somebody owes me $12,000? What am I going to do? What avenues do owners have to claim these larger sums? At the end of a 3 months moratorium and what have you.
So under the eviction moratorium, essentially owners can do a couple of different things. They can begin negotiating repayment plans, which we definitely encourage and has been discussed tonight. We are absolutely encouraging people to talk to each other, because many times there is a way to pay some portion of the rent, maybe not the full $12,000 in the beginning, but there's hopefully there is some way to pay a portion of the rent that is due. So we're encouraging people to work together to find different solutions on how to begin repayment. And under this proposal, what would happen is within a 6-month period, half of whatever amount is due will need to be paid, and by the end of the 12 months, then the full amount will be repaid. If after that period of time the rent is still not paid, then the landlord may proceed with eviction. And yes, and in the meantime, they can always pursue collection of the rent that is due to them through small claims court. That is something they can do.
And how are we informing owners of properties and rental properties about their options?
So we have been working on all kinds of outreach campaigns. We have done mailers. We've done social media updates. We've worked with our website. We have had several different avenues on how to get the word out. And again, we are just working with people one-on-one, because a lot of times each situation is just a little different. And so it really helps to have people reach out, contact, email us, call us, and we ask questions. Where's the property? Is it covered by, we have to determine what ordinances are cover that property, what are the unique circumstances, and how can we help them find a resolution to the challenges they're facing.
Yeah, well, I certainly hope that all of us can survive this economic uncertainty here. I wanted to ask you if you've heard, or have we taken a position or on that Senate Bill 1410, which provides 80% of the landlord's rent in exchange for a 20% reduction in overall rent as long as the voucher program lasts. Have you heard of that bill?
Yes, we have heard of that bill. That is one of the bills that our team is actively tracking, and we are, watching it kind of go through the process. And we're working with the city manager's office also in just tracking that bill very closely.
Okay, can I add to the motion? I may not be part of the memo here, but can I add to the motion's support for that bill? Rick, that's more of a question for you.
Yeah.
I think you can direct staff to come back with not take a specific position tonight, but direct staff to come back with a recommendation on the position. It'll have to be a separate agendized item at a future date, but you can direct staff to bring it back.
Okay, would you, I don't know who made the motion. Was it Councilmember Esparza?
Yes, I made the motion. So I would accept information on that bill in addition to Representative Omar's bill to come back, and any other legislation that we feel is going to address this issue, so that the council can review it and discuss it.
Thank you.
Thank you. Councilmember Carrasco.
Thank you. I know that it's getting late, so I'm going to make it quick, because I think that the issues that I have of concern have been addressed, and I thank you, Councilmember Esparza, for pointing them out, and thank you, Mayor, for extending that that period of time for repayment. I don't think that there are any easy answers to the situation that we're currently facing. I just want to share just a couple of thoughts very, very quickly. I've been doing some live chats since the pandemic started, actually since we started sheltering in place. And one of the biggest issues and the primary issues that we are hearing from residents, and these are residents from all over the city of San Jose, not just District 5, these are residents from District 9, District 6, really from all over the city. And it's food, and shelter. And even after we put in place the moratorium on evictions, our residents are being harassed by landlords. And so I agree that there are great individuals out there who are great tenants, and there are great landlords, people who are working together, recognizing that we're facing one of the biggest crises that we've ever seen. But there are individuals out there who are lacking understanding and empathy, and putting these ordinances in place is critical in making sure that we have stability and we have an ability to keep people sheltered. The only thing that I want to really ask staff, though, is, even after the ordinance goes into place, Jackie or Rachel, uh, making sure that we make it very, very clear and immediately clear, abundantly clear to both landlords and tenants, are their rights as tenants and as landlords, what their rights are, and what their what kind of ramifications, or where they can turn to enforce their rights. I think is going to be a really a way of protecting both parties, and they're just not getting the word. So I don't know if you want to address that.
Yeah, so thank you. We could use your help in ensuring we're getting into these groups that you feel are not accessing the current information we have. But I think this whole idea of rights and responsibilities for both parties would be very helpful, and we can certainly work on that. And we know immediately after this passage, we have a lot more education to do because we know from hearing from tenants and landlords, there is confusion about what applies. So we are absolutely committed to continuing our efforts to educate, and any help that you all can provide in getting that word out, we gladly accept and will use.
Okay. Well, okay. Thank you for that. And it is confusing. I get it. And it's a very stressful time. So sometimes the stress itself, being under duress, fogs our brains in terms of trying to understand things. And so I get that as well. Maybe if you can draft up clear messages, clear talking points that we can put out there, that would be helpful for us as well once tonight is over and done with. So that we can put it out for our community members in the different languages that we need to use in order to get the message across. So with that, thank you so much, and thank you for all of your work in getting this across the finish line.
Thank you. Councilmember Lund, yep.
Yes, sir. All right. Well, I just want to say that I support the motion on the floor. I appreciate the mayor's efforts in allowing for more time for payment of rent. I know that is certainly a problem, and I hear advocates and renters and tenants and everyone talking about this issue, and it is certainly a very real issue. It is one, unfortunately, I think beyond the scope of a city or even a state to resolve completely. When we are the entities that have to balance our budgets based on our expected income. So forgiveness means paying, somebody gets paid, and the only entity that I could think of that can print money is the federal government. So, eventually it has to have a larger solution. But in the meantime, what we're doing is buying more time and allowing the process to work itself out. And I very much appreciate that. And also Councilmember Esparza for raising the issues about limited English proficient speakers or people who are, for better or worse, tricked or enter agreements that are not, when they're not completely aware of their rights. And that is something that happens quite a lot, and we should endeavor to stop that predatory behavior. I want to point out, in addition to the language that Councilmember Esparza solicited from Jackie with the Ellis and all that, it exists already. I think California Business Code or Civil Code 1632 is something that I refer to a lot. It's not well known, I think. It's already in the law that when you're doing business and you provide a contract to somebody, especially a monolingual English speaker, specifically Chinese, Spanish, Tagalog, Vietnamese, or Korean in the state of California, if they're limited English proficient, you have to provide the contract in their native language, or else the contract is void. So that is, a built-in protection we have. I don't know if we want to reference that or how it helps us, but certainly if there are monolingual English speakers of Spanish, Chinese, Filipino, Vietnamese, or Korean descent who agree to something and they didn't quite understand the term because they weren't provided a written contract in their native language, those agreements, in my opinion, are null and void. And I think the state of California would back me up on that. So we have that at our disposal as well. I will support the motion and thank you.
Thank you. I just wanted to thank, again, Nathan Ho on my team who worked hard with Rachel in the Housing Department and Chris Alexander in the City Attorney's Office on this proposal. I appreciate that, and I appreciate my colleagues' support. Okay, anything more before we vote? All right, Tony?
Jimenez,
Yes.
Peralez,
Aye.
Diep,
Aye.
Crosco,
Yes.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Yes.
Jones,
Aye.
Licardo.
Aye.
Thank you.
Okay, for the final 15 minutes, we have 8.4, amendment to the apartment rent ordinance to allow a temporary reduction of rent due to the pandemic. And there's no presentation, is that right, Rachel? Okay. All right, so it's just up to us.
Motion to approve?
Second.
Motion from Councilmember Camus. We're going to go to the public first. I have Robert Aguirre.
Yes, thank you for bringing this forward, because I think this is one of the things that's going to help people that are having trouble already paying the rent. If you temporarily reduce the amount of rent they owe, they're more likely to make the rent payment. And this might be a good way for landlords to be able to negotiate with their tenants to be able to be sure that they will pay the rent when it's due at the end of the extended period in December. This is certainly a much better proposition than just trying to pile on more and more debt onto people that are already facing severe difficulty in just surviving. And we have enough unhoused people as it is. We don't need to add to that. And I have a feeling that the number of people becoming unhoused is going to go through the roof. And anything you can do to stop that from happening is okay in my book. Thank you.
It's basically free money. It's an easy way to earn cash back on the stuff I'm already buying.
Catherine Hedges.
Thank you, Mayor and Council. Yes, I'm very glad that this is being proposed, because landlords shouldn't be penalized if they try to do the right thing by agreeing to lower rent temporarily. And anything that makes it easier for landlords and tenants to reach an agreement is a win-win situation. Thank you very much.
Thank you, Catherine. Okay, we're returning now to the council. There is a motion, and council members like to speak. All right, then we'll get a vote. Tony?
Jimenez,
Yes.
Peralez,
Aye.
Diep,
Aye.
Crosco,
Aye.
Davis,
Aye.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Aye.
Jones,
Aye.
Licardo.
Aye.
Thank you.
Okay, well, I see I was wrong in predicting that we'd go until midnight. We've only gone till 11:48. And Blair Beekman, you're our last speaker.
Hi, can you hear me?
Yes, sir.
Thank you. My public comment, open forum. My public comments have continually offered I do not like our better human ideals being held hostage by this pandemic at this time. But in the efforts to try to uphold traditional economic and business practices, we can become confined by its rules and logic that can often become inhuman, hurtful, and simply impractical. So I find it important to address human needs at this time in short-term creative ways that can alleviate human pain. As large portions of this country and this earth are victims with no initial voice in this pandemic and its planning, I feel that over the next few years, emergency needs can be met. Let's keep channels of good communication open so people don't get hurt or have to jump through hoops they don't have to. To ask again, I hope both council and community will consider both all at once replanting and phase-in replanting for the new trees in the downtown Post Street alleyway if that was to take place. Thank you.
Thank you, Mr. Beekman. Catherine Hedges.
Hi, good evening. I am very concerned about the city housing. Partly city housing I live in. They've discontinued the security guards. All of the crime is just completely running rampant. All of their employees work off-site except the maintenance guy, bless his heart. He just got flooded after the second fire since shelter in place started, and we're pretty sure the first one was a meth lab. I don't think the city intended for the taxpayers to be spending money on a drug house, but that's what they got. What is going to happen? Is anybody going to pay attention to the problems here? Thank you.
Thank you. Robert Aguirre.
Yeah, Robert Gary. I think, and I brought this before the council before, and I'm going to continue doing so. We need some representation of unhoused people on the council somehow. I mean, maybe not a council position, but some sort of advisory position, because many decisions are being made that affect the people that are not being represented. They don't have much of a voice. I try to bring that voice to council, but I'm just one of a few people that are speaking on their behalf, and they don't have any sort of strong coalition of people that can come in force, and they obviously can't make it all the time. They come from all different parts of the city, and they can't traverse that long distance and stay out that late, like right now, and then they'd have to get back and try and find a place to stay and shelter for the night. So again, I plead that the council consider creating either an ad hoc committee or something where there's a representative of the unhoused community. Thank you.
Thank you, sir. And finally, Tessa.
Thank you, Mayor Liccardo. Well, I was just going to say that, like we've been saying before, that we need to have our public comment in the beginning of the meeting. So that's some issue that really needs to be addressed to really encourage democratic participation. And though it's a little easier on Zoom, I think we need to keep doing things digital. I think that would be beneficial, because I was able to do a lot of good things and stay up till midnight. So there was that issue. So if we keep it going on Zoom, our public meetings, I think then at least then maybe that will make it easier to stay up to midnight to make our public comments. But ideally, it should be in the beginning of the meeting, because it is we, the people, that we are supposed to be setting the agenda. And so that needs to be something that we need to change, and that we have our public comments in the beginning of the meeting. That really helps. As we've seen on BTA, we have a lot more participation because we know we can come in and make comments.
Thank you. I spoke too soon. Mike Mattingly on the phone.
All right. Yeah. So I second what the lady before me said. I heard a lot of talk. I heard a lot of not able to get in to comment, even though I was sticking the *9. And to the vice mayor, my rights don't end where your fear begins. You said the numbers are so low because of the success of all the orders that have been put in. That may be, I guess we'll never know. But if we are having huge success, then why would we add more restraints? I don't think about me. I think about we. We've been duped by turds like you, Jones, Gates, John Hopkins, and Bloomberg. Ignorance root is ignore. If you choose to ignore what is easily available information, you choose to live in ignorance. It's a social norm in China to wear a mask because they have social scores. You can't ride on the bus if you don't.
Thank you. All right, the meeting is now adjourned. You all have 6 minutes of your life back. Have a good night and please stay healthy.